entire body was injured, and the brain's part of that body, an important part. But man, if you're carrying a little too much weight, or you're not sleeping well, or your bowels don't move well, or you're not taking the appropriate nutrition, or you're eating like most Americans, if McDonald's is like your home cooking, all right, then you're not going to do well. If you don't feel comfortable practicing some relaxation strategies, whether it's mindfulness or plenty others, if you don't feel in touch with how your body's doing, if you think taking a pill every time you have a headache or you don't sleep well is the answer, you're not going to do well. Some of those interventions, pills, are maybe appropriate in the first week or so. But after that, we have to figure out how to get them off some of the medicines, not on them, all right? And again, the problem with what I just said, it's 100% accurate, and it's written unbelievably well in this book, all right? Trust me, you ain't gonna buy it. All right, unbelievably well in this book is that it's not very sexy to tell someone, take care of yourself. You've got an injury that's complicated. Looks like you've got some traumatic stress disorder. You've got some problems with some headaches. You're having a hard time finding a job. Your loved one is alienated. You know, I just watched the Sniper movie on the plane coming over here. Pretty cool, pretty close. You're out of your environment, all right? And you got to kind of get back to being a regular functioning human being. Get back into your place in society. That's all right. Any of you could say that. You don't need the stuff that I do to have said that. I think I said it very articulately, but you don't have to kind of do all that, all right? There's no pizzazz in what I'm saying, all right? And so people don't do it. People want to get transcranial magnetic stimulation. They want to get a shot. They want to be inside a chamber or vibrated or something like that, all right? And so it's hard to get people to engage in just overall wellness, all right? And that's one of the challenges. Now, in order to try to combat that, we started a pilot program of integrated medicine at a number of the polytrauma centers. And actually, my co-author in this is one of our health coaches who's got specialized training in movement therapy as well as relaxation. And big surprise, they did better. They did better even in these special brain injury centers if they had this integrative medicine. And in a nutshell, integrative medicine means instead of calling relaxation therapy, acupuncture, mindfulness, yoga, instead of calling that alternative medicine and saving it for the people that haven't done great with Botox and pills, all right, and calling this something weird, calling this is mainstream, this is the U.S., this must be the right way. This is the East. It's a little weird, all right? Instead of doing that, say we're going to bring it together and figure out this is our entire palette, and for my painting to look good, I'm going to use the right type of paint from each of these as one. Every color is equal. Right? That doesn't mean it doesn't mean we're just burning incense and singing hey la li la. We're combining everything, and we're doing it with clinicians that appreciate that everything may be an answer at the right time, or nothing maybe. Overtreating people is maybe just as bad. When we did that, headaches got better quicker, sleep got better quicker, people got out of the programs more quickly. So integrative medicine, used to be called holistic, used to be called other things, is just saying we better get the whole palette. And the biggest part of the palette is the brush, is the person or persons delivering it. And so if you're kind of brusque with your patients, or you kind of have heard this 1,000 times, and you're not open to their suggestion, you're not willing to practice mindfulness with your patients, or you're not in good shape, all right, and you're not, you're practicing what you're preaching, the painting ain't going to come out so good, right? It doesn't mean that some of the high technology stuff used early on, and for those cases that may have some unusual secondary difficulties, may not be appropriate. You may need to revisit it for a person's having symptoms that just aren't responding even to this integrative program. But let's not lead with that. Don't lead with the image or the high-tech technology. Lead with this fantastic book, which I'll sign. Lead with normalizing people, getting them back to their lives, getting them out of institutions. And institution means a clinic. It doesn't mean, the monkey house. It means just get them back to their life. Get them back to working, being a husband, going to church, all right, a volunteer, whatever it is, getting back to the military. Certainly return them to work. And I think we were saying 2 days ago at a meeting that return to work interventions, vocational rehabilitation, specifically supported employment, well studied in many populations, in the world of mental health, as well as in spinal cord injury, and now increasingly in traumatic brain injury. Supported employment, simple, have a relatively unskilled, but they're wonderfully brilliant people, unskilled person, bachelor's trained, work with a person specifically in obtaining a job, shaping them for the job, works wonderfully. 1 to 11 ratio, every dollar you put in, you get $11 back in wages or in saved medical costs. Get people back to their role, all right? Even when they're not perfect. I'm far from perfect, and I do my job pretty well, all right? Perfection's overrated once you reach a certain age. And after you've had certain injuries, you may never get back to perfect. Or you may not even remember what perfect is, all right? Or you may have problems. And I'm not diminishing. The VA will give you this care for free. You'll get a check if you have these difficulties, whatever it is. But let's get back to activity. Because coming to see me for 2 years is a complete waste of time. Really. I'm fun to be with in the clinic. People feel better afterwards. I tell them brilliant things. It hasn't helped anybody after like 6 months. I don't even want to see them. I mean, I like them. It's nice and stuff. Makes me look like I'm an important person. But really, get out of the hospital. All right? Get out of the doctor role. At some point, you got to say, you know what? I'm going to have your primary care take care of you to make sure you're staying well overall. Here are the things to work with. You know, if you ever want to come back and see me, I'm always there. But really, you've learned as much as I know. And I'll give you a copy of the book for free. All right? I'm kidding. There's a lot of books like this. This one, yeah. Oh, signed. That's a given. No, it's a given. All right. I mentioned this already. You know, they're very similar, combat and sports. All right. There's some little differences here, but very, very similar in civilian as well. I'm not going to belabor that. I'm going to get to the good stuff. Motor vehicle collisions, very similar as well, stress-related. Certainly, combat injuries have more acute stress issues. And you know, one of the challenges is if you got a brain that's not working perfectly well before a concussion, all right? Just like if you have a back that's not perfect and then you're in a car accident, you have a higher risk of having a back problem, particularly a long-term one. If you've got a brain that's anxious because it's in a war zone, that's in a body that hasn't been sleeping well because it's on a cot, that's eating some of the rations that may be not perfectly healthy, that's not, and then you're in a setting that doesn't allow you to be physically active, may not allow you to imbibe if you like to do that lightly. You may have diminished sexual activity because you're in your camp. You get all these reasons. Your brain's a little bit inflamed. It's not happy. It's stressed. All right? Then you have a concussion on top of a brain that's not functioning normally. All right? Even if you didn't have the concussion and you just developed stress because you're in the stress zone, or your buddy died, or you're in a near-death experience, just that alone will cause changes on some of the testing we do in brain injury for the first 3 months once you come back. So your brain is getting fried in the military setting. All right? And what does that mean? We shouldn't have wars. That would be one approach. That's Dave's approach. All right? The other approach is be aware of that. And just like in the sniper, when they come back, expect a period of up to 3 months of transition. But the point of this was, what if you have a brain like that and then it gets concussed, it gets shaken around? You're likely to have worse problems. So we don't typically we all have stress in our lives, but the stress that we have in America isn't quite the same one as when you're in combat. Neuroimaging, amazingly expensive, amazingly cool, high tech. There really is no good neuroimaging for concussion. And we're studying it all. All right, diffusion tensor imaging, who cares? DTI, which is a type of MRI scan, is current gold standard. It's okay. It's as sensitive as it gets. The cool hair thing there, high definition fiber tracking, which actually tracks individual axons, white matter, is cool as heck, has no clinical utility yet. Nothing. It may eventually pan out. I don't think so, but we're studying it, whatever. You know, a SPECT scan, which is something that looks at the metabolic activity of the brain, people advocate, has no value whatsoever. So if in doubt, don't ask about scans. The answer is it's not really very useful. It's used when the person doesn't get well to rule out other unusual conditions. All right? But it's not very useful. There's a list, and I think you can go online or even get copies of this, or you may have it. Diffusion tensor imaging is the gold standard. All right? It can show little areas of problems with the axons where the injury is, but nobody in this room needs an X-ray to diagnose this. You know how you diagnose it? You ask the patient. Tell me what happened. All right. Now, the reason they come up with these scans is obviously to make money, but also is because they want to say, well, what if it's 6 months later? how the patient can't remember that. Let me use a scan. Can't use it that way. That is the goal, but really, when it lights up, the patient can typically remember what problems they had. There are some other ones that we used beforehand. This is the cool fiber tracking, really cool. I have a picture of it on my wall, but no utility whatsoever now. PET scans, which similar to SPECT scans, measure flow of blood or how well certain glucose is being used, or, as we're going to transition now, look at how some breakdown products that are in the brain, all right, amyloid or tau, which are breakdown products, which show damage, can allow us to maybe track that, all right? Very sexy, a lot of potential. Snake oil right now. All right, UCLA 3 weeks ago got an injunction to stop claiming that they could predict who is going to get dementia from whether it's concussions or otherwise. They were using this technology. They had a football player, Tony Dorsett from the Cowboys, who they scanned and said, Tony, you have all this problem on your PET scan. You're going to get dementia. They were making it up. He had the findings, but I might have those findings right now. All right, it's dynamic. And I may or may not develop dementia. All right, so no utility. But again, research. All right, another area, biomarkers. You draw blood, you get saliva. If it were more severe injury, you get cerebral spinal, all right? And you look at it some way and try to recreate that graph, the David Hovde graph, and find out, did this person have an injury, both right away as well as 6 months later, all right? Probably $100 million has been spent researching this. Right now, if, God forbid, I fell down on the way out and slipped and hit my skull, and a little piece of my brain came out, I would autograph it, but a little piece of my brain came out, all right? There is not a biomarker that they have that could tell me I had a brain injury. That's the technology right now. That's honest. That's not, that's not even over the top, all right? It is over the top, but we don't have we're not good enough yet to diagnose that. And because they couldn't find anything in the last 10 years, they couldn't find anything in severe injuries. So they said, you know what? We've been looking at the wrong disease. Let's look at the more mild injuries, because that'll be much easier to figure out, right? No. That's what they're doing because that's where the money is, but they haven't figured that out. Here's a list of the most commonly used one. I made it small because they're useless. We're studying them all, and yes, there's promising stuff, and it's exciting, but no, nothing. And again, we can't diagnose it when it just occurs. How are we going to do it 6 months or a year later, or 10 years later, which is the type of people we're seeing now in our clinics? People who were missed or didn't report it, or even people from Vietnam. That's a long way. All right, so finishing. Do TBIs predispose for late life degeneration? That's one of the myths. Yes, they do. Yes, they do. All right? Specifically, moderate to severe ones. So if you have a severe brain injury, let's say I have a period of coma for 24 hours, which is the definition of that. You're unconscious 24 hours. You have a slightly increased risk in certain subpopulations, particularly those that have a genetic predisposition. It's not very high. I don't care about, I don't emphasize it to the patients. I say, you have a high risk for everything. It's slightly increased. There's nothing different you can do about it other than the wellness thing I was talking about before, so who cares? But that's not the question we're asking today, is do concussions lead to it, all right? And the term for concussion-related dementia is chronic traumatic encephalopathy, or CTE. And I said earlier in my talk that there were about 90 cases in the history of man and women that have been reported. All right, 90. And there's been 50 million, give or take, of concussion in the last 20 years. So, it's my bread and butter, so it's a big deal, but it's not really that big of a deal, all right? And so, yes, you can have a higher risk. In concussions, there's a subgroup of people that get concussions for a living. I think you're into mixed martial arts, is that right? You are in a subgroup, if you do it enough, that's at risk for dementia. Love you, but just telling you that, all right? So it's time to stop. No. It was funny, about 2 years ago, 3 years ago, there's a magazine, journal that comes out every month or so in the VA. I think it was in the military one. I forget what it's called. Someone may know what it's called. But they had featured on it this buff kind of guy who was like the best mixed martial art guy, in the military. And on the same cover, it was like talking about dementia and concussions. I'm like, really? Did you think about this and stuff? And they later apologized for it, all right? But people that get thousands of concussions in their lifetime will definitely have a significantly higher risk of dementia. You don't need to give me $62 million to study that, all right? It's common sense. Your brain can't be injured thousands of times. All right, now, it's not 100% risk. That's what we're trying to figure out. What is the percentage? There haven't been that many NFL players that have seen it, that have gotten it, but we're seeing increasingly more. And has anybody here ever met a retired or older boxer, like who's had a long career? They got a really high risk of dementia. And it's not just because they get thousands. Sorry? Well, yes. Well, although Muhammad Ali has got Parkinson's related to it, but certainly he could be classified as that. And Parkinson's disease is increased with enough of these. But importantly, boxers usually get more than just concussions. If you ever watch boxing, they're out for a long time. Their thinking skills are altered for days. So they're having moderate traumatic brain injuries. And that's why we see so many deaths in boxing, because they're actually bleeding and it's not always diagnosed. Now it's much higher. MMA, same thing. Nothing, I love you, babe. But there's a high risk for that, all right? So, yeah, we don't know what the threshold is. We don't know how many years you got to play. We're trying to figure all that out. But the risk is there. And that's the research we're studying. So again, it's 3,000 to 8,000. And if you read the book, League of Denial, describes it very nicely, all right? And the League of Denial is full of the researchers that I'm doing research with. I've talked to them all. They're like, oh, yeah, these guys are getting hammered, all right? I've had 6. And the highest I've seen in the war is 151. The average person who's had a concussion from the Iraq and Afghan wars has had 4. All right, 4. I don't think that's a high enough risk. But I don't know. We're studying it. We've got thousands of folks we're studying. There's fairly well thought out hypotheses as to what occurs. And in a very simple form, there's a couple slides I'm going to skip over because I want to make sure we finish, certainly on time, if not early, is when you get a concussion or any type of brain injury, or just as if I bang my arm or get a broken bone, there's some cell death. There's some cell injury. And the body responds to that injury. It responds by cleaning it up. Sometimes it makes it worse if it overcleans it up, but usually it makes it better. All right? And it brings away that nasty schmutz and processes it, and the body then grows back, or it scars over and the rest of the organ takes over. Whether that's your liver, your brain, your kidney, whatever's your skin, all right? Well, one of the most common byproducts that occurs when there's an injury to the brain, 2 of them are beta amyloid. It's a protein that we make, particularly in response to injury or inflammation. And the other one, which is big in this area, is tau protein. All right? It's just something in our body, all right? If you get a brain injury, you're going to have an increased tau acutely. All right? We haven't found the exact amount. We don't have a blood test that can find that. Probably if we drilled into their head and pulled out some fluid, we'd see some. Or and cut a little piece of brain out, but they would be upset. All right? So we don't know that exact amount, but that's just what happens. Just like if you drink too much, your liver the next day is working really hard, and there's some junk in that liver. Your liver's really good at recovering, but if you do it enough, you get cirrhosis. All right? Your lungs, if you smoke, God forbid. All right? The next day, or the next minute, your lung is full of cells that are trying to clean up that carbon and the other junk in there. All right, and if you stop smoking, eventually most of that carbon goes away. All right, same thing with the liver. If you do it early enough. Well, in the brain, tau is that problem, but it turns over. It's dynamic, so we don't know how much is too much. We don't know where in the brain is the bad place. We don't know, as I said, how many injuries that occur. But that's the thought. If you get enough of an injury, either one massive injury or multiple little ones, your body can't keep up with cleaning the junk out. And when you get too much junk, all right, in your trunk, too much junk, you end up getting problems with your brain. You get dementias, or you get Parkinson's disease, secondary Parkinson's disease, as seen with Muhammad Ali. All right, but we don't know enough about when, why. Why do some people get 5,000 injuries and don't ever have a problem? We may not be testing them well, but why not? Whereas others do. Do they have a genetic profile? All right, most people don't have a genetic profile that we've found. There is one, and those people have a higher risk, but it's a small percentage. So we're studying this. It's increasingly being clarified. Tau-related dementia, or CTE, from multiple concussions, used to be called dementia pugilistica, or dementia or thinking problems related to fighting. All right, it was boxing originally. Boxers were demented like crazy. All right, and this was written in the 20s. It's like, we knew in the 20s this couldn't be good for you. Probably knew before that, right? All right, but now, these people look different than those that get stroke-related dementias, that get alcohol-related encephalopathy dementias, that get the idiopathic or unknown reason dementias that we call Alzheimer's disease, and there's different forms of that. They don't look, these things, and there's frontal temporal dementias, we come up with different names because these things look differently. All right, in CTE, chronic traumatic encephalopathy, they look different than your stroke dementia or your Alzheimer's dementia. They tend to have more behavioral dysfunction. They tend to have some psychological issues. They have some a lot of anger, irritability, less of the memory stuff at first, but that does happen over time. But it's a small number of people we've seen this in. So it's probably too early to characterize it that well. But it's probably a unique type. It certainly is going to occur in people that get either a lot of concussions that don't heal in between, or that have some predisposing factor. But what I certainly can tell you is if you've had a high-risk number of concussions and you used alcohol after that, and you didn't take care of your heart by eating a heart-healthy diet, and you didn't exercise, and you didn't sleep well, you're going to have a much higher risk of getting dementia. So I can't stop the 5,000 other than tell you to stop playing football, or don't go to war, which it's not up to me to say that, all right? But I can tell you, you know what? Your brain has been pretty trashed, and you better start taking care of yourself. Now, the highest risk position in the NFL or NCAA for dementia is what? What would you guess? For getting dementia from NFL? Quarterback, running back, lineman. These massive guys who every play, it's like those sea elephants. Boom! It's like the bighorn sheep every play. All right, and they're getting a lot of velocity. I mean, I can't run as fast, and these guys are 3 bills. All right, they're nailing each other. And you know what? They also don't eat so good. I don't know if you've seen them without clothes on. I haven't seen many, but and afterwards, most of them don't thin down that well. Howie Long's an exception. He was never big, but most of them start big. They've got problems with blood pressure, cholesterol, exercise after they have their injuries. All right, and get this: some people who are in the NFL or other sports, they have some anger issues before they started playing. Certainly, they're taught that after. It's true of the military as well. Not criticizing, but that's a condition that's going to increase your risk for injury as well. And when you're angry, you tend to drive a little faster, you tend to get into fights, so they have a lot of injuries afterwards. The hardest thing I had in my hyperbaric oxygen treatment studies is preventing the guys from fighting in the study. Because they were on military base. I had to have den mothers watching these guys. Because they wanted to go drinking, which we said, you can't be drinking during the study, dude. Give me some love here, And you can't fight during the 8 weeks. You're there, you can't beat each other up, all right? And people do this on military bases. I've slept on military bases. I've never actually gone to the bars and stuff like that, but apparently it's a violent, in a healthy, generous, manly kind of way, kind of setting, all right? So, people who get concussions need to take care of themselves. It'd be good to prevent the concussion, and we're trying to come up with rules. And if we had a helmet that was like really big and fluffy, like it was inflated and they kind of bounced off each other, like the sumo thing, the sumo wrestler kind of game people play, they do better, because there'd be less acceleration, not a choice just yet, all right? So we got to figure out how to get their brains and bodies in good shape at the time of the injury, which their athletes are trying to do. But then the risk period for the CTE is 5 to 20 years after you get enough, after you've reached threshold. So during that period of time, maybe if we can intervene and get them healthier, all right, then we'd have a lower risk of dementia as well. So that's kind of my take on this. Either got to prevent these things, you got to prepare their brains before they go into battle or football or car accident to be healthy, and that means keep their bodies healthy, but also help them work on their mind if they're having stress issues or medical issues. When it occurs, we want to rapidly intervene with them in a holistic, integrative way, but give them education. The small percentage that continue to have problems, give them more intensive services. But then after that, let's say they're healed or not healed, they need to get back into wellness. All right? And if you don't do that, you're not really doing anything to help these people. Getting x-rays every couple years or like sending them to get them cognitive rehab again, all right, is not going to have an effect. Cognitively based services work for up to 18 months after a concussion. It does matter, but we don't know the difference between a psychologist doing it, an occupational therapist, and a speech and language pathologist, but certainly works. It also works for dementias. Here's kind of a summary statement that I just kind of made. But in terms of, there are increased risks. You got to have a lot of them, unless it's a severe one. I've emphasized it a couple of times, but we need that period of recovery in between. Because if you cut your arm repeatedly, like if you're a cutter, all right, that's a weird thing. But if you cut your arm for whatever reason repeatedly, and you don't let it heal in between each cut, man, you got nasty scars. If you cut your arm and let it heal, and then accidentally cut your arm 6 months later, you don't usually have as big of a scar, assuming the same size injury each time. But if you keep cutting open the scar, it doesn't do well. That's what we're talking about. And probably 4 weeks is the minimum period of time. Never going to happen. This is a wonderful country we live in. We like to fight and play rough sports. So we need to kind of figure out something in between that. This is kind of a PET scanning as well as some MRIs that are indicating there may be some of this tau deposition, all right, in individuals who are at higher risk, not well refined. So I'm going to finish with the studies we're doing. Obama came out in 2000, I guess it was 11, with the National Research Action Plan for Behavioral Sciences and TBI. In it, he said, let's throw a lot of money at CFU, and let's better understand this. Let's throw a lot of money in San Antonio and understand PTSD. So all of these organizations have gotten together under VCU and the Richmond VA and have developed a comprehensive plan of research. Dr. Henry Liu at the University of Hawaii is the co-chair of our scientific advisory board, and brings to bear his knowledge and his skills into our consortium. You've got a VA here, and as well as Tripler base that Dr. Liu has some involvement in, but importantly, he's also part of the Defense and Veterans Brain Injury Consortium, which has been a 20-year partnership between the VA and the DoD to figure this out as well, and he's one of their senior consultants, so you guys are part of this, gladly. Here's a short list. There's no room to fit it. I knew I would talk about Henry, so I didn't want to squeeze somebody else out. We've got about twice as many folks as this. They're all over the U.S. Here's our wonderful board. We've got currently 11 studies up and running. Doesn't matter what the studies are really, but we have the large study is tracking thousands of individuals who've had multiple concussions from the conflicts and tracking them for as long as they will allow us. Every year, testing every test you could ever come up with. Biomarkers and imaging and balance and eye testing, EEGs and their weight and their height and what their color preferences are. No, we don't do that one. And cognitive issues. And then following them every year for their life to see who's going to develop problems, to see who has problems, to see who responds to specific interventions, some of which are scientific, some of which they're going to get anyway. And then trying to figure this thing out in a very concerted way. All right, and that's the kind of, this is like the Framingham study, which is a big study of disease, and particularly cardiac disease that occurred in the 60s, 70s, and 80s. And it's still going on. That's what we're doing in our large longitudinal study, but we also have specialized studies as well that are trying to tease this apart. The brain's complex, thank you for coming. I didn't want to point that out, but our addiction specialist here at UH. The brain's complex, so we're studying at length. We've given out a lot of money to come up with pilot studies, which we're doing as well. We're linked with other NIH studies, so we're going to figure this thing out. It's going to take me more than 5 years and $62 million to do it, but we're going to figure this thing out, and that's part of the program that you're involved with, and that's what we're focusing on. It's important that we have large groups of folks we're going to study. It's important that we understand their risk factors before the injury, at the time of the injury, and afterwards. It's important that we intervene in these ways. There is no medicine that's going to cure this, I don't think ever. We're studying some, and the pharma industry believes there will be. There is no magical intervention with hyperbaric oxygen or transcranial magnetic stimulation or some other kind of electrical stimulation or warm water baths or high colonics. There's nothing that we've found or are going to find. Really, it's a matter of prevention, early treatment, reduction of risk factors, and then getting folks back to health. Some of the myths that we started with to finish off with, there is scientific evidence that single concussions can cause long-term problems. No. Let your kids play sports. If your kid ain't so good, put him in let him play tennis, all right, or swim, all right. If your kid's good, let him play. If he gets more than one concussion each season, which is still a lot, don't let him play anymore. He's not very good, all right. All right. Now, most kids who are really good will get them, but just don't tell their parents, and they go on to greatness in the NFL, and then they become demented. But if your kid is 6'5" and 300 pounds, he's going to be at really high risk to develop problems. All right, if he plays professional sports. If that's his only skill, power to him. All right? If he's got other skills, develop those. Because just being cognitively enhanced, going to school, actually studying, every day doing something cognitively stimulating, having normal and healthy socialization, not video games, not checking your email, not doing something in darkness, but with other people. All right? Just socializing. Limited alcohol, please, but just doing that will decrease the risk. But yes, there's an increased risk. But so my daughters played soccer. They got a couple of concussions. I didn't care. I need people like me or Dr. Lou or other folks here to diagnose them. No, imaging is interesting. It's expensive. It's cool looking, but it's not there yet. We're studying it. There are emerging biomarkers. We just draw blood or check spit or, I don't know, you pee into a cup and I can tell you had a concussion 6 years ago and you look good. We're not even close. Not even close. Remember, if I fell out the door and was bleeding, head coming out, you still couldn't tell. All right, it would take one of you very sophisticated clinicians to realize that I had a brain injury. There's no evidence that anything works for concussion. We're just at the will of the world. It's in God's hands. It's in nature's hands. Lots of evidence that things work for headaches, for dizziness. Is it the strongest evidence? No. Is it level 1 or level A evidence? No. All right, but there's plenty of, and we've talked about some of the basic things, but you'll see in the clinical practice guideline, which is coming out shortly, but which is already online from a couple of years ago, we have specific paradigms for how to treat these people. All right, and a specialist can do it, but a primary care doctor can do it as well. And most concussions from the war are blast-related and have poor outcomes. Less than 50% of blast-related appear to have the same outcomes as everybody else. That's all I got. I'm going to stop a second. Thank you for almost all of you staying and most of you staying awake. Appreciate that. And I'm happy to take any questions or comments. Thank you. Anybody? Yeah.
So you mentioned the transcranial.
Yeah, I shouldn't. Well, what it is it's a technology that's been FDA approved for depression, but is being experimentally looked at for brain injury and other things. It's taking a magnet and putting it, a focused magnet, and putting it over a part of the body, in this case the head, or up on the outside, and stimulating very briefly a part of the brain to get reaction from it. All right, it can move a limb, it can cause some sensory issues. It almost never causes seizures, which is a risk of it. With the idea being you're providing either increased stimulation in the part you want to stimulate to get activation of the brain, or you're going to the inhibitory site on the other side to decrease it if there's too much tone in a muscle. All right, hasn't been used in concussions in a big way yet. It's unclear if it works.
What is it best? What is it benefit?
Depression. That's all we got so far. Some people believe it helps with chronic pain of complex regional pain syndrome type. Some people believe it helps with spasticity from spinal cord injury or stroke. But again, most mental health disorders, there's a belief that somehow shock in the head, all right, in a very focused way. All right, it's clearly electroshock therapy has been well shown to be useful for certain types of depression as well. So rebooting the brain is helpful as well. I'm going to get you, sir, and then this one up there. Yes, sir.
I got two questions. One,
it's always dangerous.
came to me.
Yes.
As a young kid, I was involved in a rock fight, and rock hit my head. Second incident, I was riding my bike home from high school, and I hit my head, and I saw the light.
Okay. Were you unconscious for long from the rock one?
No, it was this
So they're both concussion-like?
concussion-like.
Okay. Have you had any long-term problems from them?
Well, the only other problem is...
This is a HIPAA thing. If you don't want to tell me, it's cool. I'm just, I became a doctor for a second.
The last couple of years, I've been diagnosed with a...
Okay.
I'm trying to find it.
Were they related to each other?
Related.
Yeah. Unless you had a long period of unconsciousness, meaning 6 hours or longer after either of those, then in my understanding, no, zero association.
Okay.
All right. So
Second question.
that wasn't two. Oh.
Say if my had a friend that was involved in a real bad car wreck. She had like heart problems, kidney problems, medical problems.
Polytrauma, yeah.
Body trauma. But when she hit her head, would it say that affect her overall body function?
Can, yes. Your brain controls everything. And so if the brain injury is enough, then you can have problems with your hormones, your heart. You can have problems with the flow of cerebral spinal fluid throughout your body, so it can. And seeing a brain injury specialist, a rehab physician, a neurologist, a neurosurgeon.
Unfortunately, she died.
Oh, well, but that would be just general. But yeah, we're trying to keep it general, but I'm sorry to hear that. I think there was another question. Thank you.
You mentioned there's 5 centers, Richmond being one of them. When you get a referral from one of the other regional hospitals, what's the average length of stay for the treatment you offer? Are family care members incorporated into that?
Yeah.
And thirdly, you have that triangle of addiction, chronic pain.
Yeah.
And does your program address the chronic addiction on the pain meds?
Okay, quick answers. Because people are, and I'm happy to, I'm going to stay, I'm sure afterwards and talk to anybody who likes, but quick answer is length of stay is dependent on the type of injury. You know, if folks are in a coma, 120 days is sort of the typical. You know, and we have about 85% wake up from that coma after these conflicts. But if it's a mild injury, it can be 2 weeks of outpatient. It can be 6 weeks of residential program. It can vary. The 5 centers, Richmond, San Antonio, Tampa, Minneapolis, and Palo Alto. So Palo Alto will be your closest. There was that one. Family is day 1, day 0 involved. There's an entire field of research as well as a family care manual that's available. The VA has set up programs to pay families to provide caretaking if needed. And there's also respite programs that are set up for families that it's challenging for. It can be very hard to do this. But clearly families need to be integrated right away. We don't know all the answers. We know a lot of questions. Family doesn't know all the answers to questions, but they're going to be with the patient for a long time, so we need to kind of partner on that. So very integrated. But the family care map was developed by DivBic, and it's something that you can get online. dvbic.org, great resource for clinical practice guidelines, for family care manual, for just about anything. dvbic.org. So thank you. Maybe one, I don't know. Yeah, go ahead.
Just really quick, just to
Uh-oh.
reinforce my understanding. So helmets, even the airplane helmets, do not protect you from concussion.
Right, and yeah. Right, but because again, the injury is not contact. The injury is acceleration, deacceleration. And the only thing that would work is if the helmet were actually attached to the brain, as opposed to the skull, like a woodpecker. Woodpecker skulls are attached to their brain, so when its skull moves, its brain's moving. And its brain is special, and it's got a special hollow skull and stuff, so that you're not getting movement of the brain. It's going every time, back and forth as one. All right, so we need to be woodpeckers. Or if you're in elephants that have their tusks cut off, there's some case reports of a higher risk of dementia, because an elephant's head is so big that when it starts moving, elephanting, whatever the hell, trumpeting, all right, it actually has such velocity that it can actually cause the brain to get concussions if you don't have the trunks to slow it down out there, all right? So if you had a helmet, and there's a guy in our shop, and I like him, I think he's making this up, who says, let's put magnets inside these helmets that are opposite each other, and then when the helmet's getting close, it's going to slow it down and ease it. Like a slow airbag it, all right? It's absurd. But, you know, 300 pounds. I mean, what kind of magnet is that? You know, like, if anything, they should stick to each other. It would be better. They wouldn't move. But so helmets prevent the impact, prevent fractures, are invaluable. They're great. They work. The Rydell's are great. They're not as good as they say because they don't prevent these at all. All a helmet does is add more weight. And weight equals more momentum, more velocity, or actually more momentum. When you add that to velocity, you're ending up with a higher risk. But, you know, and that's why, actually, that they used to have the face things went out further, but now they're in closer because they look kind of cool, and because they're not in the way. But that actually would have been better to be out there to slow it down a little bit. In the NHL, there are no requirements for helmets. They don't have to wear them. And when I went to locker rooms, they're wearing these flimsy little things with a little glass, like paper, all right? And I'm like, guys, why do you wear this? Because they said, because we look good, and our hair looks good. And I said, really? I said, yeah. Look, that's not good. They said, look, we know it does nothing. You know, we're getting slammed at 30 miles an hour into like wood. This isn't going to do anything to us, so we might as well look good. All right, I swear that's what they said. All right. Now, goalies have much stronger helmets because they have 120-mile-an-hour puck hitting them, all right, and they're at risk for getting skull fractures, facial fractures, but their heads get whipped back too. If I do that enough, I'm going to get one. Maybe one last question, and then we'll close up.
So when I was a little boy, there was a branch that fell off a tree and hit my head, and I woke up just fine from it. And then I also was in a motorcycle accident with a helmet on. And also when I was young, I grabbed an electrical wire, and I went about 20 feet up in the air and then came down to the grass.
Wow, cool.
So, that was pretty sad, yeah.
Yeah.
So, and I did see like a flash of orange or red, for about 1 year, twice. It was pretty odd. And I never knew what that was until you mentioned seeing orange. Did she say it was like a flash, or?
Did I say that or did he say that?
Did you say
Yeah,
it was
yeah,
a
like you see,
flash?
yeah, of orange. I've never seen the orange, but yeah. Yes, so you've had probably 3 concussions as well as an electrical injury to the brain. Right? And your question is, are you going to get dementia? Not on my watch. Is that his question?
Okay.
Yeah, well, but I will say, before I say that, is electrical injury to the brain and neurologic system is different than concussion and may actually, in a subset of people, have progression over years, 15 to 20 years. His was a while ago. It's probably not causing you problems now. You're probably out of the woods, but it's a different phenomenon. Oh, then you're still in the woods. No, you have but have you had any problems yet? You should see problems now.
Nothing yet.
All right, I think you're okay, but, eat right, exercise, be cognitively stimulated, be social, mindful. One final question, then we'll end. You sure? Nice shirt, by the way. Love the shirt. All right. So again, thank you for the invite, thanks for the attention, and thanks for the great questions.
Thank you very
You're
much.
very welcome.
Thank you very much for the excellent presentation. Before we leave, I'd like to recognize 2 people who were instrumental in bringing Dr. Seifert here. First is Dr. Liu. Could you stand up? Dr. Liu is the chair of the Department of Communication Sciences Disorder. Also, Dr. Violet Horvath, who is the director of Pacific Basin Rehab Research and Training Center. Thank you very much.
You're very welcome.
Thank you very much.
You're very welcome.
Aloha, my name is Lincoln. I am your host, and I'm from the Queen Liliuokalani Children's Center's summer school program. And today we're going to talk about littering. I'm here with my guests Venezuela and Mark. So you guys know about the littering problem, right?
Yeah.
It sucks, doesn't it? Yeah. So how do you guys feel about people littering?
I feel sad.
How about you, Mark?
Knowing people who litter, and of course it's gonna end up in the ocean.
Yeah, most.
I just think of what kind of fish might eat it or something. Might die from it.
I heard from my teacher that they're making this plastic from like corn, and then like they're trying to like make it so it's like it's not as like, it's kind of cheaper and it doesn't hurt animals as much. So how would you guys solve this problem from like getting worse? Or
Stop making plastic.
Mark?
I don't think we can solve the issue, but I think we can prevent it just by doing little and little at a time.
So why would stopping Why would stop making plastic be a good solution?
Because if we keep on making more plastic, it'll just like it'll get everywhere. Like when people buy stuff, they use plastic bags, and when they always use that, they should usually put it out inside a recycling bin.
I see. And it's pretty safe, or it's pretty cool how when you go to the grocery store, like for example Foodland, now they give out reusable bags that's not plastic, or it must be made out of plastic, but you can use it over and over again, so you don't throw it away and you don't hurt the environment. That's a start. Just to let you know.
Probably one way.
Huh?
That's one way.
Yeah, that's one way to start off of solving this problem.
Programs airing on the Olelo Community Media channels are presented by independent producers in the community's interest. The opinions and views expressed do not necessarily represent the views of Olelo Community Media or its management.
We do it island style. From the mountain to the ocean, from the windward to the leeward side. Lighting a way to a cure is lighting a way for hope.
Aloha! This is Sky with Rare Disease Hawaii. Welcome to our latest episode, ALS with Rare Disease Hawaii. And what is a rare disease? A rare disease is an orphan disease in the United States that affects fewer than 200,000 people. And 30 million Americans, which is about 1 in 10, have a rare disease. So in Hawaii, there's 1.43 million people. So that's 1 in 10. That's over 143,000 people with a rare disease in Hawaii. So that's a lot of rare going on specific to Hawaii. So today we're going to have guests, Davina Robillard, who is ALS Hawaii Support Group founder. And we're going to have Kathy O'Connor, ALS patient caregiver and advocate for her two brothers. So we're going to talk about them. But first, we're going to let you know what Rare Disease Hawaii is. Rare Disease Hawaii is laying the foundation for a rare disease task force to impact patients and caregivers to empower themselves to be stronger advocates for their rare disease. And we are an outreach resource for the rare disease community by having support groups. We have a rare disease outreach and support group at the Hawaii State Main Library every first and third Saturday at 1 o'clock. So hope to see you there. If you're looking to get information on clinical trials, on research, on helping to find a diagnosis, cheaper ways to get your medication, please come to our support group at 478 Punch Bowl on King Street, and come down and join us every first and third Saturday at Hawaii State Library. So patients that that have limited availability of information on their condition have a rare disease. People that often have difficulty getting a clear diagnosis are considered to have rare disease. And a lot of the common challenges for patients and their families, and I know this is probably common with those with ALS, and that's obtaining a correct diagnosis, getting limited treatment options, trying to gain access to treatment options that do not exist or rarely exist, and difficulty finding the right physician with the experience in treating your rare disease. So access to that and not getting the type of genetic discrimination that comes with rare diseases is what a lot of the people in the rare disease community have to deal with. So in talking with ALS, we're going to start with Davina Rovilar. You're the founder. You started in 1998, so
That's right.
you understand a lot that's going on with the rare disease community. You're one of the first ones out there. So tell us about what got you starting your ALS Hawaii support group.
First of all, let me say that I was a co-founder, not the founder, because there were
okay.
two of us. Actually, we are both nurses whose husbands had ALS. So it was at the same time that we thought it was time to put together a support group in 1998, because as you know, at that time, many of the families did not have access to information. They did not have a lot of information about home care resources as well as treatments. So we approached Muscular Dystrophy Association, the executive director, who sponsored the first few meetings. We were everywhere. We didn't have a place to call our own. However, eventually MDA took it upon themselves to sponsor all the rest of our support group meetings, which now happens every second Tuesday of the month at the Queen's Conference Center at corner of Beritania and Punch Bowl from 5:30 to 7:30.
Huh? Okay.
Yes.
Well, that sounds like a good support group to be a part of.
Yes, it is, because a lot of it is also socialization. It's potluck. And Kathy and I have been going to this support group for a long, long time. And friendships are made, enduring friendships are made during the support groups. And even those who have already, their family member have passed away, have still come back and be part of the group as well as of many of its activities. Yes.
Well, that's good to have that connection with the rare disease community, especially somebody that shares your same disease like ALS. So, Kathy, you had both your brother Brian and Bruce with a rare disease, but each had their own. Which one had the ALS?
Brian, my youngest brother. Brian is the one with ALS, and initially we did not know what was wrong with him.
How long did it take him to get his diagnosis?
It took over a year.
Over a year. Wow. From the time that he first noticed symptoms, right?
From the time he first noticed symptoms, he actually ended up homeless in the park and didn't disclose that to any of his family, so we didn't know what was going on. We couldn't step in to try to help him.
What were some of his symptoms?
He had trouble walking. He couldn't get across the street in time. He would stub his toes because he couldn't lift his feet up very good. And his speech started slurring.
Oh. Well, I guess the best question, let me give this to you, Davina. What is ALS? We heard of Lou Gehrig's disease, but what is ALS?
Well, ALS is commonly known as Lou Gehrig's because he is one of the icons that fell got sick with this illness. And there are other people in our community here in Hawaii whom people may recognize as having had ALS. The watercolorist Peggy Chan, as well as the football coach
Charlie
Wiedemeyer, were two of the Hawaii well-known personalities who had succumbed to ALS. ALS is a disease of motor neurons. We have what you call the sensory neurons as well as the motor neurons in our brains. Sensory neurons have something to do with the six senses, the sight, hearing, smell, and so on. The motor neurons are those that connect the sensory neurons with the muscles that are affected by ALS. What happens is that the connection between the motor neurons, the motor neurons themselves die. For the reason nobody knows at this time. It has taken this long, but we still do not have a common cause. But we know that about 5 to 10% is familial or genetic. And yes. That's
5%? Because you know that at least 80% of all rare disease do have a genetic component or connection to it. So that's 5 to 15% of a lot of people have that genetic component to their rare disease. So, and so does yours. We had a person on last month, Ronson, who had APBD, which is a rare form of ALS, and he has problems with his motor skills also. And what's the most common symptom that you hear when it comes to ALS in your support groups?
The most common symptom is weakness. All of a sudden they are unable to do something that they in the past have been very easy for them to accomplish. It affects mostly the limbs, upper limbs and the lower limbs, although eventually the muscles that affect breathing, your chest muscles, as well as the muscles that have something to do with swallowing and speech are also affected.
See, when you say lower limbs, you know what I think of? I think of the movie Valley of the Dolls, when the boy catches ALS, but he doesn't know it, and he's walking, trying to catch a hold of Patty Austin to get a part in a play or movie or something, and he loses control of his lower limbs walking down the steps, and oh my gosh, you know, that's what I think, you know. I know it's an old movie, but
I was just going to say,
I'm aging myself a little.
You are dating yourself here. Talking about Valley
I don't
of the
see
Dolls.
many movies that have ALS in them. I'm quite sure there's new things that are out there, but that's what I think of.
Yeah, the latest one actually is The Theory of Everything, which portrayed Steve Hawking, the astrophysicist, as and his life with his family with ALS, and it is a tremendously moving story.
And it
as
comes true to life to what people are really going through with ALS.
As all rare diseases, I think these are all moving stories, like Brian's, and he was homeless for a period of time.
Yeah, tell us about Brian's story there. He's 58 now, right?
Right.
And what happened with his story being homeless and getting his diagnosis?
Well, he had a moving business, but because he started to deteriorate, he could no longer work. It became very difficult for him because, you know, you're very physical moving the furniture, and so he couldn't pay rent. And he ended up losing his trucks and his business and his apartment, and ended up in the park. And he thought it was arthritis, or he kept going to the hospital.
And a little bit of pride, too, in that.
Right. He didn't want to, impose on his family. And most of them were on the mainland.
Oh.
Yeah.
Yeah, but you were there for him. You found him.
I was on the Big Island at the time, and I
Mm-hmm.
tracked him down here in Honolulu.
Oh, that's good.
And he agreed to let me help him get a diagnosis. And from that point, it took over a year.
Oh. And what facility helped you get that diagnosis here in Hawaii, Honolulu?
Well, we went to Queens.
Queens. Well, they have a good Queens Cancer Center with Dr. Conde is a really good source of getting your proper diagnosis with them. Who was helping you get your diagnosis at Queens?
He had a multitude of doctors.
Oh.
Like, he's probably seen over 50 doctors trying to get his diagnosis.
A team of doctors.
Yes.
Ooh, sometimes you need that to get a good diagnosis, yeah.
And this is going back like 15 years, so I'm not sure the cancer center was in operation at that point.
Oh.
And because this is a neuromuscular disorder rather than a straightforward cancer illness, there were no clinics at the time, and not too many people. As
15 years ago.
As perhaps like all people with rare diseases, they find that there is not one person that they can go to who could recognize their illness at once. And there is also a lot of denial that comes with...
he thought it was arthritis or something.
Exactly. When you think about ALS, it's kind of difficult to accept that you have something that's fatal, because that's all what people know about ALS, is that it's fatal.
Right.
Which is, it is true, but a lot of people also nowadays have the kind of support that will allow them to live a longer span of life with a good quality of life as well. As in the case of Brian, he is in a facility that now takes in people with ventilators.
Oh, that's
so
good.
Van is, he
good,
is vented as of,
So,
how many years ago was he vented?
In 2004.
2004.
Yes.
So that was at least 4 years after his diagnosis, right? Or...
He was diagnosed in January of 2003.
2003.
But he had probably had
So 1
it
year.
quite a
for
while.
2 or 3 years before that, just because of the onset of his symptoms. And what I know now about ALS, it had progressed to the point where it was quite obvious.
So let's talk about the type of facility and the care he's getting now. What type of care is he receiving now?
Well, he's in a skilled nursing facility. As he deteriorated, he ended up with pneumonia, had to be put on a ventilator to help him breathe, and because of aspiration, he could no longer eat, so he was put on a feeding tube. And he also lost his ability to move his hands and his feet, so he's a quadriplegic, and he can no longer speak. And so I'm his advocate, and I have a special way of communicating with him. I have an alphabet board, and we spell out the letters.
Oh, that's a good special way to communicate.
He'll blink or he'll smile if it's a yes. You have to ask yes/no questions, and look very closely, to his facial expressions.
That's the thing about caregivers. They pay attention better than anybody, yeah? So you can tell what's going on and be able to communicate and have the patience to communicate.
Oh, yeah.
Yes.
That makes you an awesome person, I gotta say. It
Thank
really
you.
does, yeah.
Yes, particularly families with who have rare disease in their families. Somebody has to eventually be the caregiver, and mostly it's the spouse or the mom. But it's not, caregiving is not limited to just hands-on care. There's also the supportive caregiving that goes on in families. Like, for example, some family member will have to take care of the cooking or take care of the laundry. So it becomes a family affair. Although there is a primary caregiver, usually there are other family members who help in the other kinds of instrumental activities of daily living that is needed by the person who has the illness. Like in her case, she is Brian's foremost caregiver.
That's good.
She has a power of attorney because now he is unable to sign papers, cannot do the things that normally people are able to do on their own, take care of their...
people with ALS eventually must prepare for these type of caregiving scenarios that eventually will happen with their disease, right? So it's good to get patient caregiver information with the ALS Hawaii support group, and we'll be giving out that information at the end of our show, and where you can contact Davina support group and get in contact with others that have the information you need to be a better caregiver for your ALS patient or a family member or loved one with ALS. So,
Sky, I just wanted to say the ALS support group was invaluable to me because once Brian had his definitive diagnosis, I hooked up with the MDA and the ALS support group, and that allowed me to find out what is ahead, you know, and that way I'm trying to stay one step ahead of the game.
wow.
And that
that's
was
good.
really invaluable, talking to other families who had been there, who had gone through that experience, and it helped me learn and prepare better for things that were going to happen in the future. So I encourage anybody to go and talk to somebody.
Yeah, so please talk to somebody, get the information you need. That's why we're here, to help you get the information that you deserve. So, and that's why caregiving is an important thing. And at Rare Disease Day, on the rarest day of all, February the 29th, this past couple of months ago, on Rare Disease Day down at the Hawaii State Capitol, thanks to people like Senator Brickwood Galataria for helping us sponsor that with NORD, National Order of Rare Diseases. We had ALS there, and we had some people talk at our Rare Disease Day about ALS. We had Taryn Davis speak about ALS, and we're going to take a listen to what she had to say about ALS at Rare Disease Day, February 29th, 2016 at the Hawaii State Capitol. Let's take a listen to Taryn.
My name is Taryn Davis. I've been traveling around all the neighbor islands for the last 3 years working with people with rare diseases. And so one thing I want to bring to the forefront is what happens when you have a rare disease in a rural area. Number one, people don't get diagnosed until they're stage 3 or 4 instead of stage 1 because it's so rare. Diseases are very hard to diagnose. So in ALS, as a matter of fact, we get lots of people who get diagnosed a week or 2 before they die. If we could, in any rare disease, educate the medical community about how to diagnose quickly and get clinics up, then people can get diagnosed stage 1 or 2, get treatment. And when statistically, or actually there's a research done that people who are involved, ALS people are involved in multidisciplinary clinics live 9 months longer, and they have better quality of life because their symptoms are being treated. instead of suffering the whole time and then get diagnosed a week before. Secondly is equipment. So on the neighbor islands, and actually in all of Hawaii, we're just getting equipment trickling from the mainland. And the equipment that's being used in the mainland has been there for a long, long time, and we're just getting it. One example is about 6, 7, 8 months ago, we just finally got a non-invasive ventilator called the Trilogy. We're working on getting cough assist and percussion vests for people with breathing problems, which will help COPD people with ALS, cystic fibrosis, actually. How are you? Anyway, so we're trying to get equipment to the neighbor islands too. We're trying to get education. We have people at Hilo Hospital who got discharged home on a ventilator. Yay, Hilo Hospital. They trained the family how to work the ventilator, and the family member got to go home. Wilcox Hospital in Kauai told some of my patients they don't train family members on ventilators. They cannot go home. They have to go to Oahu. The family cannot travel back and forth. They have no money. So finally, we fought hard, and for the first time in Wilcox history, a patient on a ventilator got to go home. So there are strides being made. We need to keep working. One more thing I want to talk about is Medicare and the neighbor islands. So durable medical equipment like wheelchairs, hospital beds, walkers, power chairs, anything that people need, Medicare is cutting the cost 50%. They're only paying 50% to our medical vendors on the neighbor islands and probably here too. But the neighbor islands are small business, so they're hurting. So they're not taking any Medicare people because they can't afford it. And then my patients and all our patients are getting equipment. It's a big, big problem. Okay, I lied, one more thing. It's caregivers. So I work with lots of families, and their family members that have ALS cannot move, cannot breathe, but they're mentally there. They need lots of help. Please move my arm, it hurts. Please turn me every 3 hours. I have to go shishi. And you have to physically lift them. It's hard when you don't have a big family or you don't belong to a church. If it's just you and your children, it's really, really difficult. The stress on the family members is incredible. I've had spouses end up getting breast cancer because of the stress, and it's been proven 22% of women getting breast cancer is because of stress in a family. So we need to take care of our caregivers. It's so important, and then people can stay home when they have an illness. But if the caregivers are burning out and falling apart and the families are falling apart, it's a big problem. And our ALS patients are young enough, they're the income winners, and then they get sick and the whole family loses one income. So there's financial difficulties. And a lot of my patients, my youngest patient was 28 years old. My oldest is 80 right now and here in Hawaii. So it's a big gambit. Anyway, thank you so much, and thank you for being here and listening to these important messages. Thank you, and God bless.
Okay. Well, that was great. You were there at Rare Disease Day, Kathy. What do you think about what Taryn was talking about at Rare Disease Day, mentioning how, you know, she deals with people that have the rare disease that are looking to get support?
Well, Taryn is very knowledgeable, and she's just an awesome person. We are so blessed and so lucky to have her working here in Hawaii with us through the Golden West chapter in California.
Oh, yeah.
And she flies outer island. We have ALS patients and families that are on Kauai, Maui, Big Island, and Taryn just goes where she's
really
needed.
good to know that you branch out inner islands to help those with ALS. So that's awesome to know. So she goes to the local hospitals or local agencies on each island?
She goes to the patients' homes.
Oh, wow, one-on-one. That's even better. So if you want to get that one-on-one and you're on a neighbor island, make sure you look up ALS Hawaii so you can get more information on getting the help and caregiving help that you need. And let's talk about more than just ALS, but you also have another brother, Bruce, that had a rare disease also. Can you tell us a little bit about Bruce? He had GBM. What is that?
That's short for glioblastoma multiforme. In 2012, my second youngest brother, Bruce, thought he had sinus allergies, and when he went to the ER, it was discovered that he had a brain tumor.
Wow, okay.
The tumor turned out to be a very, very aggressive stage 4 brain tumor, nicknamed the Terminator. And he was given 14 to 17 months, and he lasted 3 years to the day of his diagnosis. And I flew back to Michigan to help my mom caregive him in the end. So I'm flying back and forth between Hawaii and Michigan.
Ah, keeps you busy, huh?
It did.
And he passed away last February.
August. Last August.
Last August.
Yes.
Okay, thank you for straightening that out for me. So from the time of his diagnosis, how quick did it progress, his symptoms?
It was pretty rapid because it was on his right frontal lobe. It affected his thinking, his executive functioning, and in the end, it got to the point where he forgot how to access the internet. He forgot his passwords. He couldn't tie his shoes. He couldn't sign his name. He couldn't write a check.
So
basically,
all of his,
he couldn't function.
Yeah, his cognitive skills were totally going. Yeah.
And that was because the tumor was growing and nothing more could be done for it. He initially had surgery, radiation, and chemo, but that worked for a while, and then the tumor came back.
Were you able to find a clinical trial for him, or?
Not a clinical trial, but we did go to the University of Chicago and tried a, not an experimental, it was actually approved by the FDA, and it was like an electrode cap that you wore on your head. It was a panel of electrodes, and he would wear that minimum 18 hours a day.
And
the theory is that the electricity is going to kill the cells in the brain tumors.
Did it work?
No.
I
I think he was too advanced by the time we tried that.
So that
it was
didn't show
not
any
successful.
promise. Okay. Well, in regards to Bruce's rare disease, GBM, and how do you pronounce that again?
Glioblastoma multiforme.
Multiforme. So, if you're looking to get a proper diagnosis and you feel that your doctor is telling you, well, you have a brain tumor or something's going on, maybe this is something you want to mention to your doctor to check out to get a second diagnosis, to get the proper diagnosis. And is there any support group or anything for his rare disease?
Yes. There's the American Brain Tumor Association, ABTA for short. And they're based out of Chicago.
And we'll put their organization website on our end of our show, give you that information. And what other information do you have on GBM?
There's a lot of information online. They have online support groups depending where you are in the country. There are a lot of clinical trials, and that's all coordinated through the Brain Tumor Association.
Okay, that's good. And what we want to do is maybe talk one of our quick segments, if you don't mind, ladies. It's called Patient to Patient, and what we're going to talk about is something that's going on that affects everybody in the rare disease community and patients particularly. And that's the Consumer Financial Protection Bureau has spotlighted concerns with medical debt collection and reporting because it's known that 52% of all medical debt or debt in credit reports, 52% is medical expense or medical debt. Wow.
That's very interesting and very true.
Yeah, more than half. And I don't know if you can take medical debt off on a bankruptcy or anything, but more than half of your
income of your debt
is medical. That's serious. So there needs to be some medical debt forgiveness out there. And so what I want to talk about also is some things that you have coming up. Saturday, May 21st, what's going on with Project ALS? We're going to have a second annual With Grace 5K run.
That's right.
So what's going on with that, Davina?
May is traditionally celebrated as ALS Awareness Month. Here in Hawaii for the past 2 years, and this is our third, we have been celebrating May as ALS Awareness as well as Families Appreciation Month. There are a number of weekly activities, some that are only specifically done in May and others are regular. The first one is on May 4th, we have the governor proclaiming May as ALS Awareness Month. And so, yay! It always starts our May activities. We go to the state capitol, and our families are represented as well as other agencies and service providers are represented in the proclamation. And then the following week, Saturday, we have a joint activity by the 3 main agencies that provide services for ALS patients and their families here in Hawaii. And this is the Muscular Dystrophy Association. There is also the ALS Association. Yes, exactly. MDA Hawaii, ALSA, or ALS Association from the Golden West chapter, as well as ALS Ohana, which is a local organization. So the 3 of them are going to combine their efforts to come up with something related to ALS for the celebration. And then this is our 3rd week activity, the With Grace, the 2nd annual With Grace.
Full swing of having a good
Exactly.
time.
No, we're not going to rest until people know about ALS.
All right. Woo.
So this is the 3rd. On the 3rd week, we have With Grace, the 5K run in Kailua around Lanikai Loop. And there is a registration for that. You can go online at active.com and register for the With Grace 5K run.
Keywords With Grace 5K.
Yes.
At active.com.
Right, and there's an actual race. We have packets and waiting for you, registration with your T-shirt and your bib. And finally, we have the Day of Remembrance Memorial Ceremony that we've been holding for the past 2 years, where we have it at the state capitol. We start with sign waving, saying thank you to Hawaii for celebrating the month with us, and then ending up with a lei of remembrance where we string a lei after the reading of each of the names of those who have passed with ALS. And this is it's a very somber, very memorable an unforgettable event. It's a chicken skin kind of event.
Right?
At the end
I'm getting
of the
chicken
May.
skin just thinking about it. That's a great way to commemorate others by doing the sign
That's right,
waving
yes.
and doing the lay with the calling of the names. That sounds like a very worthy and good annual event to commemorate those that have had ALS. And so one of the things I want to talk about, I had a rare disease. My rare disease is pheochromocytoma. It's a rare neurological condition with a tumor on your adrenaline gland that causes fight-to-flight syndrome that gives you high blood pressure to the point of heart attack, stroke, or death. Less than 10 to 15 people in Hawaii are known to have my disease. So I was only given a 50-50 chance at Queens Medical Center. I went through Queen Emma Clinic and not the Cancer Center. They 2012 and went to NIH Bethesda, Maryland, and had my tumor removed, which was my only course of being cured of that disease. And just thank God it didn't metastasize or cause paraganglias, which are floating tumors, which are known to be associated with my disease. So if you wanted to know why I'm talking about rare disease, it's because I know firsthand. And I want to thank the ladies for coming by and talking about rare disease. But before we wrap up, I want to ask each of you ladies, what does rare disease mean to you in regards to the rare disease support group that you're with?
Go ahead.
Well, I'm just much more aware now of rare diseases and how important it is to follow up with good medical care, getting a diagnosis. And I should mention that in February, we just opened the first ALS multidisciplinary clinic.
That's right.
At Kuakini Hospital.
That's right.
And it's like a one-stop shop where all the doctors who are familiar with ALS are all in one place.
Oh, that's great. Talking about that, it is good to know that people are finally getting together and collaborating to help those with rare disease like ALS. And one of the things that Rare Disease Hawaii is pushing for is our Rare Disease Task Force, where we would like to collaborate everyone that's involved with the rare disease community, hospitals, UH cancer centers, insurance companies, pharmaceutical companies, and even governmental agencies to get together to collaborate with patients and caregivers on how to better take on rare disease in Hawaii as far as costs, dealing with trying to get diagnosis and getting the right doctors and the right testing. So I presented that as a resolution to be brought up at the Oahu County Democratic Convention and for the state convention to be a platform for the Democratic Party to want to take care of rare disease. And I'm quite confident that it'll be accepted by the Hawaii Democratic Caucus and Party. So I'm excited about that because then we can really get some help for rare disease and all of those that have it. So with that said, Davina, what does rare disease mean to you?
Rare disease to me is something that has to be taken up not only by government but also by the private sector.
Right.
The government's ability to deal with all of the ills of its constituents is a huge task. Because we are members of a rare disease community, it's up to us to be forceful advocates. It's up for us to fundraise. It's up for us to take up the causes that we all carry as family members and bring it to the fore so that others in the community can understand as well as participate and give and be generous in giving to the causes that we have.
To create a rare disease Ohana, that's why I created Rare Disease Hawaii, to create a Ohana and a network where if you know somebody that knows how to get that medical flight, show the next person how to get the medical flight. If you know that this doctor is, helping a little bit more and doing extra to help those find their diagnosis, recommend that doctor. If you know a pharmaceutical company that's giving a discount on that prescription, let everybody know. Sharing the love, sharing the aloha, right?
Exactly.
Yeah.
Because we just have to help ourselves. That's the tyranny of government, is that for the most number of people. So in other words, we're left behind taking care of our own selves.
That's right. That's right.
And there is a lot of resources out there that we can help each other with.
Yeah. We just got to find them, and that's why we got to create a Ohana and a community that gets together. So if you want to know more about rare disease, you can contact Rare Disease Hawaii at gmail.com or contact me or come to one of my support groups for rare disease at Hawaii State Public Library, first and third Saturday, 1 o'clock of each month. And then we have information on ALS Hawaii's support group that you can contact them and be a part of their second annual Project ALS with Grace 5K and be a part of that. And hopefully this will air in time for everyone to know that it's going on. But I want to thank Davina and Kathy for coming here today and sharing.
Thank you for inviting us.
Yeah,
It was a pleasure.
Yeah, and thanks for sharing your journey with Brian and Bruce, and your journey too with your husband, and to know that you're still out there supporting others with ALS. That's good to know. So now we know we got a really strong ALS community, not just here, but outer islands too. You got people like Taryn out there helping with ALS and MDA. So if you need more information, please contact us. And we want to thank you for watching today. We want to thank you for sharing and caring. If there's anything you need to know, please look us up or give us a call or reach out. And I just want to say, mahalo nui loa. Thank you. Woo
Lighting a way to a cure is lighting a way for hope. Hope is strong, hope is courageous, hope is withstanding, everlasting and contagious. Hope is making a way for others to stay longer in our lives. We must put up a good fight to do what is right. Staying on the right track for those that are putting up a brave fight. And for those that will never come back again.
Hi, I'm Margaret Reed McDonald, and this is my friend Jeff Gare. I'm going to tell you a story called Cockroach Party. You can find it in a book I wrote called Celebrate the World, and it is from Louisiana. It's about a hen named Pool because she was a French hen, and a cockroach named Roach.
Roach.
Yes, Roach. Yes. Pool and Roach were married. It was not a good plan, but they were in love. On the wedding night, Roach, who was a drummer, played the drums all night long. A-bim-bam-bom, a-bitty-bitty-bom, a-bim-bam-bom, a-bitty-bitty-bom, a-bim-bam-bom, a-bitty-bitty-bom, a-bitty-bitty-bom-bom-bom-bom. Wow. That night they slept in. Next morning was Sunday. And they slept some more. But Monday came. 6 a.m. Paul was out of bed. Rise and shine, rise and shine. 1 and a 2 and a 1 and a 2. I need the bends. A 1 and a 2 and a 1 and a 2. Come on, honey, come on. We gotta go to work. What's the matter? Exercise.
I'm not feeling so good.
You're not feeling good?
No.
Oh, dear. Well, okay, that's all right. I'll go to work by myself today. I'll come back tonight, and I'll make you your special soup, and you'll feel better tomorrow. She took her little hoe, and she took her little rake, and she went off to the farm. The-doodle-doodle-doo, I'm off to the farm. The-doodle-doodle-doo, I'm off to the farm. I like to work. I like to work. I like to work. No sooner was she gone than that cockroach jumped out of bed and got on the telephone. He called all his cockroach buddies. Hey, you guys!
Hey, you guys!
My wife is gone!
My wife is gone!
We can party! Come on over!
Party!
Oh, and down the road from the right, down the road to the left, down the road from the middle came cockroaches. Some were carrying chips, some were carrying dips, some were carrying their musical instruments. In they came and they began to party. A big bam bum, to bitty bitty bum, a big bam bum, to bitty bitty bum, a big bam bum, to bitty bitty bum, to bitty bitty bum, bum 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 bum. Woo! 5 o'clock, he said. Oh. My wife will come home any minute.
My wife will come home.
Clean up the house and get out of here.
And get out of here.
And those cockroaches scurried around. They threw all their little chip containers in the garbage can. They threw all their little drink cans in the garbage can.
Bye-bye.
They packed up their musical instruments. Some went up the road to the right, some went up the road to the left, some the road to the middle, and they were gone. And Roach got back in bed. And Pool came home from the farm. Oh, doodle-doodle-doo. I'm so tired to doodle-doodle-doo.
Oh.
I'm so tired. Honey, babe, how you doing? You're still in bed? You're still feeling bad? Well, I'll make you some soup. She made some little soup and fed it to me with a little spoon. Here, sweetie pie. You'll feel better tomorrow. They went to bed. They went to sleep. They slept real sound. 6 a.m. Rise and shine, rise and shine. A 1 and a 2 and a 1. Come on. A 1 and a 2 and 1 and oh, what's the matter? Go to work. What? What's going on? No. You aren't feeling good still? Oh, I'm sorry. Well, I'll come back tonight and make you some more soup, and you'll feel better by tomorrow, I'm sure. I need help on the farm. She took her little hoe, and she took her little rake, and she went off to the farm. The-doodle-doodle-doo, I'm off to the farm. The-doodle-doodle-doo, I'm off to the farm. I like to work. I like to work. No sooner was she out of sight than that cockroach got on the telephone again. And hey, you guys, my wife is gone. We can come over. We can party. And down the road from the left, down the road from the right, down the road to the middle came cockroaches. Some were carrying chips, some were carrying dips, some were carrying their musical instruments. In they came and they began to party. A bim bam bum, a bitty bitty bum, a bim bam bum, a bitty bitty bum, a bitty bitty bum, bum bum bum. 5 o'clock. He said, you better get out of here.
Get everything away.
My wife will be
Put it
coming
away.
home any minute.
Clean it up.
She's coming home. They threw the little chip cans, haters in the garbage can, little drink cans in the garbage can, packed their musical instruments, up the road to the right, up the road to the left, up the road to the middle, and they were gone. And he got back in bed. And Pool came home from the farm. Do-do-do-do-do. I'm so tired. Do-do-do-do-do. I'm so tired. Honey, babe, you still feeling bad? Oh, no, you're not still sick. 2 days in bed? I'll make your soup. You're going to feel better by tomorrow. She made her little soup and put a little hot cayenne pepper to help out, and she fed it in the spoon. Here you go. Tomorrow you're going to feel better. Right? They went to bed. They went to sleep. They slept real sound. In the morning, 6 a.m. Oh, rise and shine, rise and shine. 1 and a 2 and a 1 and a 2. Come on. 1 and a 2 and oh. Come on, we gotta go to work. What? Oh no, you're not still sick. I'll come back tonight and make you more soup. She took her little hoe and she took her little rake and she went off to the farm. I'm off to the farm. She passed the garbage can. What's this? Drink containers, chip containers, Somebody's been having a party at my house, and I wasn't here. Huh. To-doodle-doodle-doo. I think I'll just hide. To-doodle-doodle-doo. I think I'll just hide. She wasn't hid for a minute when she heard him on the telephone. Hey, you guys! My wife is gone. Come over, we can party! And sure enough, from the right, from the left, in came cockroaches. Some carrying chips, some carrying dips, some carrying musical instruments. In they came and they began to party! A bim bam bomb, to bitty bitty bomb, a bim bam bomb, to bitty bitty bomb, to bitty bitty bomb. Oh, that hen! She knocked over the door and she began to peck cockroaches. Out of here, you cockroach! Out of here! And the Lisa, she was pecking him down the road to the middle, all the way down the road to the middle, all the way, all the way. Ha 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 ha. Well, and after all, ladies, what can you expect if you marry a cockroach?
We do it island style. From the mountain to the ocean, from the windward to the leeward side.
Welcome to the Dr. John Shaw Holistic Health Show. Okay, now last month we talked about the assessment using facial, actually holistic self-diagnosis. We look at the face, we look at the tongue, the ears, the eyes, the nose, the lips. We talked about the body, and now where do you go from there? Now, assuming that you got into my webinar that I'm doing now, and then you say, okay, where do I go from now? How do I get myself treated once I find this out? Well, you can go to your doctor and see if he takes a blood test or urine test or the regular test and see if those markers, we call markers, are high. Or that's a baseline, okay? Or you can look at your tongue and you do non-invasive, okay, and you look at different signs in your tongue and everything, like when we talked about the assessment. But now you want to say, okay, I got these symptoms, signs. Okay, maybe it's called digestive tract. Okay, then what do I do for the digestive tract? Okay, well, I got to do something with it. Well, I got to see what I'm doing, what I'm eating. Okay, nutrition. Okay, I'm eating too much cholesterol. Want to look at. So that's why we talked about reading labels when you go to the marketplace. Okay, you got to read labels and know what it means. How much sugar? And sugar is the biggest culprit right there. And fat, they emphasize fat, but the sugar is the key because everything practically got sugar, one form or another. And you got to be able to discern about what sugar is good for you. Okay, so the next thing, okay, is so your tongue showed you stick out your tongue and you didn't drink coffee, you didn't drink soda or juice or anything, and you just happened in the morning. Okay, you stuck your tongue out, and you don't have to stick it way out, you stuck your tongue out. And you see in the middle, right in the middle, some red markings there on the tongue. Oh, that's digestion, okay? Well, what about the digestion? Look at your stomach. All of a sudden, are you obese, okay? Are you taking too much fat? So you gotta make some adjustment to that, okay? That's really hard to do, but you can do it. That takes a lot of discipline, okay? So now you want to see if it's going to clear up, because that will clear up those red dots, the red markings can clear up. I have one on my lung, my tip of my tongue on the side, not the middle. The middle on the tip is the cardiovascular, the heart. And both on the side, I had one red dot on my left side, and I said, what is this? Okay, and that's lung. But I've been having some congestion after I had the stroke. And I was saying, wow, I thought I took care of it. So you want something to speed it up, not wait like 3 months or 1 year and take a supplement. They say, oh, how come this thing not clearing up? I'm doing good digest. You might, as we're going to expose you some alternative devices that can help you speed up your treatment, okay? Speed up the body healing itself. And that's what I'm going to be talking about. So we're going to show you the first slide and about the digestive tract and its relations. So this is one of the things I'm preparing a lecture online, you know, and it shows you every different organs. For this one, it's the stomach. If you look at that, you see the arrows pointing out to where on the face on the lower left, you see the arrows going down. You can tell what part of the face might be red or might be, you know, deep wrinkles and everything. And you say, oh, that's structure. But no, there's something coming in the stomach. Then you check your stomach. And you say, yeah, I do have upset stomach. I may have acid reflux. You know, I can't digest well. I don't have a good bowel movements. I get constipated sometimes. Then you're going to look at the deeper cause, because you short of taking drugs, you know, that might not do it, just temporary. Then you look at the left and you can see, you can hardly see the fingernail. Okay, you might see fingernails. And you look at ridges and you say, oh wow, you get ridges. I didn't know that. People don't look at the fingernails. Or the luna called moons on your fingers. 4 of them maybe have moon, a healthy person, a thumb and 3 fingers. But the pinky finger shouldn't have any kind of moon in there. But if you find, moons are missing, that tells you something, okay? Now you look up the upper left corner and you see tension. That's emotion. Just by the grimace on the face, the facial expression tells you what kind of emotion the person goes. You get a lot of stress, and you see it on the face, okay? You just gotta observe it. Now, like I told you, you might just take a picture of the person's face, the tongue, the ears, and the body, you know, or just take a face and then the tongue, and be able to look at it, match up one of the charts like this if you're on my online webinar, and then you see, oh, that's related to this part. You might have it checked further by your doctor, you know, and then see what he says, okay? Or if you take a blood test and it corresponds with this, and you say, wow, that's more in an advanced stage, okay? You want to get in an early stage called prevention. Now, you look on the top graphs on the top, and that's, you see that I got that pointed out to the different vertebrae. Where is it? Well, do you have a subluxation in that particular vertebrae? And what does it mean? What is it related to? Then you look at the upper right and you see the body stomach. There's something in the body that may show you some kind of markings on there. And then you look over there with the hands, and so Korean acupuncture, and then also reflex, hand reflexology, and you take a certain part of the hand and you palpate it, you press it, and you say, oh, a little bit sensitive there. And you say, is it related to the stomach? Yes, or the teeth. And you're going to point out to certain teeth related to the stomach. Maybe right now, first and second molar or something. You see, that's related. And then you're talking about if you want to be down to Ayurvedic or Chinese medicine, and you see the relationship maybe with Voll, Dr. Voll, who's a German physician, found electroacupuncture by Voll. And that is related, the stomach's related to certain teeth and different chakra. We did a lot of research on that. Then on the bottom one, you see it's related to what? The tongue. Right in the middle of the tongue is the stomach. And you might see red blotching, or maybe a deep groove with different colors, maybe a crack with different colors, you know, color there. It can be purple, can be black, can be white, can be, and all that means can be indicative of something happening, okay? That's a clue, okay? So if you take the right supplement and do the right thing for the stomach, all of a sudden that particular color or that coating will start to clear up and be more pinkish. And you can say, wow, that does it. And you feel better to begin with, okay? So the next one we're gonna do is ritual. Okay, so we got some biofeedback equipment, okay? And I use that as, to the lower right, you can see like an iPad on the right hand of the screen. And that's the Quantum Infinity Pro. And then we can scan your body for all kind of stress-related things and find out cellular distortion of frequencies, okay? And we can see that. And we match them up with different frequencies as normal, and then you see, oh, that's out of balance. So you're talking about energy, frequencies, okay? We're not talking about finding out toxins in there like the physician. They do use a blood test and everything else, but we're talking about frequencies. So you can find out a prevention manner before the thing manifests into a disease. So the person has some earphones on, and the earphones get sound, so we use sound. They know that sound, different types of sound can create different vibrations in the body. People get healed by sound, okay? And then you're sitting on a mattress. You see she's sitting on white sheet, and behind that is a mattress. And that's connected to the device in the back. And while she's watching what's going on, everything we do on the iPad, on the Quantum Infinity, is shown on the 27-inch screen. So she's looking at like a hologram. And she can see all the waves going on, and the brain picks that up, okay? It picks up color, picks up sound, picks up dimensions, okay? All kind of dimensions. So you're getting all kinds of, then you also analyze the name, each, you know, just like it's not quite numerology, but it's almost like that. It's called Kaplan, okay? You measure the numbers of frequency, and it all goes into algorithms, formula. And then it indicates what conditions you may have. And that's just clues. We're not doing a diagnosis, it's just clues. So further, you can go back and check deeper into that. And we have some, what you call, formulas for that. And then if it comes up, then we test it with the traditional and say, hey, it matches, okay? It matches. And then could we reduce those traditional blood profiles, readings, you know, cholesterol, LDL, high blood pressure going on, okay? So this is just one way of doing it. This goes really deep, and it's like a biofeedback equipment, okay? So the next one we're gonna show you is, again, talking about stress. So we do different kind of techniques where we tap into an acupuncture point. That is called the comprehensive hemogenesis technique, 1+9. We do that to remove stresses from, go back for regression, go all the way back to your past and to the present and your current status, okay? How is this stress or these emotions locked into the right brain from the left brain, okay? What stimulates it through the sound, through your seeing, through your taste, through your smell. All these senses go into the amygdala, goes into the thalamus, the hippocampus rather, and then from that it goes over the body, and you interpret it as the intensity of pain. Okay, how does it come from an area where you had injury, and it goes up to the brain and back? So we track everyone through acupuncture meridians and find out where the block is on the acupuncture point, and we'll be able to unblock the block acupuncture point, and then we can release the distorted frequencies going up to the brain that interprets it as pain, okay? So these are a little complex, but we have biofeedback equipment that can help us, assist us with that, you see? So I'm showing all the different alternatives you can do. So we're going to show you the next one, okay? And there's the brain. See, if you look and study the brain, all parts of the brain mean something. They indicate something. The back of the head, sight, the side above the ears, hearing, memory. You go ahead and you talk about the front part of interpretation. You're talking about memory. You're talking about the side of the head, okay, or where the pain is all of a sudden felt. So sometimes you get up in the morning and say, oh, I got this pain on a different part of the, say, let's say, right shoulder. And you didn't have any kind of injury that you remember going back to your childhood. Well, how come? Maybe I slept, and you say, oh, I slept wrong. Well, maybe the brain got that frequency up and it goes into the brain, and the brain interprets it from past histories of maybe you strained it and you didn't know, you shook it off when you're young and everything. But all compiles itself, and all of a sudden you feel it. Wow. And then if you do all of this different exercise and everything, maybe it feels better, but it's not quite getting rid of it. It keeps coming back. Okay, so you got to go to the brain and desensitize it, neutralize that memory, and all of a sudden the brain says, no, I don't have anything because I can recognize that as pain. And then the thing goes away, okay? And the big thing is it stays away. That's the main thing. You don't bring it back by just voluntary thinking about it all the time, okay? So that's the thing. Okay, so we go to the next part. I see how part of the brain. So now I'll tell you about the facial expression. You know, these are only 2 of them. You get about 6 other ones. But, you know, contempt, where do you look on the face when somebody show contempt? You know, we point that location out, right by the side of the lips, okay? Or disgust, okay? We look at this and you say, how do you know the person is responding to you? They might show you contempt or disgust or anger or joy. What part of the face, where is that you can see an expression on that side of the face, okay, that shows you? That's an indication. Everything is clues. You're looking for clues, and you're going to find out, okay, why is he getting contempt? Why is he getting disgust? And then you go back to the brain, you track it back to the brain signals, and you find out that maybe you can change that. Maybe you had disgust because they had bad experience. Now we talk about dentistry, the next one, okay? Look at the tongue right in the upper right. You see all types of tongue. You get coding, the black tongue, geographical tongue. So you say, oh, that's a lesion. I got to watch out. And maybe a few days, the lesion moves. That's a geographical tongue. What's it mean? Okay, maybe you get a white-coated tongue. Okay, maybe you got some kind of heavy mucus from that, or maybe you get some kind of fungus or thrush, they call it. Okay, and you might see black tongue or groove tongue. And look at the fingernails on the left. You see, then you might see some coloring, dark coloring over there. You say, oh, that's osteoporosis. About the one about the lower, where the fingers are, that might be jaw bone loss. And look at the gums, okay? So you look at the gums, it's swollen, okay? That's poor oral hygiene, okay? So you try to teach them how to do better oral hygiene, and you clean the calculus and plaque out, and you wait about 10, maybe over 10 days. And then if the gums don't completely heal, look at it, you know, then maybe something else is causing it. Maybe he got diabetes. Okay, too much sugar. You gotta ask him, what is his diet on sugar? Okay? And then you look at the lips, and then you take the frenum, because the upper lip, and you see a little tumor there. And you say, what does that mean? You see maybe a couple of them, and you might be multiple colon polyps, okay? So you take, if you want to check for sure, you do a colonoscopy, and you can find, wow, you find that you got polyps in the colon, okay? But it shows there. So if you do it another way and do good nutrition, good diet and everything, and all of a sudden this thing kind of dissipates. And you say, wow. And then you go ahead and maybe take a colon if you're curious, and colonoscopy, and then you find out maybe the polyps are not so big. They might be still there, okay? But it's going to take a while to clean it up, but you can do it, okay? So these are what we call self-diagnosis holistically, okay? So you're more in control of your own health, okay? So people are interested in that. They eat more vegetables. But what kind of vegetables? Even flax seeds might be bad for what we call angioma, okay? We found that out. Too much estrogen, okay? You can get, that can mean cherry angiomas can mean you get something wrong with the liver, but also you may too much estrogen, low testosterone, okay? So they give you clues, you know, it's not absolute, okay? Absolute is, now, if you take the right diet, the right supplements, all of a sudden that thing clears, you know that's the right thing. If it doesn't clear, maybe you got to do something different. I give you a clue what to ask the doctor, what kind of test you ask, so then he can check it for you and see if you really got it, okay? So, go to the next leper. Okay, and we talk about dentistry. Look at, I told you about the arches. You look at the upper left, you see how narrow the arches? And you look at the upper arch, because if the upper arch is too narrow, then it's compressing. So people have a hard time breathing, okay? Because it's too narrow there, the space, you see? And the lower teeth got to fit against with the upper, and then it affects that side of the face which is narrow. You're going to see a configuration on your facial features, cheek and everything, might be more inverted inside. So again, look at the upper teeth on the upper right, it's crowded, right? Like you say, oh, you need orthodontia. So traditional people would say, okay, let's take out the bicuspids, create room. Well, we've been taught holistically to widen the arch, no big deal. Okay, widen the arch with appliance. And it might take a rapid arch expander, might take only a few weeks or maybe a month and a half, and you widen the upper arches, then you widen the lower arches, and then the person is going to breathe better because the palate's wider, and the face will help form, and then the muscle won't be contracted so much, and you get a chance for later on get wrinkles because you're losing, because the muscle is always in hypercontraction, and it goes on the Golgi tendons, and then what happens is all of a sudden that tension is released, so there's less chance to lose collagen and hyaluronic acid, okay? And the bottom, so if your bottom, if your teeth, you say, oh man, I'm biting something, and always hitting one side, was sensitive. So the dentist put this blue paper in marking paper and they tap the teeth, and then he grinds on the spots, see if you're sliding. Okay, before you do that, maybe you want to get your muscles in totally relaxed position, and you can do that, the masseter muscle, temporalis muscle, you know, pterygoid muscle. And once you balance that out, then if you still got a high spot because the muscles are balanced, then you can go ahead and do occlusal equilibration. They call occlusal at the top of the teeth, and you equilibrate it for high spots, okay? I ever thought that when you put a second molar crown in there, that was always high, because the temporalis muscle is stressed. You see, people, even a lot of dentists don't know that, okay? And then you hear big grinding on the second molar. If you put a porcelain crown there, it chips. It always chips, so now we put gold crowns in the second molar because you see you can grind off a little bit of the high spots. But on a porcelain thing, when you grind that, you got a abrasive surface. So you don't want to do that too much, okay? So, or the person might get tenderness when he bites on a hard object. See, like the middle slide, the person says, oh, I got sore teeth because I bite on this. I don't know why. And the dentist take an x-ray and you don't find anything, okay? You look at the lining of the tooth, periodontal membrane, and he see maybe a thickening there, but he doesn't know why, okay? So he might give you medications. Medication is not going to do anything for you, okay? So eventually that tooth gets traumatized and might die, and you say, okay, you got to put a root canal. Well, I'm against root canal, okay? Because it can cause toxicity to your colon area, or sigmoid flexure on there. So I don't like that, okay? So let's take the preventive way and look at what causes these high spots rather than just grind them out. I did that when I first practiced. I didn't know any better. But now, as I went over the years, I've been practicing over 54 years, and in 40 years it's been holistic. I found a lot of things that I thought I knew, learned in traditional dentistry that I had to change, and I saw things happen. Okay, so next one here. Okay, again, I talked about nutrition. Look at this person. She's happy because she's eating the fast food, the French fries, the hamburgers, the Cokes. And I went over that in my previous shows here about, looking at reading labels, what eventually the obesity will catch you up. It's not the superficial obesity around the tummy, it's the deep visceral that goes around the organ that you're worried about. That can cause you a lot of chronic problems, okay? Yeah. And then we go to the next one. Yeah. Okay, and there's a different acupuncture points, and you see on the upper top, we use sound vitality. Those are sound waves. We put them on, instead of poking a needle in there, we use sound waves. So it's non-invasive, okay? That we can do all different acupuncture points or traumatic points. That works good. And finally, we talk about posture as you're getting old. You gotta watch your bad posture, and we can direct you to being, instead of resistant exercise, lifting heavy weights, we do light energy movements, and that will help you quite a bit and put less stress on your body, and you can find out the source, and you can slow down the aging process. That's what we're looking for, slowing down the aging process. So all these things, I just give you clues. These are clues. These are alternatives. And what you can do is look at the last month's show and this month's show, and you start putting them together. Capture on your DVD or computer, and then study it. And when you do that, you're going to find out that there are some alternatives. You can speed up healing, and you'll be better, healthier for that. So we're going to be seeing you in about, let's see, maybe a couple months from now, and we're going to go to another topic more on how you treat yourself, okay? Now, I said that you should be checked by the doctor to make sure everything traditionally is right, but doesn't mean that the doctors are wrong. No, I didn't say that, but you can look at clues. Clues, self-diagnosis to help your body and see if you're giving you a drug, does the symptom clear up? Does the, you can monitor that. If it doesn't, if something else comes up, the thing has a secondary effect on you. Okay? So here is something that you can actually go online, and you can, if you're very studious, and check all these out. Okay? But to then, I bid you a happy life and a healthy lifestyle.
Is no less than any other family.
My heart doesn't see race. Even love is love.
Did you know the Norfolk pine found on Oahu's mountaintops are there due in large part because of President Theodore Roosevelt's conservation efforts to address soil erosion? Now you do.
Honestly, dude, I did the most shocking thing today. It was just something I never thought I'd do.
Did your parents find out?
My mom cried.
What'd you do?
Programs airing on Olelo Community Media's channels are presented by independent producers in the community's interest. The opinions and views expressed do not necessarily represent the views of Olelo Community Media or its management.
We do it island style. From the mountain to the ocean, from the windward to the leeward side.
Hi, this is News and Views. Thank you so much for joining us. My name's Renee Ng, and with me today is Keone Dudley. Thank you so much for coming on the show again. I appreciate your coming all the way from Akakilo to come on this show.
My pleasure. My pleasure.
Yes, and this time you're running for city council. I'm so glad, I'm sure a lot of people who are viewing this show know your name and have followed you through the years. But for the few people in Hawaii who don't, could you give us a short bio?
Yeah, I've been around a long time, I guess. Well, briefly, I live in Makakilo. I bought my home there in 1979.
Wow.
When the area was surrounded by sugarcane.
Mm-hmm.
It's right in the middle of District 1, which is the district I'm running for city council.
Mm-hmm.
So I've kind of seen everything develop. I know why things happened and how things happened, and I've been on the neighborhood board for 18 years now. I've done a lot of things for the basic members of the community. Fighting for them, and I've also
And for everyone, when you fight for against Ho'opili, actually you're fighting for our food security.
You're right about that.
Mm-hmm.
You're right about that. I founded a group called the Friends of Makakilo. As their president, I was the intervener at the Land Use Commission in the fight against Ho'opili. We won that fight in 2009, and I have an old website that says I won the fight, but they came back and we lost in 2012. I also have an organization called Save Oahu Farmlands, Save Oahu Farmlands Alliance, and the two organizations have about 1,000 members each. We'd have an awful lot of alliances with environmental groups, food groups, people who just are concerned about what's happening with with our island.
Mm-hmm. And because you're concerned, you're running
for
city council again from District 1.
Yep.
So, from the whole range of stuff that you've always worked on, you have to pick three.
Okay.
The most important three, because we don't have that much time on this show. So, what do you think is the most pressing issue that you would like to address while on the city council?
Well, there are two, and they are intertwined. The first is gentrification, and the second is traffic.
And gentrification for the 12-year-old watching this show means?
Well, it means that you begin to start building for the rich, and you begin to change things for the better, for the modern better, but you sacrifice the past, and
sacrifice the quality of life we had in the past.
That's right. I mean, we have begun to focus so much because the unions and developers and big landowners are so much in charge of our government that they bring people into the government who are their pawns, and then everything begins to focus on doing more for people who have money, and we find, as Bernie Sanders says, that there's the 1%, and there's the rest of us, and the rich getting richer and the poor getting poorer.
Yeah, and so they're luring in the richer people to come here, and we get kicked out.
If we just take a look at Ala Moana as an example, all of a sudden now the Sears is gone. That was our store.
I know, Penny's too. I went to Sears and Penny's all the time.
I know. And Sears was, when it left, it was the biggest Sears in the world, the highest producing in the world. And we sacrificed that for Bloomingdale's and Nordstrom, and those stores aren't for our people. And we got Neiman Marcus, and that's not for us. And in between, I mean, how many shops are there that are for our people?
Fewer and fewer.
Fewer and fewer. If you go to that the midsection of Ala Moana, it's surrounded by stores that have guys meeting you at the door dressed in tuxedos.
I know. It's selling clothes I would never wear.
Yeah, and so we're just we're building a $10 billion, $15 billion rail to go to Ala Moana, but that's not our shopping center anymore. When we come out to Ko'olina in my area. Ko'olina for years was shut off to the people. They couldn't get in the gate.
Yeah, only tourists only.
Yep, and we had a little parking place here, a little parking place there, and now it's wide open because it has to be. But they're going to be building. They've got a new Four Seasons there. They're going to build a huge complex for very, very rich Chinese, and what happens to our people? We're going.
You get to be servants. You get to be serve
servants.
them.
Yeah, so
that's the only kind of job you're going to have now.
So we built a $10 billion rail going through. The last 5 stops are going to be underwater in 30 years. Ala Moana itself is going to be underwater, and
they know it.
And they know it, and they want us to pay for it.
Yeah, once they develop and they sell and they take their money and run, do they really care?
No. No, and then they're going to extend the rail for sure on out to Ko'olina and charge such high prices for passage for people to go from Ala Moana to Ko'olina. Come on, give me a break. It's time to call a halt. Time to say it's time to take back our government. It's time to take back our island, and it's time to take back our lives.
And that's why you're running for District 1 City Council.
Yes.
Yes. So, with that, Rosie. Scenario. Shall we move on to traffic?
Sure.
And actually, for guys from your side of the island, that's no laughing matter.
It's no laughing matter.
Jeez,
it really isn't.
It was very interesting what you were telling me about how the development out there affects the traffic.
Well,
can affect the traffic.
Yeah, we're at a point right now where the H1 H2 merge is the problem. It has 5 lanes. It can go to 6. But by law, the lanes have to be 12 feet wide. But in certain small areas, they can make them 11 feet wide. And so there's 70 feet between a set of pillars here and a set of pillars there. And there's nowhere to go, And they can move another. They can make the lanes 11 feet wide and have just a 4-foot shoulder, and so they could possibly get 6 lanes in there. However, and then they're going
now
to. And now they have 5.
5. They can get 6 lanes in there. Okay.
We also have a new zipper lane and a second zipper lane that's going to open in August. And so there's a chance here for relief. What we have to realize is that there's also a chance for disaster, and we're headed for disaster. Now, with we've got 71,000 new houses already zoned out there.
Can I make a comment before you move on?
Yeah, sure.
Every time they build more lanes, you have more cars to fill them up. So, therefore, moving on to the actual development of housing, where the cars come from, I give it back to you.
Okay. Well, that's the problem. Our neighborhood board, at my instigation, passed a resolution demanding that the Department of Planning and Permitting stop building houses in Central and Libre Oahu until we can get our freeway back up to, livable. Livable is what they call level of service D, and that means that it's crowded and it's slower, but it's still not stop and go. It's free flow.
So we have a D grade D.
That would be desirable. Right now we are far into F, and the plans for the Department of Transportation are for us never to come out of F, but only to get worse. Now, we stand at a point, though, where if we were to stop the development right now for just a couple of years, and if we were to get that extra the zipper lane and the extra lane in there, we could accommodate our people. Now, think about
Our present people.
Our present people. We're saying stop building out there now and just accommodate our people. Think of what that would do. Right now people are taking an hour extra to go into town and an hour extra to come out of town, and that's just to Kapolei, add an hour to get to Waianae because of the terrible disaster out there right now. But, that extra hour, we could dissolve that, and we could get them down to 20 minutes during the daytime when there's no traffic, 30 minutes to 40 minutes at the most,
Okay, say this again slowly. If for the next 2 years you work on the housing traffic solutions
Yes.
of getting an extra lane
Yep.
and the zipper lane,
Yep.
you could at least bring the traffic situation for the present residents back to, say, grade C instead of D.
Oh, no, we'll never get to see. Now what we're talking about is the rush hour traffic.
Yeah, rush hour traffic, right.
Okay. And so rush hour traffic nationwide, it's accepted that D is the accepted level. But D is not bad, D is still moving, Right now, there's a 4.5 mile backup that takes an extra half hour to get through.
Oh my goodness.
What if that wasn't there? What if you just kept on moving through there 3 minutes, And that's it. We could add so much quality to people's lives by getting the traffic back into shape, and now is the time that we can do it, and we must do that, and that's why I got to get elected.
Well, if you get 2 years to work on the traffic solutions, you're basically saying we need to put off the housing, the construction right now, so that you don't keep on adding more cars.
That's right. That's
to
right.
The traffic gridlock.
That's right. And our EVA development plan gives us that as an adequate facilities requirement. So it requires that.
Oh, really?
Oh, yeah. But they our politicians are all bought, and so they're just doing what their buyers want them to do. And yeah, well, it's the truth. It's the truth. So right now, we could do that. We could get our traffic probably back up to D with just the freeway itself. And we've also got the rail or a substitute that is being built. And, we're going to have a guideway and use something on it. And that will further relieve. So when we finally get our traffic up to the level of service D, we could, at that point, we could let people start to build houses again, as long as they kept it there. We're talking a couple of years. It may be 2, 3 years. It could possibly stretch to 4. But the Department of Transportation, their number one priority is to do that freeway extra lane. And they're fooling around right now saying that, they don't have any money from the legislature and they have to cancel all that stuff. But that's pretty much baloney. And we can just, keep pushing them to get working on that lane.
You apply for federal funds and you go and get them. I thought that's the way it worked.
and to use them.
And to use them, yes.
But they don't seem to be too anxious to use them. I mean, they're saying it was going to cost $230 million to build that extra lane on the freeway. But they've got twice that amount sitting there unused. And so, it's all just baloney. I mean, let's get going on reality here, guys.
Yes.
Okay?
Yeah, I feel sorry for you guys on that side of the island, man. Whew,
I do too.
avoid that traffic as much as I possibly can.
Now let's say that Dudley is not elected, okay? And let's say that everybody just goes along doing their own thing, and all of a sudden we have 71,000 houses. Let's say we get our extra lanes on the freeway. That can only accommodate 12,000 out of the 71,000. That leaves us 59,000 people. More people. Now, but they're all going to go on the rail. Rail could accommodate 28,000 only.
And on top of that, you ever watch HGTV? Come to Hawaii, HGTV?
Yeah.
Yes, and not only they kind of make it's for local people, we need to have these houses.
Mm-hmm.
But then they're going, come.
Oh, yeah.
Yeah.
25% of our houses are built for people who don't live here. Mm-hmm. And we aren't reproducing ourselves right now.
That fast?
No. I mean, we're not even reproducing ourselves. We are below the average for normal reproduction.
Well, I thought it was partly because so many of us went out that our local population stays fairly stable.
We do lose people, yes.
Yeah.
Okay, but the reality is that as far as reproduction is concerned, we don't have enough babies being born to replace.
Babies.
Yeah. Okay. The other thing is that where we are suffering is that older people like us don't give up and die. And so we need houses for us old people. So some of the building is for old people. There's no question about that.
Yeah, but I have to put in my plug here. If I'm old people, I don't want to live in Kapolei. I want to live in town, which is where I live. I want to live in an apartment where I don't have to do the yard.
Okay.
So anyway, I wish there was more housing development in town.
And that's smart.
In apartments.
And that's smart. And people will live in situations like that. I'd see. Okay. We're doing a little microphone adjustment here.
Microphone adjustment. Oh, the phantom pass.
Okay.
The phantom passes. Uh-oh.
Well, if they haven't heard a word we've said already, let's start all over.
Gosh. Okay.
So at any rate, what I did want to say though was I wanted to continue on with the idea of if I'm not elected and if people continue to go on with the plan, then we're going to have 71,000 houses out there, and the freeway can take 12, which is 59, and then the rail, if the rail came in, could take another 28, and that leaves us 31,000 people without a way.
So you still have gridlock.
And we're adding 30,000 cars onto what we've got right now, and that's just insane. So what we've got to do is realize that we can never build those 71,000 houses, period, if we're going to have normal lives. Now, who are we living for? Who are we paying taxes for? Are we paying taxes for us or for developers? Are we making the lives of offshore developers happier at our own expense?
Yes.
Yes.
That's nuts.
And shouldn't we have somebody in there who's going to make our lives better? Who's really going to pay attention to us first?
Right.
And so that's what we want to do with traffic.
Good.
And it must be done.
Yeah, well, just if you could just explain this to people loudly and clearly.
Yeah.
It would really help because I I'm just so sad for what's happening to Hawaii. I really am.
Me too.
Yeah.
Me too.
And well, we have a few more minutes here, and the third topic we were going to talk about was the rail, mass transit.
Good. Let's talk about it. Okay. We might even have time to throw in farming and
farming.
sea level rise and desalinization and things like that. Okay, but yeah, let's move
But the
on to
hot
rail.
topic right now is the rail.
Okay.
The expensive rail that has all the problems the people who were against it were saying from the beginning we were going to have. It's not like we didn't know these things, folks, and now they all are coming to pass.
Yeah.
Yep.
And it's really sad. You know, I do want to say that if we are going to continue building out on the west side, it's pretty clear that we need some way to get to town. It's pretty clear that we're going to have 28,000 people that need a way to town. Actually, we're 58,000 people who need a way to town. And rail was supposedly going to take care of 28,000 of those. Now, we need something. So I've kind of changed my stance from being vehemently opposed to rail to saying, okay, we need something. And what I feel is that we need something up on that guideway, whether it's a rail, or whether it's maglev, or whether it's buses.
Oh, wait a minute.
Okay.
I gotta get on my soapbox now. Can I?
Yes.
Can I tell you what I think?
Sure.
It needs to be buses.
Okay.
We can use, according to Panos Providores, we can use that elevated with buses, and they just have, the buses are the same old buses we have, and they just have these little attachments to keep it on the guideway. And then when it comes down off the elevated, then you can just run on city roads. But the thing is that bus rapid transit around the world has increased bus ridership tremendously. I think in Curitiba, Brazil, the last time I read, just several years ago, it increased their ridership by 150%, because here you are tootling along on your dedicated bus lane. Cars cannot go on it, so you're right to where you're going. You're getting there fast, watching all these little guys slowly crawling along on the freeway. And because of that dedicated lane that bus rapid transit is on, which does not get, crowded with cars and slowing it down, it's just a whole much nicer way to get into work or school or whatever it is than regular buses.
Okay. I could be perfectly happy with that. What I really do insist on, though, is we've got to get them into town. I think where we disagree is you would like to see things stop at Middle Street, and Panos would like to see things stop, and there's a nice article in the paper about that too. But I would like to see that everything get to Ala Park at least.
I don't care, just let me have bus rapid transit.
My feeling is that we're going to keep on building for people, and
whether it's housing or transportation, it needs to be for our local people.
Okay. The truth of the matter is that our freeways have been very improved in the last several years, and I remember when Linda Lingle was governor, and she said that, we're going to widen the freeway in town, and I said that's an absolute impossibility, but we've done it, and we've got an extra lane, and things do move. We still stop up at Bishop Museum, but things move pretty well up until you get there, and then it's tolerable coming into town. It's not going to be that way once we can build more houses and have more cars.
And have more,
And so My feeling is that it's going to back up like it used to, all the way back to Moanalua Valley, and
If you have all of this housing
that's right.
in the next few years.
And so I want to see an elevated whatever go all the way into town, because I know that if we get into buses there at Middle Street, we're going to be in the midst of that traffic, and it's going to take another half hour into town. And see, our people might be coaxed onto a bus to get into town, but they're not going to be coaxed onto a bus to get to Middle Street and then take another half hour to get to town. So whatever way we work it, we need to get them into town. Now, we were talking before the show about having a dedicated lane. Do you want to talk about that?
Well, I did briefly mention that Bus Rapid Transit has a dedicated lane so that all of the gridlock from the cars does not slow it down. So that even though it goes into town, it would have a dedicated lane so that they don't want to stop at Middle. I'm only saying Middle Street because that seemed like, because it's a bus transit point to all different parts, seemed like a common sense solution. But if they can work it so that with that dedicated lane only for Bus Rapid Transit, that means that actually somebody was saying that her mom lived in Waianae and worked in town, and in the middle of the night, early in the morning, when there wasn't much traffic, she got into town in half an hour from Waianae. So we're talking whoosh. Yeah, so if it, from Middle Street, once it got off the elevated and got onto the, at grade road level, and it still has its dedicated lane, it still would have the advantages of Bus Rapid Transit.
Okay.
At much less cost.
I could live with that if there was a dedicated lane. But I would want to see the dedicated lane be a lane that goes all the way into the city, and I would like to see that before I would sacrifice stopping at Middle Street.
Well,
in other words,
throw it into the mix.
It's got to be.
Throw it into the mix.
We've got to have a way to get all the way into the city.
Yours is the voice of somebody who lives out there.
That's the exact truth.
Yeah.
And
you drive this all the time.
and people, the people who want to stop at Middle Street don't remember what it was like.
Well, I don't live out there for a reason.
Yeah.
Uh-huh.
And so we've got to make sure that our people are going to ride it.
Right. Oh yes. Right.
And the truth of the matter is that we can't just stop building all houses. I mean, we can stop for a few years, but we are going to need more houses for our people.
Yes.
We don't need as many as we got. For instance, we just last year had the Department of I think it was DLNR came out with a statement about how many houses we need over the next 20 years. We need 25,000 more new houses on Oahu. Well, we've got 71,000 already zoned out in our area alone.
Yeah, because we're telling the guys from other places, come.
Yeah. But we only need 25,000 houses over the next 20 years. Well, it's not it's not like it's the end of the world and everybody has to have a house today. It's just it's something that is manageable, but we need to get things under control. We need to get our lives back.
Yeah, and as you said, what are we doing with our lives? Are we doing what is good for the developers, or are we going to be doing what is good for our people?
Yeah.
Yeah. And in the last minute, Keone, thank you so much for running. And would you like a closing statement?
I think that I am really concerned about the fact that people sit in traffic and they pay an extra $3,000 a year for doing just that. That's what the statistics say. And we talk about homeless. Well, if we double the traffic, we're going to double the homeless because it's going to cost $7,000 a year for people to sit in traffic. And nobody's going to be able to afford that. And we're going to have a terrible, terrible problem. So we need to get people in office who are going to be thinkers, who are going to look into the future, we're going to see what's going to happen. We're going to do something for us.
Our people.
For our people.
Yes,
Yeah.
not for some offshore developers who only come here to make money off of us.
That's right.
You know, then thank you very much.
Thank you so
I
much.
shake your hand.
Great being with you.
Yes. Well, all the way from Makakilo, Keone Dudley, running for City Council District 1. Please consider him when you vote.
Thank you. Please.
Well, okay, this is the best part of the show when it's all Paul.
Did you ever wonder when the flower blooms? Well, plant biotechnologists have figured out that it's actually the plant's leaves that determine when the flower's gonna bloom, not necessarily the flower itself. And other factors are the weather, water, sun, and the temperature as well. Did you know?
We do it island style. From the mountain to the ocean, from our windward to the leeward side.
Show us your muscle. All right.
Come on, let's get this video.
Oh, this is a video.
Curl the shotgun. Curl the shotgun. Jack LaLanne.
And 3.
Jack LaLanne. Wow. We are very honored to have John LaLanne here today at the Bragg exercise class at Waikiki Beach, Honolulu, Hawaii. And I'd like to introduce John.
This is in honor of my father. We're going to jump across the world. Michelle Obama has done such a great job organizing this, and we're going to show you our stuff right now. Here's to Dad. You've actually made health food taste good now.
Oh,
thank you.
Thank
we
you.
praise you.
Thank you. Well, it's wonderful that, John, that your dad has you to carry on a lot of the heritage and the legend. You will be a legend.
Well, I hope so. We just want to convey the message of eating natural foods in their natural state and obeying nature's laws. You can't go wrong. Right?
That's right.
You can't go wrong.
So it's an honor to have people. We have people from Russia.
690 on
Here's Dan from Russia.
Disturbia.
Yes, so we're very happy. And we have people from all over the world that visit our class here. Now, where are you? All of you?
Yeah, we're all on one team, the volleyball team.
Which team from Canada?
We're from Canada.
What's the name of the team?
Ward Tweedsley. Just outside Vancouver. Near Vancouver. Yeah.
Oh, I've lectured in Vancouver.
Just in
done radio shows. My publicist in Vancouver. Hey, Jack LaLanne's son, John, his show used to come to Canada.
Let me brief you. Your parents know who my father is. And he had the first exercise show in America, and it was on the air on network television for 30 years. And all your mothers and fathers probably got up and exercised with my father, and he inspired Richard Simmons and Arnold Schwarzenegger, and you're part of this whole deal today. We thank you for coming. And how do you like my setting and my games?
That's his favorite woman's sport, is volleyball.
It is.
It is.
No lie.
Especially women's.
Yes. He loves it.
3, 2, 1,
go.
Wow! Wow! Jack LaLanne!
Jack LaLanne!
Jack LaLanne!
Woo! Yes!
Come on, Becky.
No, it's not a minute yet.
We're not done. We have 17 more seconds. Keep going. Keep going.
Oh, 6, 7. Yes.
7.
Jump.
5, 4,
3, 2, and 1 more.
You are a miracle. I believe that. My name is Leslie Gill, and I'm producer and host of today's show. And today we're going to be talking about feet with Dr. Patricia Bragg. Why are our feet important to take care of?
Well, you saw John LaLanne, Jack LaLanne's son, doing the jumping jacks that he started, jumping up and down on your feet. Your feet are your foundation that carry you through life. And we kept Dr. Scholl going to almost 100, the famous foot doctor.
Really?
And he said that I have the most healthiest feet he's ever seen. I've never had a bunion, a corn, or an acre of pain, Leslie.
My goodness, that's miraculous.
And we inspired Eunice Ingham to write the story the feet can tell.
Doesn't she do reflexology?
She started reflexology and zone therapy.
My goodness.
Eunice Ingham. And she came to my father's lecture when she was 18. Oh, in Florida she was living. And we lecture every 2 years in Miami. And she came backstage. She said, oh, what can I do for my grandmother? Her feet are like cement. She's in pain. She can hardly walk. Dad said, use your thumbs and massage the bottoms of her feet. And every one of you out there should put your foot in your lap when you're watching the telly and massage the bottoms of the feet. And those of you that have athlete's foot, you soak your feet in the Bragg Oh, guess what? Apple cider vinegar.
Really?
It saps the athlete's foot, nail fungus. People get rid of it. But hot and cold water on the feet and then massage them with your thumb. See, you have crystals and toxins. They lodge in the feet, the bottoms of feet.
And the hands, too?
Yes, and the hands and the ears.
Really?
I massage my ears every night. I go in all around, massage, and I massage my hands. People come to me and say, "Oh, my hands are so cold." I said, massage them, and just like your feet. Now, I get up. Remember, I'm 5 feet tall, 95 pounds, and guess what?
What's that, Patricia?
I do stationary jogging, and I have 5 and 10 pound weights near my telly, and I use the weights. My busts all stand up by themselves because I'm doing the bust exercises.
Amazing.
Woo, woo, woo. And all of you gals out there, you do it. And now, guess what? Stationary jog. For every half hour, you sit at your desk, get up, or you sit in front of the telly, get up, do stationary jogging. Circulation to the body is so important. Feel your nose. Is it warm? Guess who's pumping the blood? Your heart. See, feel your ears. Are they warm? I hope so. Because your heart is your major pump. And you have 2 more pumps here, your arms, and 2 more pumps for your legs.
Now, you're saying to get up every few hours. What about office workers?
All right, listen to this. We have at the Bragg headquarters in Santa Barbara, California. You can go to bragg.com is our website. And they can see the desks go up, down, down. Would you tell them about that?
Sure. Can we hold this book up right
Yes,
here?
it's in the Bragg Heart Book. And guess what? We'll put it up on the website, bragg.com, and you can see the desks that go up and down, up and down. They're very inexpensive.
May I see?
And they're putting them in a lot of offices. And also, I have, guess what? I have 3 desks. Guess what? I've been Bragg Live Food Products. Live foods make live people. You see, that's what my father named it. Keep your life as simple as 1, 2, 3.
So they need these in offices so they can sit and stand?
Yes, so
That's
you can
wonderful.
get up, and if they won't get one, then you just automatically stand up. And on your break, you can do stationary jogging. Just go up and down, barefoot. And by the way, I have a little sign. Please, no shoes. I have little paper slippers they can put on.
At the office?
Yes.
That's wonderful.
And there's no reason for you to wear shoes. Oh, that's like putting your feet in a prison. In a prison. Now, let me show you this. This is the Bragg windmill exercise. Woo, woo. I have millions of people doing this. Look, wow, wow, wow.
Looks fun.
Wow, wow, wow. It's wonderful. Brings a circulation throughout your body. Do your shoulder rolls and come to the Bragg free exercise class. Forced Jerusi lawn, 6 days a week, 9 to 10:30. And guess what? You're going to learn all these exercises.
Fabulous.
And it's wonderful, wonderful. No, you are what you eat, drink, breathe, think, say, and do. Words are living. And your computer, what you think, you can become.
I like
that. No negative thoughts. I don't want anything about war, killing, greed. I want a peaceful world. Each one of you, plan, plot, and follow it through.
Plan, plot, and follow it through.
Yes, for a healthy, fulfilled life. No toxic food before you put it in your mouth. Woo! It's going to bring me health or sickness. Think of that. I've had Clint Eastwood for 60 years. Tom Selleck for years.
My goodness.
We have people all walks of life, the rich and the poor. Kept J.C. Penney going to almost 100. Dr. Schul, the foot doctor, almost 100.
Wow.
Your feet carry through life. Be good to them. The shoes that you wear, he said the women that are wearing some of these high heels and all, Oh, you're not meant to walk around on your tiptoes. Be sensible, gals.
What about nail polish?
I've never worn it. Never worn it. Do you know that a lot of girls that were manicurists got cancer?
From the
They were
smells?
breathing all the toxins.
Oh my goodness.
You see,
I believe that.
Do you realize you're a breathing machine? My father and I wrote the book on breathing, superpower breathing. Yes, we have Bob Anderson, the leading stretching coach, and he taught the Bragg superpower breathing exercises all over the world. Bob Anderson, smart. We're a breathing machine. Breathing. Breathe in, and slowly out, 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 out. Breathe in, out. And never jog along a big street where there's a lot of car exhaust.
The fumes. Huh?
Yeah, go to the parks. Go to places, the ocean, along the ocean. Remember, my father, Paul Bragg, met the Duke in 1920 at the Olympics. And he said, brother, come to be my guest in Hawaii. My sister's getting married. You be my guest. Dad and the Duke were like brothers.
Did they surf together too?
They surfed.
Oh, my goodness.
My father was the original triathlete. He promoted swimming, biking, and running around the world.
Wow.
He was the first one to promote. Jim Cotton started the Waikiki Rough Water Swim, and my dad, he came to our Ilokai condo. He said, Paul, will you be in it for me? You'll help promote it, won't you?
Wow.
And Dad was on the front page of the LA Times, the Chicago Tribune, the New York Magazine, and guess what? Promoting the Waikiki Rough Water Swim.
My goodness.
And it's still going on every year.
Now, Patricia, we're running out of time. Is there anything you want to tell the audience about feet?
Oh, my dear, your feet carry you through life. Be good and kind to them. Be sure the shoes you wear are flexible, comfortable, and I want each one of you to realize that you are a miracle. A miracle. God bless you, and God bless the world.
Thank you, Patricia, and thank you for watching. I appreciate you.
Programs airing on the Olelo Community Media channels are presented by independent producers in the community's interest. The opinions and views expressed do not necessarily represent the views of Olelo Community Media or its management.
We do it island style. From the mountain to the ocean, from the windward to the leeward side.
Cleveland loves sports, music, and Marines. The Corps infiltrated downtown a few hours before sunrise this morning, kicking off Marine Week Cleveland. Military assault vehicles rolled out of the Cleveland Browns Stadium underbelly, guided by city police to Voinovich Park, Gateway Park, and Public Square.
Oh, I liked it. It was awesome. The whole traveling from the Cleveland Browns Stadium to over here, I thought it was amazing. It's definitely an experience.
Police blocked off roads as residents saw a different beginning to normal rush hour. 60-ton tanks, followed by Humvees and light armored vehicles rolled into the city, building excitement for local residents.
This is my first time actually seeing a tank roll through Cleveland, Ohio. It's pretty cool.
I think it's actually a great support. You know what I mean? Come on, you know, people don't even get to see this all the time. Let's be honest. Come on, it's America. You gotta appreciate it, man. This is beautiful.
More than 9,000 Marines are from Ohio. Some of those service members involved are here to show appreciation and celebrate Cleveland's support to the Corps. The Marines worked through the night to ensure vehicles were in place before dawn and ready for public viewing. By connecting with the community, the Corps will showcase 236 years of history for the city of Cleveland and the surrounding region. From Marine Week Cleveland, I'm Sergeant Todd Hunter.
The Marines before you represent 60 years of marching and rifle drill precision. The Silent Drill Platoon executes its drill sequence without cadence or verbal command. The Silent Drill Platoon demonstrates the finest in Marine professionalism, esprit de corps, and marching precision. The United States Marine Corps Silent Drill Platoon. Platoon.
Marine Week gives the American public an up-close look at the men, women, and equipment of the Marine Corps. The culminating event here at Cleveland's Burt Lakefront Airport is a demonstration of the Marine Air Ground Task Force, showing off the Corps' ability to respond to crises at a moment's notice.
It's basically a beginning to end of how we launch, how we utilize our equipment in combat, and how we get it back safe, home safe and sound.
More than 50,000 spectators came to see the capabilities of America's Expeditionary Force in readiness.
The airplane is so awesome. The fast ones that make some noise.
Marine Week kicked off in Chicago in 2009. It went on to Boston the following year, and last year was in St. Louis. But here this year in Cleveland, the Marines continue to celebrate community, country, and Corps.
It's blown me away personally, and I was in St. Louis last year, so it just gets bigger and better every year, and we hope to continue that trend.
Well, I think Cleveland, they had a good showing here. They, from what I understand, it was well attended. So, no, that's you got to bring the Marine Corps in the forefront, that's for sure.
You know, this is great for the American people. This is great for the people of Cleveland to see America's Expeditionary Force in readiness, what we talk about, to actually show them what they can do.
But for all the hoopla, there's still one basic fact.
I saw airplanes and you didn't.
From Marine Week Cleveland, I'm Sergeant Todd Hunter.
So we have the Phil Marsoc guys here teaching Jess, which is their jungle survival training. And so we got a morning class from them. Once we got their class on different characteristics of survival. Came out here to prac after everything. They taught us all the type of snares, how to make fire with bamboo, how to set up the traps, set up the snares. They teach us, all the skills they know, all their cooking skills, the different ways, different plants to eat, all that stuff. It helps us to get a better understanding of the AO that we work in, so we can go out and if hard times happen, we can identify plants, animals, different ways to trap them and different ways to eat them, cook them. So it's been good.
The USMC and the Mars Philippine Marines laid traps and snares intended for monitor lizard, and they are very lucky that they have caught one, and they cook it, and they said that it tastes like, it seems like chicken, but much sweeter than that. In the Philippines, it's traditions that before we eat together, of course we give thanks to our Lord for the blessings that He gives unto us. It's part of a camaraderie, eating together. We need every one of us. We are hoping to have a continued partnership in terms of arms training.
Yeah, I hope we take away stuff that they need, or we identify things that they need from us next time. So next time we come back, we can help them out even more than we are going to be able to help them out this time. So yes, hell yeah, I'd love to come back.
Continuing Promise is a U.S. Navy South-led operation. It's a humanitarian assistance mission, and it's based off of the U.S. Navy ship Comfort. And the U.S. Navy ship Comfort has gone from the Caribbean Basin, Central America, and Colombia. the only country in South America. And it goes from port to port, providing humanitarian assistance to those places that those governments choose is the best place for U.S. forces to come and serve those people in that country. As a civil affairs team leader, it's our job as civil affairs forces to work with the main effort, which are doctors and engineers here for Continuing Promise. We gather civil information, and we do that through assessments, and these assessments could potentially determine projects for long-term development for the country of Colombia. So, the U.S. military and the Colombian military have a strong partnership that dates back many years. The significance of Continuing Promise 2015 is that it nests within the Colombian military's campaign to end its 50-plus year battle with the FARC. And the government of Colombia has asked us to basically come and partner with the Colombian Navy here in Buenaventura. And this is an opportunity for the U.S. to partner with Colombia and do meaningful med-readies and engineering projects to serve the people of Buenaventura. Buenaventura is considered one of those places in Colombia that's a strategic location. And in many of the places where we're working, there are lots of young males who are considered at-risk youths, and we come in these communities and we, with the Navy Seabees, and we basically serve these people through small-scale projects. The greatest challenges for civil affairs forces are probably first gaining that rapport with that partner nation, with that country's military, and also the people that they're serving. Once you can establish that rapport, it makes it a lot easier for civil affairs forces to go out and do their job as far as doing assessments, tactical climate surveys, gathering atmospherics to help support the commander achieve his objectives.
What the heck is a tech? When you walk through our doors, you know we remember the men and women who make up our mission. We sacrifice and we strive for excellence, for precision, making decisions that serve the needs of our nation. But who are we? We toss around terms from the 10,000-foot level: assured mobility, geospatial engineering, horizontal and vertical construction. We oversee a landscape of massive operations. Yet we know the work that goes on the ground. We are the experts of terrain, building airstrips and bases for troops, dropping bridges on call in 3 hours or less. But we also build schoolhouses and medical centers for our international allies and their people in need. Indeed, we are the engineering firm the military needs. But our engineers can not only build, they can fight. They can blow you away. They are the warriors with heart. They have the spirit to stand, to sweat, and to bleed in defense of our nation. And yet, we possess more than brawn or things that go boom. Our real force is our brain. We think, we plan, we execute. With 20,000 engineers across the U.S. Army Reserve and 6,000 more who can settle the score, we train for war, yet we aim to hold peace. We are the tech, and we are what our nation needs.
Remember that people are always watching us. We may not see it, but there's a kid looking out his window or watching us. There's a kid walking by watching us. There's an adult at a gas station watching as we walk by. And we should always conduct ourselves as Marines. We know what's expected of us as Marines. They expect us to conduct ourselves in a certain way. But as long as we conduct ourselves as Marines everywhere we go, we shouldn't have an issue.
Continuing Promise 2015 is a humanitarian operation designed to visit 12 countries, delivering doctors, medical, and engineering expertise to local civilians within those 10 countries. United States Naval Ship Comfort is providing the support platform for the doctors, nurses, technicians, engineers, everybody that is required to make this mission a success. Let's go. A Civil Affairs Marine is primarily a warfighter. We were trained to fight battles and win battles. However, a Civil Affairs Marine goes so much further than warfighter. We're ambassadors to these countries that we visit. We're humanitarians to the local populations that we try to support. We know the local indigenous population. Our job is to be the subject matter expert on any country in our AOR. Marines from 4th Civil Affairs Group have that level of expertise that was developed over engagements with locals in foreign countries, or it comes from the individual Marine's own background. Many of our Marines are from these South Latin American and Caribbean countries that we support. Without Civil Affairs Marines, without 4th CAG Civil Affairs Marines on the ground, the commander would not have the situational awareness that he does when he has us as a tool in his toolbox.
I didn't realize there was meters.
He's jumping around and
oh no.
Lo veo como un éxito. Es la segunda vez que viene este gran buque y lo veo como sí, como positivo. De hecho, la asistencia de los ciudadanos dominicanos en las diferentes localidades recibiendo asistencias médicas de diferentes ramas médicas ha sido fabulosa, ha sido numerosa. Los números están allí y las personas la han aceptado la ayuda y también han aceptado la ayuda y los brazos de ustedes siempre han estado abiertos desde la embajada y las diferentes instituciones.
operations like these are very important because we show other countries, and for this mission, we show the Dominican Republic that we really care about its people. We show the community that we're here to help them. We're friends, we're neighbors, we're here for the same cause, and it's to help each other. And that's why the missions like these are very important.
The community response to our presence here in Santo Domingo was overwhelmingly positive. Without a doubt, we were extremely well received everywhere we went. Whether it was a community engagement planned event, exercise, planned event, or just United States Marines walking down the streets in our utility uniform, I cannot tell you the amount of times that we were approached by locals happy to see us, smiling, shaking our hands, wanting to talk to us. Absolutely an amazing experience.
One of the events that touched me personally, that I really enjoyed, was our last event, which was at Albergue Nacional. This school basically had local kids, very poor local kids that have many disabilities, if you would, some with Down syndrome. Some of these kids had to get around in wheelchairs. Some of these kids, very poor. And I personally enjoyed this event because this event basically helped us understand why we really are here, what this mission is really all about.
No matter how bad you think it is today, you can change tomorrow with the way you think, the way you act, and the way you hope that there's always a brighter tomorrow. And that's something I think that, we as Americans, we as Marines, should really take to heart, because no matter how bad we think we have it, we have an opportunity to change our lives. We have an opportunity to change others' lives as well. And I think that one of the amazing things about being a civil affairs Marine and being able to operate in this AO is the exposure that we get to individuals that we would not otherwise have access to. And relative to our lives, we see what struggle really is. It makes me, as an individual, as a human being, a lot more appreciative of what I have. It makes me very appreciative of the friends I have, the family I have, and the Marines that I have.
Vienen dando su mano, están en ayuda, nos sentimos protegidos. Al contrario, nos gustaría que esa ayuda llegara más lejos, fuera de la ciudad de Santo Domingo.
Nothing material is really important in life when you get to see things like we have seen during this mission. Nothing that money can buy is even close to what we've seen here. We have these children, their families, they're very united families, if you would. I mean, the kids are happy kids regardless of the condition that they're living in. And that's one of the main things that touched me personally.
Ladies and gentlemen, the President of the United States.
Good afternoon, everybody. Please be seated. It is a great honor to return to the National Defense University. Here at Fort McNair, Americans have served in uniform since 1791, standing guard in the earliest days of the Republic and contemplating the future of warfare here in the 21st century. For over 2 centuries, the United States has been bound together by founding documents that defined who we are as Americans and served as our compass through every type of change. Matters of war and peace are no different. Americans are deeply ambivalent about war, but having fought for our independence, we know a price must be paid for freedom. From the Civil War to our struggle against fascism, on through the long twilight struggle of the Cold War. Battlefields have changed and technology has evolved, but our commitment to constitutional principles has weathered every war. And every war has come to an end. And with the collapse of the Berlin Wall, a new dawn of democracy took hold abroad, and a decade of peace and prosperity arrived here at home. And for a moment it seemed the 21st century would be a tranquil time. And then on September 11th, 2001, we were shaken out of complacency. Thousands were taken from us as clouds of fire and metal and ash descended upon a sun-filled morning. This was a different kind of war. No armies came to our shores, and our military was not the principal target. Instead, a group of terrorists came to kill as many civilians as they could. And so our nation went to war. We have now been at war for well over a decade. I won't review the full history. What is clear is that we quickly drove al-Qaeda out of Afghanistan, but then shifted our focus and began a new war in Iraq. And this carried significant consequences for our fight against al-Qaeda, our standing in the world, and to this day, our interests in a vital region. Meanwhile, we strengthened our defenses, hardening targets, tightening transportation security, giving law enforcement new tools to prevent terror. Most of these changes were sound. Some caused inconvenience, but some, like expanded surveillance, raised difficult questions about the balance that we strike between our interests in security and our values of privacy. And in some cases, I believe we compromised our basic values by using torture to interrogate our enemies and detaining individuals in a way that ran counter to the rule of law. So after I took office, we stepped up the war against al-Qaeda, but we also sought to change its course. We relentlessly targeted al-Qaeda's leadership. We ended the war in Iraq and brought nearly 150,000 troops home. We pursued a new strategy in Afghanistan and increased our training of Afghan forces. We unequivocally banned torture, affirmed our commitment to civilian courts, worked to align our policies with the rule of law, and expanded our consultations with Congress. Today, Osama bin Laden is dead, and so are most of his top lieutenants. There have been no large-scale attacks on the United States, and our homeland is more secure. Few of our troops are in harm's way, and over the next 19 months, they will continue to come home. Our alliances are strong, and so is our standing in the world. In sum, we are safer because of our efforts. Now, make no mistake, our nation is still threatened by terrorists. From Benghazi to Boston, we have been tragically reminded of that truth. But we have to recognize that the threat has shifted and evolved from the one that came to our shores on 9/11. With a decade of experience now to draw from, this is the moment to ask ourselves hard questions about the nature of today's threats and how we should confront them. And these questions matter to every American. For over the last decade, our nation has spent well over $1 trillion on war, helping to explode our deficits and constraining our ability to nation build here at home. Our service members and their families have sacrificed far more on our behalf. Nearly 7,000 Americans have made the ultimate sacrifice. Many more have left a part of themselves on the battlefield or brought the shadows of battle back home. From our use of drones to the detention of terrorist suspects, the decisions that we are making now will define the type of nation and world that we leave to our children. So America's at a crossroads. We must define the nature and scope of this struggle, or else it will define us. We have to be mindful of James Madison's warning that no nation could preserve its freedom in the midst of continual warfare. Neither I nor any president can promise the total defeat of terror. We will never erase the evil that lies in the hearts of some human beings, nor stamp out every danger to our open society. But what we can do, what we must do, is dismantle networks that pose a direct danger to us and make it less likely for new groups to gain a foothold, all the while maintaining the freedoms and ideals that we defend. And to define that strategy, we have to make decisions based not on fear, but on hard-earned wisdom. And that begins with understanding the current threat that we face. Today, the core of al-Qaeda in Afghanistan and Pakistan is on the path to defeat. Their remaining operatives spend more time thinking about their own safety than plotting against us. They did not direct the attacks in Benghazi or Boston. They've not carried out a successful attack on our homeland since 9/11. Instead, what we've seen is the emergence of various al-Qaeda affiliates, from Yemen to Iraq, from Somalia to North Africa. The threat today is more diffuse, with al-Qaeda's affiliates in the Arabian Peninsula, AQAP, the most active in plotting against our homeland. And while none of AQAP's efforts approach the scale of 9/11, they have continued to plot acts of terror, like the attempt to blow up an airplane on Christmas Day in 2009. Unrest in the Arab world has also allowed extremists to gain a foothold in countries like Libya and Syria. But here, too, there are differences from 9/11. In some cases, we continue to confront state-sponsored networks like Hezbollah that engage in acts of terror to achieve political goals. Other of these groups are simply collections of local militias or extremists interested in seizing territory. And while we are vigilant for signs that these groups may pose a transnational threat, most are focused on operating in the countries and regions where they are based. And that means we'll face more localized threats like what we saw in Benghazi, or the BP oil facility in Algeria, in which local operatives, perhaps in loose affiliation with regional networks, launch periodic attacks against Western diplomats, companies, and other soft targets, or resort to kidnapping and other criminal enterprises to fund their operations. And finally, we face a real threat from radicalized individuals here in the United States. Whether it's a shooter at a Sikh temple in Wisconsin, a plane flying into a building in Texas, or the extremists who killed 168 people at the federal building in Oklahoma City, America's confronted many forms of violent extremism in our history. Deranged or alienated individuals, often U.S. citizens or legal residents, can do enormous damage, particularly when inspired by larger notions of violent jihad. And that pull towards extremism appears to have led to the shooting at Fort Hood and the bombing of the Boston Marathon. So that's the current threat. Lethal, yet less capable, al-Qaeda affiliates, threats to diplomatic facilities and businesses abroad, homegrown extremists. This is the future of terrorism. We have to take these threats seriously and do all that we can to confront them. But as we shape our response, we have to recognize that the scale of this threat closely resembles the types of attacks we faced before 9/11. In the 1980s, we lost Americans to terrorism at our embassy in Beirut, at our Marine barracks in Lebanon, on a cruise ship at sea, at a disco in Berlin, and on a Pan Am flight, Flight 103, over Lockerbie. In the 1990s, we lost Americans to terrorism at the World Trade Center, at our military facilities in Saudi Arabia, and at our embassy in Kenya. These attacks were all brutal. They were all deadly. And we learned that left unchecked, these threats can grow. But if dealt with smartly and proportionally, these threats need not rise to the level that we saw on the eve of 9/11. Moreover, we have to recognize that these threats don't arise in a vacuum. Most, though not all, of the terrorism we faced is fueled by a common ideology, a belief by some extremists that Islam is in conflict with the United States and the West, and that violence against Western targets, including civilians, is justified in pursuit of a larger cause. Of course, this ideology is based on a lie, for the United States is not at war with Islam. And this ideology is rejected by the vast majority of Muslims, who are the most frequent victims of terrorist attacks. Nevertheless, this ideology persists. And in an age when ideas and images can travel the globe in an instant, Our response to terrorism can't depend on military or law enforcement alone. We need all elements of national power to win a battle of wills, the battle of ideas. So what I want to discuss here today is the components of such a comprehensive counterterrorism strategy. First, we must finish the work of defeating al-Qaeda and its associated forces. In Afghanistan, we will complete our transition to Afghan responsibility for that country's security. Our troops will come home. Our combat mission will come to an end. And we will work with the Afghan government to train security forces and sustain a counterterrorism force which ensures that al-Qaeda can never again establish a safe haven to launch attacks against us or our allies. Now, beyond Afghanistan, we must define our effort not as a boundless global war on terror, but rather as a series of persistent, targeted efforts to dismantle specific networks of violent extremists that threaten America. In many cases, this will involve partnerships with other countries. Already, thousands of Pakistani soldiers have lost their lives fighting extremists. In Yemen, we are supporting security forces that have reclaimed territory from AQAP. In Somalia, we helped a coalition of African nations push al-Shabaab out of its strongholds. In Mali, we're providing military aid to French-led intervention to push back al-Qaeda in the Maghreb and help the people of Mali reclaim their future. Much of our best counterterrorism cooperation results in the gathering and sharing of intelligence, the arrest and prosecution of terrorists. That's how a Somali terrorist apprehended off the coast of Yemen is now in a prison in New York. That's how we worked with European allies to disrupt plots from Denmark to Germany to the United Kingdom. That's how intelligence collected with Saudi Arabia helped us stop a cargo plane from being blown up over the Atlantic. These partnerships work. But despite our strong preference for the detention and prosecution of terrorists, sometimes this approach is foreclosed. Al-Qaeda and its affiliates try to gain foothold in some of the most distant and unforgiving places on earth. They take refuge in remote tribal regions. They hide in caves and walled compounds. They train in empty deserts and rugged mountains. In some of these places, such as parts of Somalia and Yemen, the state only has the most tenuous reach into the territory. In other cases, the state lacks the capacity or will to take action. And it's also not possible for America to simply deploy a team of special forces to capture every terrorist. Even when such an approach may be possible, there are places where it would pose profound risks to our troops and local civilians, where a terrorist compound cannot be breached without triggering a firefight with surrounding tribal communities, for example, that pose no threat to us. Times when putting U.S. boots on the ground may trigger a major international crisis. To put it another way, our operation in Pakistan against Osama bin Laden cannot be the norm. The risks in that case were immense. The likelihood of capture, although that was our preference, was remote given the certainty that our folks would confront resistance. The fact that we did not find ourselves confronted with civilian casualties or embroiled in an extended firefight was a testament to the meticulous planning and professionalism of our special forces, but it also depended on some luck. And it was supported by massive infrastructure in Afghanistan. And even then, the cost to our relationship with Pakistan and the backlash among the Pakistani public over encroachment on their territory was so severe that we are just now beginning to rebuild this important partnership. So it is in this context that the United States has taken lethal, targeted action against al-Qaeda and its associated forces, including with remotely piloted aircraft commonly referred to as drones. As was true in previous armed conflicts, this new technology raises profound questions about who is targeted and why, about civilian casualties and the risk of creating new enemies, about the legality of such strikes under U.S. and international law, about accountability and morality. So let me address these questions. To begin with, our actions are effective. Don't take my word for it. In the intelligence gathered at bin Laden's compound, we found that he wrote, "We could lose the reserves to enemies' airstrikes. We cannot fight airstrikes with explosives." Other communications from al-Qaeda operatives confirm this as well. Dozens of highly skilled al-Qaeda commanders, trainers, bomb makers, and operatives have been taken off the battlefield. Plots have been disrupted that would have targeted international aviation, U.S. transit systems, European cities, and our troops in Afghanistan. Simply put, these strikes have saved lives. Moreover, America's actions are legal. We were attacked on 9/11. Within a week, Congress overwhelmingly authorized the use of force. Under domestic law and international law, the United States is at war with al-Qaeda, the Taliban, and their associated forces. We are at war with an organization that right now would kill as many Americans as they could if we did not stop them first. So this is a just war, a war waged proportionally, in last resort, and in self-defense. And yet, as our fight enters a new phase, America's legitimate claim of self-defense cannot be the end of the discussion. To say a military tactic is legal, or even effective, is not to say it is wise or moral in every instance. For the same progress that gives us the technology to strike half a world away also demands the discipline to constrain that power or risk abusing it. And that's why, over the last 4 years, my administration has worked vigorously to establish a framework that governs our use of force against terrorists, insisting upon clear guidelines, oversight, and accountability that is now codified in presidential policy guidance that I signed yesterday. In the Afghan war theater, we must and will continue to support our troops until the transition is complete at the end of 2014. And that means we will continue to take strikes against high-value al-Qaeda targets, but also against forces that are massing to support attacks on coalition forces. But by the end of 2014, we will no longer have the same need for force protection. And the progress we've made against core al-Qaeda will reduce the need for unmanned strikes. Beyond the Afghan theater, we only target al-Qaeda and its associated forces. And even then, the use of drones is heavily constrained. America does not take strikes when we have the ability to capture individual terrorists. Our preference is always to detain, interrogate, and prosecute them. America cannot take strikes wherever we choose. Our actions are bound by consultations with partners and respect for state sovereignty. America does not take strikes to punish individuals. we act against terrorists who pose a continuing and imminent threat to the American people, and when there are no other governments capable of effectively addressing the threat. And before any strike is taken, there must be near certainty that no civilians will be killed or injured, the highest standard we can set. Now, this last point is critical because much of the criticism about drone strikes, both here at home and abroad, understandably centers on reports of civilian casualties. There's a wide gap between U.S. assessments of such casualties and non-governmental reports. Nevertheless, it is a hard fact that U.S. strikes have resulted in civilian casualties, a risk that exists in every war. And for the families of those civilians, no words or legal construct can justify their loss. For me and those in my chain of command, those deaths will haunt us as long as we live, just as we are haunted by the civilian casualties that have occurred throughout conventional fighting in Afghanistan and Iraq. But as Commander-in-Chief, I must weigh these heartbreaking tragedies against the alternatives. To do nothing in the face of terrorist networks would invite far more civilian casualties, not just in our cities at home and our facilities abroad, but also in the very places like Sana'a and Kabul and Mogadishu, where terrorists seek a foothold. Remember that the terrorists we are after target civilians, and the death toll from their acts of terrorism against Muslims dwarfs any estimate of civilian casualties from drone strikes. So doing nothing is not an option. Where foreign governments cannot or will not effectively stop terrorism in their territory, the primary alternative to targeted lethal action would be the use of conventional military options. As I've already said, even small special operations carry enormous risks. Conventional air power, or missiles, are far less precise than drones and are likely to cause more civilian casualties and more local outrage. And invasions of these territories lead us to be viewed as occupying armies, unleash a torrent of unintended consequences, are difficult to contain, result in large numbers of civilian casualties, and ultimately empower those who thrive on violent conflict. So it is false to assert that putting boots on the ground is less likely to result in civilian deaths or less likely to create enemies in the Muslim world. The results would be more U.S. deaths, more Black Hawks Down, more confrontations with local populations, and an inevitable mission creep in support of such raids that could easily escalate into new wars. Yes, the conflict with al-Qaeda, like all armed conflict, invites tragedy. But by narrowly targeting our action against those who want to kill us and not the people they hide among, we are choosing the course of action least likely to result in the loss of innocent life. Our efforts must be measured against the history of putting American troops in distant lands among hostile populations. In Vietnam, hundreds of thousands of civilians died in a war where the boundaries of battle were blurred. In Iraq and Afghanistan, despite the extraordinary courage and discipline of our troops, thousands of civilians have been killed. So neither conventional military action nor waiting for attacks to occur offers moral safe harbor. And neither does a sole reliance on law enforcement in territories that have no functioning police or security services, and indeed have no functioning law. Now, this is not to say that the risks are not real. Any U.S. military action in foreign lands risks creating more enemies and impacts public opinion overseas. Moreover, our laws constrain the power of the president, even during wartime. And I've taken an oath to defend the Constitution of the United States. The very precision of drone strikes and the necessary secrecy often involved in such actions can end up shielding our government from the public scrutiny that a troop deployment invites. It can also lead a president and his team to view drone strikes as a cure-all for terrorism. And for this reason, I've insisted on strong oversight of all lethal action. After I took office, my administration began briefing all strikes outside of Iraq and Afghanistan to the appropriate committees of Congress. For the record, I do not believe it would be constitutional for the government to target and kill any U.S. citizen with a drone or with a shotgun without due process. Nor should any president deploy armed drones over U.S. soil. But when a U.S. citizen goes abroad to wage war against America and is actively plotting to kill U.S. citizens, and when neither the United States nor our partners are in a position to capture him before he carries out a plot, his citizenship should no more serve as a shield than a sniper shooting down on an innocent crowd should be protected from a SWAT team. That's who Anwar al-Awlaki was. He was continuously trying to kill people. He helped oversee the 2010 plot to detonate explosive devices on 2 U.S.-bound cargo planes. He was involved in planning to blow up an airliner in 2009. When Farouk Abdul Muttalib, the Christmas Day bomber, went to Yemen in 2009, al-Awlaki hosted him, approved his suicide operation, helped him tape a martyrdom video to be shown after the attack, and his last instructions were to blow up the airplane when it was over American soil. I would have detained and prosecuted al-Awlaki if we captured him before he carried out a plot, but we couldn't. And as president, I would have been derelict in my duty had I not authorized the strike that took him out. Of course, the targeting of any American raises constitutional issues that are not present in other strikes, which is why my administration submitted information about al-Awlaki to the Department of Justice months before al-Awlaki was killed, and briefed the Congress before this strike as well. But the high threshold that we've set for taking lethal action applies to all potential terrorist targets, regardless of whether or not they are American citizens. This threshold respects the inherent dignity of every human life. Alongside the decision to put our men and women in uniform in harm's way, the decision to use force against individuals or groups, even against a sworn enemy of the United States, is the hardest thing I do as president. But these decisions must be made, given my responsibility to protect the American people. Now, going forward, I've asked my administration to review proposals to extend oversight of lethal actions outside of war zones that go beyond our reporting to Congress. Each option has virtues in theory, but poses difficulties in practice. For example, the establishment of a special court to evaluate and authorize lethal action has the benefit of bringing a third branch of government into the process, but raises serious constitutional issues about presidential and judicial authority. Another idea that's been suggested, the establishment of an independent oversight board in the executive branch avoids those problems, but may introduce a layer of bureaucracy into national security decision-making without inspiring additional public confidence in the process. But despite these challenges, I look forward to actively engaging Congress to explore these and other options for increased oversight. I believe, however, that the use of force must be seen as part of a larger discussion we need to have about a comprehensive counterterrorism strategy, because for all the focus on the use of force, force alone cannot make us safe. We cannot use force everywhere that a radical ideology takes root. And in the absence of a strategy that reduces the wellspring of extremism, a perpetual war through drones or special forces or troop deployments will prove self-defeating and alter our country in troubling ways. So the next element of our strategy involves addressing the underlying grievances and conflicts that feed extremism, from North Africa to South Asia. As we've learned this past decade, this is a vast and complex undertaking. We must be humble in our expectation that we can quickly resolve deep-rooted problems like poverty and sectarian hatred. Moreover, no two countries are alike, and some will undergo chaotic change before things get better. But our security and our values demand that we make the effort. This means patiently supporting transitions to democracy in places like Egypt and Tunisia and Libya, because the peaceful realization of individual aspirations will serve as a rebuke to violent extremism. We must strengthen the opposition in Syria while isolating extremist elements, because the end of a tyrant must not give way to the tyranny of terrorism. We are actively working to promote peace between Israelis and Palestinians, because it is right and because such a peace could help reshape attitudes in the region. And we must help countries modernize economies, upgrade education, and encourage entrepreneurship, because American leadership has always been elevated by our ability to connect with people's hopes and not simply their fears. And success on all these fronts requires sustained engagement, but it will also require resources. I know that foreign aid is one of the least popular expenditures that there is. That's true for Democrats and Republicans. I've seen the polling. Even though it amounts to less than 1% of the federal budget. In fact, a lot of folks think it's 25% if you ask people on the streets. Less than 1%. Still wildly unpopular. But foreign assistance cannot be viewed as charity. It is fundamental to our national security. And it's fundamental to any sensible long-term strategy to battle extremism. Moreover, foreign assistance is a tiny fraction of what we spend fighting wars that our assistance might ultimately prevent. For what we spent in a month in Iraq at the height of the war, we could be training security forces in Libya, maintaining peace agreements between Israel and its neighbors, feeding the hungry in Yemen, building schools in Pakistan, and creating reservoirs of goodwill that marginalize extremists. So that has to be part of our strategy. Moreover, America cannot carry out this work if we don't have diplomats serving in some very dangerous places. Over the past decade, we have strengthened security at our embassies, and I am implementing every recommendation of the Accountability Review Board, which found unacceptable failures in Benghazi. I've called on Congress to fully fund these efforts to bolster security and harden facilities, improve intelligence, and facilitate a quicker response time from our military if a crisis emerges. But even after we take these steps, some irreducible risks to our diplomats will remain. This is the price of being the world's most powerful nation, particularly as a wave of change washes over the Arab world. And in balancing the trade-offs between security and active diplomacy, I firmly believe that any retreat from challenging regions will only increase the dangers that we face in the long run. And that's why we should be grateful to those diplomats who are willing to serve there. Targeted action against terrorists, effective partnerships, diplomatic engagement, and assistance. Through such a comprehensive strategy, we can significantly reduce the chances of large-scale attacks on the homeland and mitigate threats to Americans overseas. But as we guard against dangers from abroad, we cannot neglect the daunting challenge of terrorism from within our borders. As I said earlier, this threat is not new. But technology and the internet increase its frequency and, in some cases, its lethality. Today, a person can consume hateful propaganda, commit themselves to a violent agenda, and learn how to kill without leaving their home. To address this threat, 2 years ago, my administration did a comprehensive review and engaged with law enforcement. And the best way to prevent violent extremism inspired by violent jihadists is to work with the Muslim American community, which has consistently rejected terrorism, to identify signs of radicalization, and partner with law enforcement when an individual is drifting towards violence. And these partnerships can only work when we recognize that Muslims are a fundamental part of the American family. In fact, the success of American Muslims and our determination to guard against any encroachments on their civil liberties is the ultimate rebuke to those who say that we're at war with Islam. Now, thwarting homegrown plots presents particular challenges in part because of our proud commitment to civil liberties for all who call America home. That's why in the years to come, we will have to keep working hard to strike the appropriate balance between our need for security and preserving those freedoms that make us who we are. That means reviewing the authorities of law enforcement so we can intercept new types of communication, but also build in privacy protections to prevent abuse. That means that even after Boston, we do not deport someone or throw somebody in prison in the absence of evidence. That means putting careful constraints on the tools the government uses to protect sensitive information, such as the state secrets doctrine. And that means finally having a strong privacy and civil liberties board to review those issues where our counterterrorism efforts and our values may come into tension. The Justice Department's investigation of national security leaks offers a recent example of the challenges involved in striking the right balance between our security and our open society. As Commander-in-Chief, I believe we must keep information secret that protects our operations and our people in the field. To do so, we must enforce consequences for those who break the law and breach their commitment to protect classified information. But a free press is also essential for our democracy. That's who we are. And I'm troubled by the possibility that leak investigations may chill the investigative journalism that holds government accountable. Journalists should not be at legal risk for doing their jobs. Our focus must be on those who break the law. And that's why I've called on Congress to pass a media shield law to guard against government overreach. And I've raised these issues with the Attorney General, who shares my concerns. So he's agreed to review existing Department of Justice guidelines governing investigations that involve reporters. And he'll convene a group of media organizations to hear their concerns as part of that review. And I've directed the Attorney General to report back to me by July 12th. Now, all these issues remind us that the choices we make about war can impact, in sometimes unintended ways, the openness and freedom on which our way of life depends. And that is why I intend to engage Congress about the existing authorization to use military force, or AUMF, to determine how we can continue to fight terrorism without keeping America on a perpetual wartime footing. The AUMF is now nearly 12 years old. The Afghan war is coming to an end. Core al-Qaeda is a shell of its former self. Groups like AQAP must be dealt with, but in the years to come, not every collection of thugs that labels themselves al-Qaeda will pose a credible threat to the United States. Unless we discipline our thinking, our definitions, our actions, we may be drawn into more wars we don't need to fight, or continue to grant presidents unbound powers more suited for traditional armed conflicts between nation states. So I look forward to engaging Congress and the American people in efforts to refine and ultimately repeal the AUMF's mandate. And I will not sign laws designed to expand this mandate further. Our systematic effort to dismantle terrorist organizations must continue. But this war, like all wars, must end. That's what history advises. That's what our democracy demands. And that brings me to my final topic, the detention of terrorist suspects. I'm going to repeat one more time. As a matter of policy, the preference of the United States is to capture terrorist suspects. When we do detain a suspect, we interrogate them. And if the suspect can be prosecuted, we decide whether to try him in a civilian court or a military commission. During the past decade, the vast majority of those detained by our military were captured on the battlefield. In Iraq, we turned over thousands of prisoners as we ended the war. In Afghanistan, we have transitioned detention facilities to the Afghans as part of the process of restoring Afghan sovereignty. So we bring law of war detention to an end, and we are committed to prosecuting terrorists wherever we can. The glaring exception to this time-tested approach is the detention center at Guantanamo Bay. The original premise for opening Gitmo, that detainees would not be able to challenge their detention, was found unconstitutional 5 years ago. In the meantime, Gitmo has become a symbol around the world for an America that flouts the rule of law. Our allies won't cooperate with us if they think a terrorist will end up at Gitmo. During a time of budget cuts, we spend $150 million each year to imprison 166 people. Almost $1 million per prisoner. And the Department of Defense estimates that we must spend another $200 million to keep Gitmo open at a time when we're cutting investments in education and research here at home, and when the Pentagon is struggling with sequester and budget cuts. Now, as president, I have tried to close Gitmo. I transferred 67 detainees to other countries before Congress imposed restrictions to effectively prevent us from either transferring detainees to other countries or imprisoning them here in the United States. These restrictions make no sense. After all, under President Bush, some 530 detainees were transferred from Gitmo with Congress's support. When I ran for president the first time, John McCain supported closing Gitmo. This was a bipartisan issue. No person has ever escaped one of our supermax or military prisons here in the United States, ever. Our courts have convicted hundreds of people for terrorism or terrorism-related offenses, including some folks who are more dangerous than most Gitmo detainees. They're in our prisons. And given my administration's relentless pursuit of al-Qaeda's leadership, there is no justification beyond politics for Congress to prevent us from closing a facility that should have never been opened. Today, So let me finish, ma'am. So today, once again, today,
these desperate people.
I'm about to address it, ma'am, but you got to let me speak. I'm about to address it.
Commander-in-Chief.
Let me address it.
Close Guantanamo today.
Why don't you let me address it, ma'am?
Release those 86 prisoners.
Why don't you sit down and I will tell you exactly what I'm going to do.
Today. That includes 57 Yemenis.
Thank you, ma'am.
It includes Shakir Amr.
Thank you. Thank you. Ma'am, thank you. You should let me finish my sentence. Today, I once again call on Congress to lift the restrictions on detainee transfers from Gitmo. I have asked the Department of Defense to designate a site in the United States where we can hold military commissions. I'm appointing a new senior envoy at the State Department and Defense Department whose sole responsibility will be to achieve the transfer of detainees to third countries. I am lifting the moratorium on detainee transfers to Yemen so we can review them on a case-by-case basis. To the greatest extent possible, we will transfer detainees who have been cleared to go to other countries. Where appropriate, we will bring terrorists to justice in our courts and our military justice system. And we will insist that judicial review be available for every detainee. Now, ma'am, let me finish. Let me finish, ma'am. This is part of free speech, is you being able to speak, but also you listening, and me being able to speak. All right? Thank you. Now, even after we take these steps, one issue will remain, which is how to deal with those Gitmo detainees who we know have participated in dangerous plots or attacks, but who cannot be prosecuted, for example, because the evidence against them has been compromised or is inadmissible in a court of law. But once we commit to a process of closing Gitmo, I am confident that this legacy problem can be resolved, consistent with our commitment to the rule of law. And I know the politics are hard. But history will cast a harsh judgment on this aspect of our fight against terrorism and those of us who failed to end it. Imagine a future, 10 years from now, or 20 years from now, when the United States of America is still holding people who have been charged with no crime on a piece of land that is not part of our country. Look at the current situation, where we are force-feeding detainees who are being held on a hunger strike. I'm willing to cut the young lady who interrupted me some slack, because it's worth being passionate about. Is this who we are? Is that something our founders foresaw? Is that the America we want to leave our children? Our sense of justice is stronger than that. We have prosecuted scores of terrorists in our courts. That includes Umar Farouk Abdul Muttalib, who tried to blow up an airplane over Detroit, and Faisal Shahzad, who put a car bomb in Times Square. It's in a court of law that we will try Doksar Charnev, who's accused of bombing the Boston Marathon. Richard Reed, the shoe bomber, is, as we speak, serving a life sentence in a maximum security prison here in the United States. In sentencing Reed, Judge William Young told him, "The way we treat you is the measure of our own liberty." When we went, you know, I think that and I'm going off script as you might expect here. The voice of that woman is worth paying attention to. Obviously, I do not agree with much of what she said. And obviously she wasn't listening to me in much of what I said. But these are tough issues. And the suggestion that we can gloss over them is wrong. You know, when that judge sentenced Mr. Reed, the shoe bomber, he went on to point to the American flag that flew in the courtroom. That flag, he said, will fly there long after this is all forgotten. That flag still stands for freedom. So, America, we face down dangers far greater than Al-Qaeda. By staying true to the values of our founding, and by using our constitutional compass, we have overcome slavery and civil war and fascism and communism. In just these last few years as president, I've watched the American people bounce back from painful recession, mass shootings, natural disasters like the recent tornadoes that devastated Oklahoma. These events were heartbreaking. They shook our communities to the core. But because of the resilience of the American people, these events could not come close to breaking us. I think of Lauren Manning, the 9/11 survivor who had severe burns over 80% of her body, who said, "That's my reality. I put a Band-Aid on it, literally, and I move on." I think of the New Yorkers who filled Times Square the day after an attempted car bomb as if nothing had happened. I think of the proud Pakistani parents who, after their daughter was invited to the White House, wrote to us, "We have raised an American Muslim daughter to dream big and never give up because it does pay off." I think of all the wounded warriors rebuilding their lives and helping other vets to find jobs. I think of the runner planning to do the 2014 Boston Marathon who said, "Next year you're going to have more people than ever." Determination is not something to be messed with. That's who the American people are. Determined and not to be messed with. And now we need a strategy and a politics that reflects this resilient spirit. Our victory against terrorism won't be measured in a surrender ceremony at a battleship or a statue being pulled to the ground. Victory will be measured in parents taking their kids to school, immigrants coming to our shores, fans taking in a ball game, a veteran starting a business, a bustling city street, a citizen shouting your concerns at a president. the quiet determination, that strength of character and bond of fellowship, that refutation of fear, that is both our sword and our shield. And long after the current messengers of hate have faded from the world's memory, alongside the brutal despots and deranged madmen and ruthless demagogues who litter history, the flag of the United States will still wave from small-town cemeteries to national monuments to distant outposts abroad. And that flag will still stand for freedom. Thank you very much, everybody. God bless you. May God bless the United States of America.
On this planet to keep us alive for the rest of our days.
Know that when you breathe, it's all part of a cycle. 4.6 billion years in the making. That's how long
the Earth has been around. Let's play a shrinking game.
Take 4.6 billion years and put them into 46.
We've been here for 4 hours and only had factories for a minute. What harm would we have done
In a minute? Well, we've already cut down half of the world's trees.
Chop, chop, chop. But the Earth has been here for ages. There's no way we could have put a dent in it.
But we have.
Back to real time.
Did you know?
It would take 10, count them.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Fully grown trees to provide enough oxygen for one person.
We need them to survive. Did you know?
In the last minute, 2,000 trees have been cut down.
The babies born in that time have been deprived of their right to
breathe.
Did you know?
Since this show began, 120,000 trees have been murdered.
12,000 lungs robbed of the oxygen.
I'm cleaning the view. I'm helping for good. Yeah, watch out, yeah, this guy is cleaning all this ugly waste. He's so good, he should be one of the biggest. Man. Yeah, I got me some bottles, you got me some cans. Cleaning the streets, I can handle no litter. You know how I do with the energy squad up. Hey, got that little buck, though. We ain't perfect, but you know we ain't broke, So if I see some, I grab some, I recycle it, I'm with some cool friends and they loving the green way. Like the ES, Energy Squad, they're the greatest, it's the fullest. To the brightest of the nation that is growing. Susan Posh and the tree and the teacher. Here to save the world from dying, so start living. Recycling. When I started planting, I was young. Look at my big tree, it's so grown up. I'm gonna plant more trees so I can make the world so beautiful, so beautiful. Recycling, recycling, recycling on you. I'm cleaning, I'm cleaning, I'm cleaning for good. I'm helping, I'm helping, I'm helping for good. Yeah, watch out, yeah, this guy is cleaning, yeah, cleaning all this ugly waste. So good, he should be one of the biggest.
Hey, whoa, hey, hey, yeah, hey, hey, bottles, 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 yeah, hey, hey, look at my tree swimming up outside, yeah, hey, hey, sweeping, I'm sweeping, hey, yeah, hey, yo, hold on, ah, yeah.
Recycling, you know? Recycling, you know, it's just a start, but sustainability is a goal, and reimagination is a plan of action. Listen to Nadia as she sings an original song that dares us to think different.
One sang in the trees. History, history. Broken homes and now I can't breathe. History. I was turned upside down, and no one is to blame. As I'm looking around, 'cause it's different. So different. I don't know how to feel. This is different. Don't know what to do. It is different to me. How about you? And this is not my home. From you get to me. The place that I have known is nowhere to be seen, 'cause it's different. Don't believe this is real.
If you think about how action happens, so let's say I want to pick up this cup and have a sip of water, which I want to do. You can break that action down into 4 basic steps. So the first, and you have to have all 4 of these steps in order for the action to happen. So the first thing is I think, oh, I want to take a sip of water. That's great. Then my brain makes a plan, sends that plan to the motor area of the brain, the motor cortex, where the motor nerves, the upper motor nerves, where they pick up that plan, process it, and send that plan down the spinal cord, where a second set of motor nerves, the lower motor nerves, come out from the spine and they go to the muscle. So number 1, think a thought, action, think a thought, make a plan. The plan picked up by the upper motor nerves that go down the spine, the plan picked up by the lower motor nerves that go out to the muscle, and then the muscle has to work to pick up the cup and have a refreshing sip of water. Now in ALS, the brain is fine, the muscle is fine, but those 2 set of nerves, the upper motor nerves and the lower motor nerves, those 2 sets of nerves, they get attacked, they degenerate, and they die off one by one, and that causes the weakness in the muscle. So the muscle really is fine, but it's not getting the message from the nerve, and therefore the muscle gets smaller, it withers or atrophies, and then it loses its ability to move properly.
That's an excellent explanation of that. Thank you for sharing that. Could you give us, what do you think some of the potential causes of ALS are?
Well, that's tough. We know probably about 30 what I call glitches. So there are these things that happen outside of the norm. So a glitch happens, and then as soon as the scientists discover a glitch, they start throwing a medicine at it. Now maybe it's an existing medication that's on the market for another purpose, or maybe it's a brand new medication. So one of the things that we have known early on is that glutamate accumulates in the spinal cord. Now you may think about monosodium glutamate and Asian food, but no, that has no bearing. You can eat MSG and Chinese food, that's fine. But in the spinal cord, there's too much glutamate where that upper motor nerve talks to the lower motor nerve. And that causes abnormal activity in and around the nerve. So it's excitotoxicity or glutamate toxicity. Now, Riluzole, the one drug that's on the market to combat ALS that is FDA approved, that acts specifically on reducing the amount of glutamate at the synaptic junction there in the spinal cord. And it acts to protect the nerve. So taking Riluzole early when there are lots of nerves still to protect is a really great thing and can help people stay stronger longer. I hope that,
yeah, absolutely.
Good.
Let's talk about treatment options.
Well, what a beautiful segue, talking about Riluzole first. So when we talk about treating ALS, I started talking about ALS being a treatable disease about 15 years ago. You think about treatment. Well, treatment is not a cure, it's treatment. You can treat diabetes, you can treat high blood pressure, but you don't really cure those things. You're treating them. So to me, treatment means that you're changing the outcome. You're managing the disease. So that's what we're doing in ALS, and that's why treatment is part of our clinic title, the Forbes Norris ALS Treatment and Research Center. Treatment is focused there. So what we've learned through research, the bang for the buck has really been in management studies, not necessarily in drug studies. Yes, we do have that one drug, Riluzole, but we've learned how to manage the disease better so that people are living longer and having a higher quality of life today.
That's important.
Than they used to. Oh, you bet.
Absolutely.
People stay stronger longer, they live longer, and they're feeling better while they're living longer. And it's through learning more about good nighttime breathing with a little augmentation from a little machine. Sometimes people call that BiPAP, but it's non-invasive ventilation, or paying attention to nutrition and general good health. Those are the things that we really pay attention to today.
Fantastic. What about the National ALS Registry? Can you tell us a little bit about that?
Well, yeah, so the National ALS Registry is just that. It's a registry of people who have ALS, and they are looking to get thousands and thousands of ALS patients involved in this registry. And it's an observational study. What is this disease? How does it affect people? And if you get thousands of people involved, things will pop up. You'll learn more. And it's a great avenue for patients to get involved in research. They can click a box that says, I'd like to be involved in research. What are my options?
Fantastic, fantastic. Thank you for sharing that information. Moving forward a little bit, we have a segment now to talk about the ALS Registry. If you'll have share this, we'll share this message with you.
Do you have ALS or care for someone with ALS? ALS, amyotrophic lateral sclerosis, is also known as Lou Gehrig's disease. If you're an ALS patient, you can help us create an accurate picture of the disease by joining the National ALS Registry. For many of us, what we know about ALS starts and ends with the story of this baseball legend, but we don't have all the pieces to the ALS puzzle. Joining the registry is simple and only takes about 5 minutes. Your information, combined with other patients' information, could help scientists as they work to determine the causes of ALS, find treatments, and perhaps one day, a cure. In the future, your information could help others with ALS live longer, healthier lives. For more information about the registry or to join, please visit www.cdc.gov/ALS. Thank you for helping ATSDR complete the picture as we strive to solve the puzzle of ALS.
The ALS Registry is extremely important, as we were discussing earlier. We can register online. It's a very easy process. It doesn't take much effort whatsoever. And it just is random questions that are asked, and it helps to categorize things. Let's talk about nutrition.
Yes.
How does nutrition affect people living with ALS?
Well, we know that in many diseases, if you lose weight, or if you lose too much weight too fast in particular, that you won't do as well. Now, for many times when people are having chemotherapy for cancer, for instance, they'll put in a feeding tube just as a temporary thing so that the patient will be well nourished when they've lost their appetite and they have lots of nausea and such. So that kind of knowledge really informs ALS as well. So we know that ALS is a disease in which the muscles wither, so you lose some weight. It's expected to lose a little bit of weight because of the muscles getting smaller. We don't know how much weight loss is okay, but there's new evidence to say that greater than 5% of your body weight before you got ill, so we call that premorbid body weight, losing greater than 5% of that, people don't do as well. They don't live as long or feel as good. So how do we pay attention to diet? Is there any special diet? People always ask. There's no special diet, so just a good general diet, but then keeping track of your weight. So some people become hypermetabolic with ALS. They start to burn their calories just because they've got this disease. And when they do that, they need maybe 1,000 or even 2,000 more calories a day. And they don't know if they're hypermetabolic or not, and we can't tell. So just hop on the scale once a week. See how you're doing. Being knowledgeable is really powerful. You got the knowledge, then you can do something with it. This is something that's really in the patient's control, is how are you doing with nutrition?
Fantastic. That's some good information. What about occupational therapy and physical therapy? How does that play into
So
treatment?
certainly as muscles weaken, a person is able to do less than they were before. So it can get difficult to cut your food, feed yourself, get dressed. So an occupational therapist helps with what we call activities of daily living, just those things that I've just talked about. A physical therapist mostly helps with mobility issues. And so we're talking a piece of equipment, a walker or a wheelchair. And the idea is to use the right piece of equipment at the right time. And it could be that you use a cane for short distances, you use the shopping cart in the grocery store, or you use a walker for a little bit longer distance. And if you're going to go someplace, go Christmas shopping at the mall, then you might want to use a wheelchair. So you use these three things piece by piece, and then you start using the the wheelchair more or the walker more and less. So it's using the right tool for the right job. So the physical therapist and the occupational therapist, the two of them, when you come to clinic, they'll assess what's going on. They'll watch you walk. They'll look at your range of motion. How are the ligaments doing in your shoulders or elsewhere? And they'll make suggestions and give you guidance about things that you might not even know are coming up as troublesome. So they keep you ahead of the 8 ball. It's a really great thing.
That is fantastic. So going back to the research, or no, let's stick with the registry.
Yeah.
Let's talk about the registry a little bit more.
Sure.
So if they're involved with the registry, is there anything that, in the research aspect of it, do you guys pull information, or how is the information pulled from the registry?
Right. So this registry is looking at lots of data points. That is, how long people have the disease. If they get weak in one arm, where does it go next? If it takes so long for one leg to get weak, will the arm get weak on the same kind of timetable or not? There's so many questions that we need answers to just about how the disease progresses, that you can only get these answers with thousands of people into a database. So the database can be mined in that respect. It can also be used to, as I said before, for people to say, I want to be involved in research. And so physicians can have an idea. I want to look at the database and say, answer this particular question. I've posed a couple of them. Let's answer this particular question. And then they will put an abstract into the committee that will look at these things, and that idea will be vetted. So not anybody can just look into the database.
Right.
They have to have a good research idea. And there have been databases like this in the past that have been smaller, less ambitious, that have yielded fantastic pieces of information that have led us to know more about how to care for people today. And so this is going to give even more knowledge so we can help people to do better with the disease.
So does this help people with get involved in clinical trials by being at the registry?
It can. Now here in Hawaii, that's a little difficult. Right. Because when you're involved in a clinical trial, the physician who's caring for you in your ALS clinic has to be involved in that trial. And there has to be a critical mass of people. So usually a clinic that's seeing less than 60 patients on a yearly basis really wouldn't have the critical mass to be able to be involved in a clinical trial. But there are some observational trials, and there are some trials with just donating some blood that people would be able to be involved with.
Okay, okay. We've learned a lot through research about ALS. Where do you see things headed?
Oh my! So, I think that In terms of management studies, we're going to learn a lot more about nutrition, good nighttime sleep, exercise, maybe learn more about alternative and complementary medicine with ALS. I know a lot of people use acupuncture and other things, and we need to explore those areas. And there's something called ALS Untangled that you can Google that looks at alternative things, looking for an answer. So that's one thing. But let's talk about drug trials because that's what people really, really want to talk about. So there are a number of drug trials that are ongoing, and there are stem cell trials, and people are so interested in all of these things. I don't know how much time you have for each of these segments, but you know, one of the things that we have to know is that with stem cells, for instance, it's really not ready for prime time yet. We don't know much about stem cells in ALS, but there are 3 good trials going on in the United States. 2 of them are from commercial companies. One is coming out of Cedars-Sinai in Los Angeles, which is an ALS certified center with the Golden West chapter. And they're going to be putting stem cells, some very special stem cells in people. But stem cells are not a cure.
Right.
You still have ALS, even if you put replacement cells in, it's not a cure. So people have to be cautious about that and talk with their ALS physician about what's going on.
Fantastic. Let's see, what else? Can you discuss with us the new research, including the Cytokinetics clinical trial?
I'd love to talk about the Cytokinetics trial because I think it's the most exciting thing that has come on. So this drug is so different than others. It's not aimed at the nerve. It's aimed at the muscle. It's aimed at fooling the muscle into thinking it's getting a strong message from the nerve. And in an earlier study, a phase 2 study, it actually showed that there was an increase in muscle strength in a subset of people who took this drug. So let's say that normal strength is here, the patient's strength is here, and what we saw was it just bumped up a little bit. And that was breathing muscle strength and arms and legs. So it's in a phase 3 study right now, which means that if this study is positive, they will apply to the FDA for this drug to be put onto the market.
Exciting.
It's very exciting.
Very exciting.
Yeah.
Very exciting.
It'll be about 2 years probably before it gets to that point. It's a 14-month study for each patient. It's just gotten going recently.
Okay, well, fantastic. Now let's hear a word from our President and CEO, Fred Fisher.
Aloha. ALS robs a person of the ability to speak.
Hi, I'm Margaret Reed McDonald, and I wrote this book called Earth Care, World Folk Tales to Talk About. 35 stories from peoples all around the world on caring for our planet. I'm going to tell you one from Brazil called the Curupira. In Brazil, they have a creature called the Curupira, and he is the father of the animals, the keeper of the forest. He's very small, about the size of a 5th grade boy. And he has hair all over his body. He has pointy ears. He can hear anything that happens in the forest. And he rides a wild boar.
Patients who are at the walks and just act as a support. And I think the walks are probably the high point of what goes on in terms of fundraising for the ALS Association. And it helps money to come back to the centers that we desperately need.
And it's a celebration, too.
Oh,
it's
fun. Yes.
1 year we get together, all of us, and we celebrate, and it's really fun.
It's fun for the whole family.
Yeah.
It's fun for the community. It's fun for the community. We have a fun time. You should come back to ours. Come back for the Hawaii Walk.
I'd love to.
Taryn, what chapter resources are available to families who are facing ALS?
Well, we've been here in Hawaii for about 3 years, and we've developed support groups on almost all the islands, Maui, Kauai, Big Island here. We even have a ventilator support group. We have loan closets on all those islands that I'd mentioned. We have 2 ALS clinics here now that have just started in Honolulu. And for more information, you can call us on our phone number. What is that phone number?
808-888-9627, or you can look us up on als-hawaii.org.
Thanks, Gala. So we have great things coming, and hopefully we'll bring research here too. That's the next thing to work on. Yay.
Fantastic. So we have the clinics. We have support groups. We have equipment closet.
We have videos about breathing, respiratory issues. We have periodicals, books. We have online webinars. We have a great website that has care manager information. Caregiver information as well. And then even some of our support groups, we break out into caregiver help as well.
Well, I think one of the other things that you're downplaying is your role as a care services manager. So why don't you explain a little bit about what you're doing when you're going out to the homes?
Sure, I go out to the homes, and I try to see everybody monthly or bi-monthly, depending on the islands, and I somewhat assess where they are.
Then he heard a man was coming down the river who was buying the skins of wild animals and the feathers of beautifully colored birds and paying a lot of money. I can make a lot of money. I'm a good shot. He went into the forest. He began to kill everything he saw. Bam, 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 bam. 6 deer, just like that. Bam, 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 bam. 6 peccary pigs. Okay. Bam, 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 bam. 18 beautifully colored birds. Bam. He even killed a jaguar. Yes. He drug all the animals into a clearing. He was going to skin them, take the feathers, take the skins, and pack them out and get rich. He had just taken his knife out to cut the first deer when he heard a rustling in the bushes. And out of the bushes came a chicken. The chicken didn't have any feathers on it. It was a totally naked chicken. The chicken looked at him and shook its head crossly. And from the forest, a voice boomed out. Esteban, did you find my animals? Yeah, boss. They're all here, Kudapera. What'll I do with them? And the voice said, bring them to me, that's what. And the little chicken began to march down the row of dead animals and peck on them. Peck, 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 peck. Come on, dear, get up. Kudapera wants you. And the deer came back to life. Peck, 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 peck. Come on, peccary pigs, Kudapera wants you. And the pigs snorted and came back to life. Peck, 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 peck. Come on, birds, peck, peck, come on. And the birds ruffled their feathers and came back to life. Peck, peck, peck. Come on, jaguar. Kudapera wants you. And the jaguar came back to life. The little chicken lined them all up in a straight line and began to march into the forest. But before he left, he turned and looked back at Carlos the hunter. Hey, boss, what about the man? What'll I do with him? And the voice called, leave him for now. We'll come get him a little later. And they all disappeared into the forest. Carlos dropped his knife. He dropped his gun. He left behind the knife. He left behind the gun. He left that forest. He left that territory. He never came back. But he left behind the story to warn everyone what happens if you take too much game and anger the Kurupila. A true story from the Amazon.
We do it island style. From the mountain to the ocean, from our windward to the leeward side. 大丈夫だよね。で、返事はねえ。ああ辛い。水が飲みたいよ。何ですか？はい。私は大丈夫です。大丈夫なんです。静かにしてください。大丈夫なんです。ちょっと妊娠してるんですよ。大事にしてください。もっと静かに動かしてください。だから私は大丈夫です。お腹の赤ちゃんを大事に。どこにいたの？心配させないでよ。なんで手紙くれなかったの？いい。言わなくていい。黙ってここに座って。たくさん話したいことがあるの。ああ、痛い。ここはどこ？誰ですあなたは？何ですって？どうして私はここにいるんですか？主人はどこです？今までここにいたんです。ああ、痛い。ちょっと待って。どこへ行ったんです？赤ちゃんです。私のどこなんです？無事ですよね？無事ですよね？
tangata e tiki inu mai ana, ka tahi ka tikina e ia te e ka. Kari ai. Hei! Kukuriri ana te pononga atu tāne kai ka hoki atu i atu te whare. Ka tono anotia e te tāne kai tāna pononga kia hoki atu ki te awa me tiki inu maa. Ke mai anō te pononga atu tāne kai te tāna iku tuarua, tiki inu mai māna. He oi, ki te atu anō ai ne mai tēnei tau te hare kame tāna iku ka. Anu anō! Hei, hits! Kukuriri ana te pononga atu tāne kai ka hoki atu i atu te whare. Ka mea atu ia ki atu tāne kai ika. Ki pukaru i tēnei tangata tēnei iku. E kei hoa tu tāne kai, hou, wai a te tau te kai ka nāna tau ipu pakaru. E kei hoa tu tāne kai se punaka te. Ui, ui. O tana ipo, wai rewa. Tūtaki oi rā aua, ka hongi, ka hairu. Kukua ki te awa mai o tui ngā whatu manoa, ka whakaahua tu tāne kai. E wā. Me hoki tā awa ki ta kuwhare te whakawhai atu. Ketika dia sampai di suatu tempat yang luas sekali, di sana ada berbagai macam makhluk yang ada yang mendalanginya, ada yang membunuhnya, ada yang mau menelannya. Ada yang mau membantu, ada yang mau menyusahkan. आणि तुमच्यासारखे सारे विद्वान सभेत उपस्थित आहेत. द्यूताचा खेळच निवडते. युधिष्ठिर, आपलं सारं राज्य पहिल्यांदा पणाला द्यूताचे ठासे घेऊन ते चांगले आणि सारं राज्य दुसऱ्या बाजूला दुर्योधन ठासे घेऊन ते सगळं राज्य जिंकतो. आता कोणाला काय हवं? संपत्ती, सारी संपत्ती परत एकदा म्हणावं. ठासे घेऊन देवाचं नाव परत एक हा दुर्योधन ते फासे घेऊन परत एकदा जिंकतो. तुमची सारी संपत्ती झाली माझी. आता काय लावणार कोणाला? मला स्वतःला आणि माझ्या चारी भावांना लावतो पण परत एकदा भाग तो भाग दे. काय तुम्ही आमची भावना आमची संपत्ती आता काय एक गोष्ट तुमच्याकडे असणार तुमची सुंदर द्रौपदी माझी झाली, आमची झाली. तिला घेऊन या. द्रौपदी अंतःपुरात एकवस्त्रात रजस्वलम तिचे केस लांब तुटलेले न बांधले त्या केसांना खेचत दुःशासन तिला सभेत घेऊन येतो. सगळ्यांच्या समोर विचारते, हा काय न्याय आहे? हा काय न्याय? काय न्याय आहे? तुम्ही स्वतःला पाहिल्यानंतर मला पणाला लावली कशी? न्याय अन्याय कोणाला विचारतेस? तू आता आमची संपत्ती आहेस, माझी संपत्ती आहेस. तू आमची संपत्ती आहेस. मी कोणाचीही संपत्ती नाही. अजिबात नाही.
ったり木に登ったり川で泳いだりするのが大好きでした。ある日のこと、海入りの木の枝に男の子が座っているのを見つけました。遠くの海がよく見える場所を捉えたので、女の子は男の子を吸い下ろそうとしました。長い間取っ組み合った末、枝は折れてしまい、二人は地面に落ちてしまいました。長い間泣いた後、二人は海の話をし始めました。大好きな海の話を。それからは二人は時間があれば一緒に海へ行きました。春には大きな波を見に、夏には泳いで競争し、秋には裸足で砂を感じに、冬には海辺を一緒に歩いて、何年か経ったある日のこと、大きくなった男の子は町へ引っ越すと言いました。それは村を出て行く前の日でした。なんで早く言わないの？女の子はそっと向き、海へ入っていきました。女の子が海辺へ戻る前に、男の子は家へ帰っていきました。女の子の涙を見たくなかったから。女の子は男の子がいなくなるまで泳いでいました。男の子の思いを知りたくなかったから。でも二人とも知っていました。波が浜辺へ戻るように、また人は会えるということを。
from our windward to the leeward side.
Well, praise the Lord, everybody. This is Evangelist Mary Ann Penn coming before you in the presence of our Lord and Savior. Amen. It's good to be before you. Let's start it off with prayer. Father God, in the name of Jesus, I ask that you would increase, that I would decrease, oh God, that you will come in and speak through me, God, and have your way concerning the souls of this world. Oh God, in the name of Jesus, Lord, in the name of Jesus, Lord, we need you now more than ever. Oh, God, have your way in this service today. In Jesus' name. Amen. Let's go to Ezekiel 34, where it says, "Thus saith the Lord, Son of man, prophesy against the shepherds, and say, woe to them who feed themselves and fat themselves up and leave the flocks, the sheep, out there to slaughter." I want you to know that God has a word for you shepherds that's out there that said that you would stand and preach the word of God, that you would pray for people, that you would lay hands on the sick and they will recover, that you would be a shepherd in the midst of the flocks of God's people. Amen. Shepherds, you are not doing your job. You spending the saints' money and you're not praying for them. You ain't got time to pray for them. You too busy running out the back door to see what you can buy or what you can get with the saints' money, and the saints need you now. We need to come to the church and pray like never before. Shepherds need to be calling the saints in to pray for the leaders. You see what's going on. If we all come together and pray on one accord, God will move. The Holy Spirit will move and knock down some of these demonic things that's happening. But you shepherds, you're so busy feeding and getting fat off of the saints' finances instead of having the finances there for the saints when they need help with their electric bill or help with their rent, that we can come to the church and ask for help. But we can't come into the church and ask for help because you're too busy spending the saints' money buying better houses and riding around and letting people see who you are. You ain't nothing because God called you to preach the word of God. Instead of you doing what God said, you out there trying to be a celebrity, trying to let people know who you are. Your word, you like Ichabod. Christ ain't even in your church no more. It's you that's preaching, not the word of God. The Spirit of God has left. You robber, you stealer. I want you to know that God is coming for everything that you got, that you have stolen from the saints, that you said that you were going to minister the word of God, that you would do whatever God said. You done got money all in your pockets, all in a bank account, and you done forgot the word of God. May your houses be burned down. May your money disappear. May the tires off of your car roll off in the name of Jesus, because you lied to God. You lied to the Holy Spirit. You said you would preach the word of God. You said you would be here for the saints. You see what the devil is out there doing. He's out there destroying our brothers and sisters because you're not behind the pulpit preaching what thus said the Lord. God's going to get you. And I'm just here to tell you that God said that your days are numbered in fruit. F-E-W. It's numbered in fruit. You ain't got too many days before you look up and you'll be looking up with Jesus. You'll be looking up to hell or you'll be looking up to heaven. It's either one or the other because you're not doing what God called you to do. We got our brothers and sisters out here being slaughtered by the enemy because the man or woman of God, they're not in position to minister, to pray, to call on God, to seek God's face concerning the affairs of this world. I'm telling you, saints of God, we got to put on the whole armor of God and stand and do all the stand and stand on the word of God, which God's word said he will keep us us. He will keep us from falling. He will keep us from the hand of the enemy. And we got to come together and have church by ourselves and have group church, people come to people's homes, and let's all pray and call upon the name of Jesus and believe God for a turnaround. Amen. Ministers, everything that you got that you stolen from the saints of God, you're not doing your job, it will be taken and it'll be given to somebody else that's going to minister word of God, that's going to lay hands on the sick, that's going to give hope to the saints. Let them know that all is well, that Jesus is in control. I'm telling you, you dogs of a shepherd, may God have mercy upon your soul. May the blood of Jesus be against everything you do from this day forward. You take in the saints' money, but you're not doing what you said you was going to do. You're not laying hands on the sick. You're not praying for the brothers and the sisters. You're not praying for the mothers that lost their sons and daughters, but you keeping your sons and daughters close to you to make sure nothing happened to them. Baby, you can keep them up under your arm. The enemy still going to snatch them out because you went back on your word. Saints of God, I want you to know that Jesus loves you, that God sent his son Jesus to die on the cross for our sins, and on the third day, he rose with all power in his hand. I want you to know that you got a Savior that will keep you. His name is Jesus. For God so loved the world that he gave his only begotten Son, that who shall ever believe it in him shall not perish, but you'll have everlasting life through Jesus Christ our Lord. I want you to know, saints of God, don't be worried about what's going on. God has it in control. Stay prayerful, and when you see what's going on, just pray. Get your brothers and sisters together and come together as a unit, as a group, and pray. Pray concerning the affairs of this world. You see what's going on. Pray for our presidents. See, pray for our leaders, our cabinets, our legislators. Pray for them because they need our prayer. Amen. I want you to know that Jesus loves you, and that it's going to be a turnaround in all our lives because Jesus is sending the Holy Spirit. Jesus is going to send somebody that's going to preach the word of God, that's going to give you hope, that's going to give you strength. I want you to know there's hope in the word of God. I want you to know that no weapon formed against us shall prosper. Any tongue rises up against us shall be at fault because we stand behind the Father, and the Father goes before us and makes the crooked way straight. I want you to know the blood of Jesus. I plead the blood of Jesus over every family home, every brother and sister, every family that's lost loved ones. May the Lord God be with you and keep you. I want you to know that Jesus loves you, and we're praying for you, and I want you to know that you got a right to be free. Call me for prayer. We will pray and beat down the work of the enemy. I love you, and Jesus loves you, and you got a right to be free. Amen.
Marines perform their precision drill in hundreds of public appearances throughout the United States and abroad each year. In addition, they represent the Marine Corps at numerous ceremonies in the national capital area, honoring visiting dignitaries and heads of state. Comprised of highly trained Marines from Marine Barracks, Washington, D.C., the Silent Drill Platoon executes its drill sequence without cadence or verbal command. The M1 rifles they carry with fixed bayonets weigh in excess of 10.5 pounds. Representing Marines around the world, the Silent Drill Platoon demonstrates the finest in Marine professionalism, esprit de corps, and marching precision.
from our windward to the leeward side.
Hi, I'm Margaret Reed McDonald, and this is a story that was told me by Layla Oman, an Eskimo elder from Nome, Alaska. She said call her Eskimo because that is what she is. She doesn't like the word Inuit. Well, she told me this story because when she was a little girl, she said they used to go and stay on the tundra in the summertime in a tent, in a skin tent. And her father told her this story every single night. Every night. Little Mouse was swimming to Kotzebue. Little Mouse was swimming to Kotzebue to get married. He was so happy. He was so happy. He said, I'm swimming to Kotzebue to get married. I'm swimming to Kotzebue to get married. I'm so happy. I'm so happy. Little Mouse was swimming to Kotzebue to get married. He was so happy. The willow trees on the banks of the river bent over and called, Mouse, Mouse, be careful where you swim. Don't go near the deep water. Don't go near the deep water. I'm swimming to Kotzebue to get married. I'm so happy. I'm so happy. I won't go near the deep water. I won't go near the deep water. Little Mouse was swimming to Kotzebue to get married. He was so happy. He was so happy. He didn't look where he was going. He swam right into the deep water. A big pike fish came up and swallowed Little Mouse. The end. I said, Layla, the boys and girls aren't going to like that story. She said, that is a very important story. She said, my father told that story every night because there were wolverines and polar bears on the tundra. If we weren't alert, they might eat us up. Your children won't be eaten by a polar bear or a wolverine, but they could be going down the street. It's my birthday. I'm so happy. I'm so happy. I'm so happy. Run out in the street and boop, hit by a truck. So tell the story to everyone you know. Hi, I'm Margaret Reed McDonald. I'm going to tell you a story called Look Back and See. It's told by the people in Tanzania. It's from a book I wrote called Look Back and See. And you can tell the story too if you look for the book. Now, when stories are told in this part of Tanzania, the storyteller says, I went and I saw. And if the audience went to hear the story, they say, see so that we may see. I went and I saw. I saw a village where there had never been a dawn. The sun had never shone. The people lived in darkness all of the time. Just over the mountain lived the chief who owned all the sunshine. If he wanted sunshine, he would take it out and spread it around the valley. And meanwhile, on the other side of the mountains, the people were in total darkness. Now, the chief of the village of darkness decided to try to buy some dawn. He called a messenger and said, I'm going to send you over the mountain to buy some dawn. Here are 1,000 cowrie shells. Cowrie shells from the ocean. One shell was like $1 so far inland. The servant put on the cowrie shells over his neck, and he started to climb the mountain. He went up the mountain. He went up the mountain. He went over the mountain. He came down the mountain. He came to the village and he stopped. He said, Chief Lugeye, that was the name of the chief, I would like to buy some dawn. Dawn? Dawn, said Lugeye, I have a whole box full of dawn. What do you have to buy it with? I have 1,000 cowrie shells. Hand them over, said Lugeye. 1,000 cowrie shells? Okay, you may have the dawn. Hold it tightly, sir. Just one thing. When you climb the mountain, don't look back. He went up the mountain. He went up the mountain. A little maid at the gate of the village opened her eyes and watched him go. Man, man, you've taken the dawn of Legaye. Look back and see what Legaye does. He sings with his arms, he sings with his legs. He's wearing shells like dancing maidens. They go chucku, they go wah. 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 Whoa! The man had to see that. The chief was dancing. He turned, he looked back. Oh, clap, snap. The dawn was gone. He went up the mountain. He went over the mountain. He came down the mountain. He came to his village, and he stopped. He said, Chief, I had the dawn in my hand, but I looked back and I dropped it. Oh, no. You failed us, sir. Who can go? Who can go? And a woman spoke up. I could go. Well, you may try, ma'am. Here are 2,000 cowrie shells. Go over the mountain and buy us some dawn. She went up the mountain. She went over the mountain. She came down the mountain. She came to the village and she stopped. Chief, Legaye, I would like to buy some dawn. Dawn. I have a whole box full of dawn. What do you have to buy it with? I have 2,000 cowrie shells. 2,000 cowrie shells? Yes, said Legaye. I will sell you some dawn. Here, ma'am. Hold it tight in your hand. And just one thing, when you climb the mountain, don't look back. She went up the mountain. She went up the mountain. The little maid at the gate of the village opened her eyes and watched her go. Ma'am, ma'am, you've taken the dawn of Legaye. Look back and see what Legaye does. He sings with his arms, he sings with his legs. He wears shells like dancing maidens. They go chucku, they go wah. They go chucku, they go wah. They go chucku, they go wah. They go chucku. Wow! She had to see that. She turned and looked back. Clap, snap. The dawn was gone. She went up the mountain. She went over the mountain. She came down the mountain. She came to the village and she stopped. Chief, I climbed the mountain. I had the dawn in my hand, but I looked back and I dropped it. Oh, no. Who can go? Who is stronger? Who can go? A little dog spoke up. I can go. Let me go. I can go. Pardon me. Aren't you a dog? Yeah, but I can do it. Let me go. Well, the woman failed. The man failed. We can let the dog try. I gave you 3,000 cowrie shells, dog. Bring us back some dawn. And the little dog started up the mountain. He went up the mountain. He went up the mountain. He went over the mountain. He came down the mountain. He came to the village and he stopped. He said, Chief, want to buy some dawn? Legaye said, Dawn? Aren't you a dog? Yeah, but I got 3,000 calories. Dawn, 3,000 calories. Of course, little dog, I can take 3,000 calories, and you may have some of my dawn. Hold it tight in your teeth, little dog. And when you climb the mountain, just one thing, don't look back. He went up the mountain. He went up the mountain. He went. The little maid at the gate of the village opened her eyes and watched him go. Dog, dog, you've taken the dawn of Legaye. Look back and see what Legaye does. He sings with his arms, he sings with his legs. He wears shells like dancing maidens. They go chucku, they go wah. 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 He went up that mountain. He didn't look back. Dog, dog, you've taken the dawn of Legaye. Look back and see what Legaye does. He sings with his arms, he sings with his legs. He wears shells like dancing maidens. They go chucku, they go wah. 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 He went up the mountain. He wouldn't look back. The dog went over the mountain. He never looked back. The little dog came to his village. He opened his mouth. The dawn came out. It covered the hills. It covered the valleys. It was so beautiful. It was so beautiful. I said, I must go at once and tell everyone what I saw. I saw. That is what I saw. Hi, this is the Little Rooster's Diamond Button. It's a photo from Hungary, retold by Margaret Reed MacDonald. That's me, and Will Terry made the pictures. It's a really easy story to tell, and you can also find it in my book, 20 Tellable Tales, so you can get a copy just anywhere. Listen up and see if you can tell it too. Somewhere, someplace, across the 7 seas, lived a little old lady and her little pet rooster. They were very poor, but they were very happy. One day the rooster went out to peck out something to eat. He pecked and he pecked and he pecked and he pecked, and he pecked out a diamond button. "Cock-a-doodle-doo," said little rooster. "I like diamond buttons. I'll take it home to my good mistress because she likes diamond buttons too." He picked it up in his beak and he started to walk home. But just then, along came the king. Whoa! He was a very big man. He wore big, baggy trousers. His pants were so big, he had to have 3 servants walk behind him and hold up his pants so he could walk. He came walking down the road, and the servants came behind, holding up his pants. He saw the little rooster, and he wanted that diamond button for himself. He said, "Catch that little rooster and take his diamond button away from him. Put it in my treasure chamber in the palace." They caught the little rooster, took his diamond button away, and put it in the king's treasure chamber in the palace. Little rooster was so angry, you can imagine how he felt. He flew right to the king's palace. He perched on the windowsill, and he called out, "Cock-a-doodle-doo, cock-a-doodle-doo, cock-a-doodle-doo, give me back my diamond button." The king was angry. He was mad. He said, "Catch that little rooster and throw him in a well full of water. I'll get rid of him." And they threw him kersplash into a well full of water. But little rooster called out. He had a magic stomach. He said, "Come, my magic stomach. Come, my empty stomach. Drink up all the water from the well." His stomach began to drink. He drank up all the water in the well. It couldn't hurt him at all. Flew right back to the king's palace, perched on the windowsill, and he called out, "Cock-a-doodle-doo, cock-a-doodle-doo, cock-a-doodle-doo, give me back my diamond button." The king was angry. "Catch that rooster and throw him into the fire. I can get rid of him." They threw him in the fire, but he called, "Come, my full stomach, come, my full stomach, spit out all the water from the well. Put out the fire." Psh, his stomach spit out all the water. It put out the fire. Couldn't hurt him at all. He flew right back to the king's palace. He perched on the windowsill, and he called out, "Cock-a-doodle-doo, cock-a-doodle-doo, cock-a-doodle-doo, give me back my diamond button." The king was furious. "Catch that rooster, throw him in the beehive where the bees live. Let the bees sting him." They caught the little rooster and threw him in the beehive. But he called, "Come, my empty stomach, come, my empty stomach, eat up all the bees." They couldn't sting his magic stomach. He flew right back to the king's palace. He perched on the windowsill, and he called out, "Cock-a-doodle-doo, cock-a-doodle-doo, cock-a-doodle-doo, give me back my diamond button." The king was infuriated. "Catch that rooster. Bring him to me. What'll I do with him?" And the first servant said, "If I were you, I would chop his head off." The second servant said, "If I were you, I would hang him from a tree." And the third servant said, "If I were you, I know what I would do. I would sit on him and squash him." It was a good idea because he was a very big king. He said, "Catch that little rooster, drop him in the big bag on my baggy pants behind, and I'm going to sit on him and squash him." They caught the little rooster and dropped him in the big bag on the king's baggy pants behind, and he started to sit on him. But the little rooster called, "Come, my full stomach, come, my full stomach, spit out all the bees and sting that king." He was jumping around the throne room. He said, "Catch that little rooster, take him to my treasure chamber, and let him have his old diamond button. I don't want to see him again." They took the little rooster, and they left him all alone in the king's treasure chamber. They said, "Take your diamond button and go along home." Little Rooster looked around. He saw all the diamonds, all the emeralds, all the gold and silver, all the rubies in the king's treasure chamber. He said, "This is the treasure the king has been stealing from the people all these years." Well then, come my empty stomach, come my empty stomach, eat up all the treasure in the king's treasure chamber. His stomach ate up all the diamonds, all the emeralds, all the gold and silver, and he waddled home and gave it all to his good mistress. And they lived happily and richly ever after. Hi, I'm Margaret Reed McDonald. I'm going to tell you a story called Not Our Problem. It's from a book called Peace Tales, World Folk Tales to Talk About that I wrote. You can tell this story too. It's very easy to tell. It's told in Thailand and in Burma. The king and his advisor sat eating honey on puffed rice. A drop of honey fell from the king's mouth to the windowsill, and the advisor said, "Oh, Your Majesty, should I wipe that up?" "No," said the king, "it's not our problem. The servant will get it." The drop of honey dribbled off the windowsill and fell to the ground beneath the palace. And a fly lit on the drop of honey and began to eat it. And a gecko jumped on the fly and began to eat the fly. Whoa. The advisor said, "Your Majesty, the drop of honey that fell from your mouth has fallen to the ground under the palace, and a fly was eating it, and a gecko was eating the fly." "Oh," said the king, "it's not our problem." Just then, a cat ran out, jumped on the gecko, and began to eat the gecko. A dog saw the cat, ran out, and attacked the cat. The dog and the cat were fighting under the palace. "Oh, Your Majesty," said the advisor, "you know the drop of honey that fell from your mouth? Well, a fly ate the drop of honey, a gecko ate the fly, a cat ate the gecko, and a dog has attacked the cat, and they are fighting under the palace." "Well," said the king, "it is not our problem." The woman who owned the cat saw the dog attacking her cat. She grabbed her broom and began to beat the dog. Oh, the dog's owner saw the woman beating the dog, and he ran out and began to beat the woman. Now the man and woman were fighting under the palace. "Oh, Your Majesty, now there's a man and woman fighting under the palace because of the drop of honey that fell from your mouth." "Well," said the king, "it is not our problem." The woman's friends saw her being attacked. They ran out and began to attack the man's friends. And then his friends saw him being attacked. They ran out and began to attack the woman's friends. And the woman's friends and the man's friends and the man and woman, they were all fighting under the palace. "Your Majesty, the drop of honey that fell from your mouth, well, a fly ate it, a gecko ate the fly, a cat ate the gecko, a dog attacked the cat, a woman attacked the dog, a man attacked the woman, her friends attacked him, his friends attacked her. There's a whole fist fight going on under the palace." "Well," said the king, "it is not our problem." Just then the soldiers were marching through town. They saw the fight and they ran to break it up. But when they heard the issues, some took the man's side, some took the woman's side. They began to argue among each other, and then they began to fight. And in the fight, someone drew a pistol and fired a shot, and a civil war broke out. And in the war, the palace caught fire and burnt to the ground. The king and the advisor stood in the ashes. And the king said to the advisor, "You know, I think the drop of honey was our problem."
Welcome to government contracting. The federal government is required by law to provide opportunities to small businesses, including yours. So is it worth it? Absolutely. In 2015, SBA authorized $27.9 billion in loans and included individuals on probation or parole to access SBA microloans. And they also helped small businesses access $100 billion in contracts. So, go to your local SBA and look into getting the loans and the contracts that you need to grow your business.
모두 날 보며 모두 날 보며 내가 널 봐도 모두 날 보며 내가 널 봐도 내가 봐도 찬란 유전자 That's right got my spaceships on superfly 모두 물어봐 도대체 엄마 누구냐 go
So I'm presenting a video that I made a few years ago. And I put it on YouTube, and it was in two parts. It was I call it the decline of Dungeons and Dragons, and I give reasons why I believe Dungeons and Dragons kind of fell off and declined. It's kind of gaining some popularity again. It was kind of like in its heyday was the 80s. It was most popular in the 80s, and it kind of fell off after that. And it's kind of making a slow comeback. But I think that most of that is from people that are saying that they play, but I don't really play. And because there's a popularity of the nerd culture going on these days with the Comic-Cons and all the con conventions and stuff, more people are saying that they love Dungeons & Dragons. It has a retroactive popularity to it now. I remember when I was young, it was kind of nerdy. You didn't want to. Sometimes you didn't want to admit that you played it, and now it's kind of making a comeback, and that's good. But in the video, I give reasons of why it declined and so forth, and those reasons are still here today, some of them, and I think it's a very interesting video. You should, and everybody should watch it. I think if you're interested, you should watch it, and this may get some people into Dungeons and Dragons. I also wanted to talk about why Dungeons and Dragons is such a great game and how unique it is, and I'm going to be making a video about that soon too. But in the meantime, please enjoy this two-part video that I made a few years ago. I have the audio, and so it's all about just listening to my particular point of view and my reasons. Thank you. The decline of Dungeons and Dragons, the fall of Dungeons and Dragons. I'd like to make an in-depth article about that, but people like to talk about, well, they think it's the main reason is that the PCs took over, and I have something to say about that. Yeah, they say like the PCs. Let me go through flip through see some of the other pictures here. And that's part of the reason is, you know, computer games took over. But just go through the beginning. Yeah. Okay. But let me put the camera to me. Okay. I played. When I was young, I had a PC playing Dungeons. PC. There are computer games out there that were role-playing games like Alternate Reality and Bard's Tale and Ultima, which was the best. And that didn't drive me away from, and that didn't drive other people away from RPG games, paper and pencil games, you know, that it may have enhanced or, you know, was like a fix. It was kind of a temporary fix. You're all by yourself, you know, and that's why you wanted to play PC games. But the main event, the big event was like paper and pencil with your friends in a circle on a table, rolling dice. That was Dungeons & Dragons. That was like the main event. That's like watching a football game versus playing fantasy football, you know, having a fantasy football league. You know, it's the temporary fix. It's the it's something that will give you a little satisfaction until you have the big event on the weekend or whatever, you know, when you play it. That's the appeal of that to me was much better than PC games. And to say that PC games took over Dungeons & Dragons, you know, the game RPG, you know, the paper and pencil Dungeons & Dragons, it tells me how socially probably inept we've become in the United States, because we're not social anymore. We want to stay by ourselves on the computer and stay in a room alone and not socialize and gather and stuff. And, you know, that's another thing. Another thing is the perception that it's nerdy, and the other reason would be just the way it was marketed, and I'll talk about that. So I'll elaborate on, you know, like some of the things that killed Dungeons & Dragons, that made, you know, the decline of Dungeons & Dragons, the fall of Dungeons & Dragons. And one of the things is that it was perceived as being loved by nerds and only played by nerds. But when I was young, everybody played it. I mean, it was a very popular game, and, you know, cool people played it, and jocks played it, and, you know, pretty girls played it sometimes, you know. It was like I said, it was a popular game, and not just nerds played it. And then there was this perception that only nerds, losers, you know, people like that played it. And what I thought that Dungeons & Dragons should have done was, you know, Gary Gygax said us, would defend their game, and you know, and tell these people to shut up because they're idiots, and compare the game to other activities and hobbies. I would compare Dungeons & Dragons to other activities and hobbies that other people, cars or collecting coins and stuff. What's so great about that? What is more nobler, or what is more interesting about doing that than playing Dungeons & Dragons? You know, and they should have kind of went hard and defended their game and defended the people. They were insulting the people that were playing the game. They just sat there and didn't say nothing, and that was crap, you know. Another thing is that I remember when I was young, everybody played. Like I said, it was really popular. Everybody played, so I would join in these other groups, and most of them were terrible. Most of them did not know how to play the game, did not know the rules. They didn't know how to, they didn't know what the dice were for. They didn't know how to tell good stories. They were bored. People were saying, this is kind of boring, man. And what Dungeons & Dragons, they should have done was they should have, like, gotten a DVD, or not, well, a VHS, because DVDs weren't around then, but a VHS tape and sold like great dungeon masters playing great sessions of Dungeons & Dragons, and actually study their game, study the people playing their game, and see who's doing this and who's doing wonderful things with the game and who's coming with great stories and stuff. A contest of who the best dungeon master out there. I mean, talk about like super geek of the universe, you know, but who would be like the best Dungeons and Dragons player, dungeon master, and who comes up with great stories, who's in tune with the rules, who has great imagination. And then they should have had that guy, and you know, and kind of like and kind of show people and tell people how this game is played. They didn't really, you know, after you bought the books, you're kind of like left on your own. And what I saw with like maybe a DVD, well, like I said, a VHS tape of great Dungeons and Dragons being played, actual Dungeons and Dragons being played. I think that would have been a great idea. It would have been novel. It would have helped the game. It would help all these losers who didn't know how to play the game learn how to actually conduct a session. Because, you know, now I play Dungeons and Dragons and we have some killer sessions, man. I mean, nobody wants to go home. I mean, you know, I have like, you know, not like standing ovations, but, you know, people are like applauding after, you know, a Dungeons and Dragons session because it was so unbelievable experience. I never seen anything like that. I don't think people are in the cars, or they have a very shallow visual kind of very non-cerebral liking towards what they do. But, you know, Dungeons & Dragons is just the depth of the emotion that you feel in playing the game. It's crazy, and it is what the game is perceived, you know. Some people are, you know, the game can either go all sorts of directions. It's like a tool, you know. It can be used for bad, or it can be used for good. So I'll try to make more videos about like what's a good, more about Dungeons and Dragons, which is my great love. The greatest game in the world, the #1 greatest game ever invented. And I'll try to make more videos about that because I really want to relay this feeling that I have about this and why it's gone away, and how terrible it is that it has.
6th grade. So, aloha, my name is Solomon Enos, and I'm an artist and illustrator. I'm here at Castle High School as part of a commission for the State Foundation for Culture and the Arts. I am Hawaiian, I'm Japanese, I'm Chinese, I'm Russian, I'm Polish, I'm German. I'm Jewish because of my mother. So I have all these different stories that make me. Just like each and every one of you guys are vessels for stories. And we are collectively a larger story. And it's understanding the role of stories is a big part of what we're going to be doing today. But I've been able to basically feed my family by doing art. I've been able to make a career out of telling stories through images, through ideas, and it's something that I really want to pass on to the students and say in this day and age, it's just as valid to be an artist as it is to be a doctor or a lawyer or whatever. The mural process will be very interesting. I've been doing a series of workshops with students, cutting murals into small pieces, painting them, reassembling them, giving them the big picture. A very literal way of talking about how everybody has responsibility. If you do with what you have, if you do a really good job with what you have, then collectively you will have beauty. It reminds me of a quote from Gandhi, and he says, although what you may do may seem insignificant, it is most important that you do it. Even if it's a small piece of paper, if you do a really good job with a small piece of paper, when we assemble the mural made up of everybody's individual piece, you get the instant epiphany for a lot of students. And they all gather around the image at the end of class and say, whoa, this is where my line ends and your line begins. And it turns into her line and then his line. And it's like, well, it's all one story, but it's passing through all of us at the same time. And to me, grid scale murals are a wonderful way of saying, every one of us have responsibilities. Bring as much beauty to this piece of paper. Bring as much beauty to you. Bring as much beauty to your yard. Bring as much beauty to your community. And collectively, we can peel back that layer and we can put together all of these different stories that really is the sum of just so much beauty in our communities. And honestly, sincerely, when I aggregate all of the experiences I've had for the past 12 days or so I've been here, I really do have a tremendous amount of hope for Kaneohe. And I really believe that. There are wonderful students here. There are students that need help, and we just gotta get those folks together so that they're working collectively to solve our problems. And have fun and use a lot of red and blue and green and pink and orange in the meantime. And that's just sort of part of that process.
Solomon Enos is a muralist and an active member of the public art community. Raised in Makaha Valley, his parents were the most influential in modeling his love of his own culture and for the arts. Some of Solomon's past mural work can be seen at Disney's Aulani Resort, the Hawaii Convention Center, the Sheraton Waikiki, and in Kaka'ako.
So the commission that I got was through the State Foundation for Culture and the Arts, and it's a commission designed, it's an artist in school residency program. So sometimes they have different departments. Some might be art and public spaces and different things. For me, the monies come in because every new building that comes up, every state building, 1% of that money gets put into a fund, and that's the fund that the State Foundation uses to create fine art. And Hawaii was one of the first states to do that. I think the idea behind it was whenever you build a building, you block somebody's view. Right? And that's in Kaka'ako right now. There's a lot of people saying, hey, where's my view going? Boop, boop. And they got like 20 more towers to go up. Like, you're not gonna be able to see anything from Tatlas. It's just gonna see a skyline. There's not gonna be a horizon. So, but the idea is that when you remove a view, they wanted to be able to create a fine art piece that at least brings a kind of beauty back to urban spaces. So, you know, it beats not having urban, but I would prefer 2%. I would just want more of it. I would just want more money into it. But the coolest thing about this is that we're not just creating art for a public space. We're creating art that's the sum of students' voices. And that, to me, makes it especially relevant. It's just not me, whoever, or whoever the artist is, coming in and saying, I know your story for you, I'm going to tell your story, just sit back and listen. It's kind of like please tell me your story. All of you can all tell me your story. I'm gonna bring it all together, and hopefully it'll be the collective story. And it may surprise you, because there may be parts of your own story that you don't know. But I always want to enter into this process being very humble. But it is a state foundation for the Arts Commission.
Joseph Aikala is a noteworthy videographer, a Society of Professional Journalism award winner, and senior project mentor.
The argument against it is that it's a waste of public money, but if you look at the budgets, the money that's actually budgeted for public arts, an infinitesimally small part of the budget. Most of the time it's less than 1% of the budget. And it's important because the arts aren't supported in America the way they are supported in the rest of the world. In Europe, for instance, there's national film bureaus, national art bureaus that contribute money to these sort of things. We have somewhat of that with national funding for arts, but their budgets aren't what they could be. And I think it's important. It's important to provide inspiration for future artists. It's important to provide inspiration for everyone.
Okay, downsize politically speaking, the ordinary taxpayer, man and woman who pay taxes into government, does not have a direct say in what art is being produced. There are public organizations, government organizations that make those decisions.
The time that I've spent here working with students has really been a boon for me. It's helped me to get an idea of what stories that I'm working on seem relevant to students today. And that's huge because it kind of keeps me grounded in what's relevant. But it's also helped me to figure out, what messages really resonate with students. And I'm hoping that the work that I'm going to get a chance to do here, that resonance will last beyond this time that I have with the students. It won't just be limited to the commission. It'll be something about the school holistically that will come out of it, that'll really benefit from this whole process.
It's right on the theater, which people pass by a lot, and it's definitely something that'll catch the eye of people. And bringing the community together to do something big like that, that's gonna build, friendships and bonds between not only just people, but families too.
I think it is going to be a good addition because it's all the students together as a whole creating it instead of just one class.
If you can make this piece of canvas beautiful, you can make Kaneohe beautiful. Take care, you guys.
Solomon Enos continues to work on the mural for Castle High School and plans to complete it in 2016. Please look forward to it.
I'm Alicia. I'm Sabrina. McKenna. Cindy. Danila. Jacelyn. And Allie. Thanks for watching Olelo Community Media.
We do it island style. From the mountain to the ocean, from the windward to the leeward side.
Hey, what's up, guys, and welcome to yet another episode of Real Talk TV. It's me, the Black Hawaiian, a.k.a. Lionel Wright, and I know I always say it backwards, but I think of myself as being a Black Hawaiian first and then being Lionel second. So, again, guys, like I always say, at the beginning of the show, Real Talk TV is all about people in the combat sport industry. I'm not only looking for fighters, but I look to talk to coaches, promoters, anybody that has anything interesting. And, like I always say, in the last couple of episodes at least, if you want to see someone on this show, check us out on Facebook, Real Talk TV, and drop me a line. Let me know what you think about the show, and let me know who you want me to interview. And, we can get to know those guys up close and personal. Right now, guys, and I always say this about my guest, but you just got to know that this is actually very genuine when I say it. I got a great guy that I got into the studio, and, this guy, I've known him for a while. I've watched him fight, and I've watched him grow as a person. And I'm very excited and honored, really, to have this guy on the show. Ladies and gentlemen, I want to introduce you to my man, John Bernard. How's it going?
How's it, everyone? I'm good.
All right, cool. So speak up a little bit, man. So John right here, he talks like he's a real soft and quiet guy. But let me tell you, if you are across from this guy in a ring or a cage, he is anything but soft and cuddly, I'll tell you. So John right here, thank you very much for coming on the show.
No problem, no problem.
Right. Thank you for, taking the time. So, real quick, we want to kind of dive into this thing. And basically, Real Talk TV is just about knowing about you and kind of getting people to know who you are. I mean, I think I know you pretty well, but there's a lot of great stories and stuff that people just don't know about who you are and what you are. So, we're going to dive right into it. And the first question out the box, man, I got to ask you is this, man. What is your full name?
No one has ever asked me that. You'll be the first. So, since you're a good guy, I'm going to actually tell you that.
Wow. All right. Go ahead, man.
My name is John Freemark Bernard.
Oh, my God. So that's why you never told anybody. You guys heard it here first, right? You heard it? All right. Freemark. I love it. All right.
Yeah, you never knew, huh?
Nah,
Nobody
never knew. And that's what Real Talk TV is all about, guys, is getting to know the person. There's a lot of people out there who may have known John, and now you just kind of learned a little bit of something that you never heard before.
Yeah, some of my closest friends don't even know that.
That's what I'm saying. Well, that's great. Hey, thank you so much, man. I really appreciate that.
Welcome.
So, along those lines, man, John Bernard, where are you born and raised? Where are you from?
I'm born and raised in Hawaii. Raised on the west side, Makaha. The best side, the west side.
Oh, boy. Check this out.
Yeah, I got a lot of memories out there. A really, really awesome place,
Yeah.
That place is basically about friends and family. Super, super loving place, you know what I mean? And most people may think it's something different, but it's not, You got to live there in order to understand
Right,
this,
understand it. Yeah, no, that's great, man. So what is your nationality, man?
Oh, I'm a mixed plate. I'm Hawaiian, Black, German, Indian, Portuguese.
Wow.
Yeah, so I'm a little bit of everything.
Yeah, that's pretty cool. Well, I knew the Black Hawaiian thing, man.
Yeah.
Wow, that's awesome. Okay, so you got two Black Hawaiians now. Not one, but two. All right.
I'm a Creole Hawaiian.
The Creole Hawaiian, right. That's cool, man. All right, so, we got a little more information about you. So tell me now, growing up in Makaha, what elementary did you attend back in those days?
I went to Kamaili Elementary. It's actually right across the street from the west, Waina High School. Right down there, Uluvehi's area. Not Uluvehi's, but what is that called? I actually can't. It's on the tip of my tongue, but I can't remember. I'll get back to you.
We'll get back to that in a little bit. All right. Okay, so you went to that elementary. In intermediate, you went
Intermediate, Waianae Intermediate.
Okay,
and then Waianae High School.
So you graduated from Waianae High School?
Graduated from Waianae High School, 2007.
Oh, wow.
Yeah. The best year Waianae had.
You know that everybody's watching this, right?
Yeah, that's fine. That's fine.
Okay, so back in the days, you know, going to elementary, you know, were you involved in any sports back then?
No. That's why a lot of people kind of tripped out, you know. I've actually, the first sport that I ever played or done was Taekwondo. I did Taekwondo for maybe like 6 months. That's it. Yeah, and it was really, really short. Like, it was a short period of time. I wasn't able to actually enjoy the sport yet. I just started, so as a kid, 6 months goes by so fast. You know what I mean?
Well, so what year or what age were you about?
Maybe when I was in intermediate, so during my whole elementary to intermediate, I have done nothing. You know, I haven't done no sports. I hadn't done nothing, you know. I wanted to, but there's not much backing at home, you know, as far as allowing me financially to do these things, you know. And then I heard about there's a rec center in Waianae that offered free Taekwondo classes. So I ended up attending that and enjoyed it. Did it for about 6 months, and I guess I probably did something wrong at home, and then my family punished me, so I couldn't go anymore. And they seen the enjoyment I had in that, so they, you know, wanted to teach me a lesson, so I didn't go. And then, yeah, I didn't do anything after that for maybe like a good 3 or 4 more years.
So that was about like high school about now?
Yeah, so now I'm in high school, about 185 pounds, 5 feet tall.
Holy
big
God.
round circle.
Yeah. You look like me, but shorter.
Exactly. You said it, I just thought about it. Yeah, so basically, yeah, I was in high school, and, you know, I just seen all my friends started to dwindle away. They all ended up getting girlfriends, you know. They all ended up doing sports or other things that I've never was involved in. So I basically stuck around one of my really, really good friends called, but his name is Sean Akana. And me and him would be in school basically challenging each other on who could get the better grades. It was always in competition. I'm a very competitive person. Most people may not know this, but at home I'm super competitive. Even with my girlfriend, I'm just super competitive, you know?
Oh boy.
But so in high school, it was always competing who can get the best grades, you know, all that kind of stuff. So it was kind of, I just stayed in that lane while I was in high school for maybe like 2 years actually in high school. So my first 2 years, I just stuck to education in the books and all that kind of stuff, you know?
Wow.
And then I took a lot of business classes in high school. So my year, we had, what is it called? There was this thing called, what is it called? It's Academy. They started the Academy in Waianae. So basically you could pick a direction for your future. So you had a business, arts and communication, human resources. So you could go in a trade or a field. Yeah. So basically your whole high school experience is basically going down that route. So I took business management, and I've just learned a lot of things in the business, and I enjoyed it. So, which basically took me to where I am now. You know what I mean?
Wow.
Yeah.
Oh, that's pretty cool.
Yeah.
So where or how did mixed martial arts come into your life?
Oh, actually, I wanted to lose weight. In about 10th grade, I was 10th grade, and I wanted to lose weight. Like I said, I seen all my friends getting girlfriends and stuff like that. I was like, okay, what are they doing that I'm doing wrong, you know? So I was like, you know, I just figured maybe I need to get in shape or something, you know? So I started training with Team Rootless at the time, and lost maybe about 40 pounds in about 6 months.
Oh, wow.
Yeah, and then ended up fighting.
So back then, like when you started training, what type of discipline were you folks training at that time?
Oh, striking. Yeah.
So
kickboxing. Kickboxing, yeah.
Boxing. Yeah.
Boxing, kickboxing, Muay Thai. Yeah,
okay.
A little bit of Taekwondo, so a little bit, you know. Since I had a little background, I always wanted to put some of Taekwondo inside of our training. So,
all right.
Yeah, we did a little bit of everything as far as the striking aspect goes. Yeah.
So this was back in what year?
2005.
Okay.
About 2005 to about 2008-ish. It was about 2000, yeah.
Okay. So the name of the gym was?
Team Ruthless.
Team Ruthless,
yeah,
all right.
Which consisted of 5 guys.
Oh, yeah. So who was the 5 guys?
Shaisen, Colin.
Oh, it's
we go for the name.
Yeah, give him the full name.
Okay, Shaison Laupola.
All right.
Colin McKenzie, Sam Ferreira, Josh Ferreira, and myself.
Wow.
Yeah, it was just 5 of us.
So Team Ruthless, I remember.
Yeah.
I remember the name. I remember the name.
Of course, everybody did. We were in every single event.
Yeah, I remember that.
Yeah.
Okay, so now you guys started Team Ruthless, the 5 guys, the 5 amigos.
There you go. Yeah.
So you guys start doing stuff. You guys start winning because I remember you guys were winning a lot of the kickboxing events back then. You know, so how did you guys transform into like the whole MMA thing? Because later on, you guys started to do MMA. So how did that
That's
work?
cool. MMA just started getting really, really big. Icon and Rumble in the Rock and all that kind of stuff was happening, and the crowd base was really, really huge. And basically, the only events that we could fight on in kickboxing were I forgot what's his name show was before, but there was only like 2, Punishment Paradise and another like real amateur beginner show, feeder show, and we used to compete in those shows, and that was basically all we were limited to, you know. So we wanted to do more, you know, and basically one day we just came up with an idea of just try to learn MMA, jiu-jitsu, and all that type of stuff, and so we did a fundraiser. With the help of our Hanai auntie and uncle Billy Keanu and Wayne Annette Keanu, they helped us create a fundraiser. We sold Kahlua Pig for about 2 or 3 months. We raised about ate about $10,000 we made selling Kahlua Pig, okay? And then we funded ourselves to go to Oregon. We stayed in Oregon. We trained at OJJ in Oregon, Tualatin, Oregon, Tigard, Oregon, excuse me. And we stayed up there for 2 weeks, and we learned ground for the first time.
Wow.
Yeah, we learned ground for the first time.
You guys went all the way to Oregon to learn jiu-jitsu.
Yeah, the heart of Oregon, yeah. One of Randy Couture's old gyms.
Okay.
Yeah, so we went there. We trained up there for a while, and then we came back, and that's when there were the O Lounge fights.
Okay.
Yeah, there was the O Lounge fights. So we basically all had our first MMA fight at the O Lounge.
Wow.
So yeah, we all got submissions. yeah, and so everyone was expecting a striking bout, you know, and we took guys down. Well, we would strike with them, they'll take us down, they'll get submitted, and it was just, I don't know, we rode with it. It was awesome.
Okay.
Yeah.
So now, you know, you guys are doing that whole Team Ruthless thing, and then eventually you change into another team. So what was the name of that other team that you guys turned into?
Oh, we turned into God's Army.
God's Army. All right.
God's Army.
So now, you know, when God's Army comes up, this is about the same time as O Lounge?
Yep, same time. Yep.
Okay.
Around.
Who else did you guys? Because I mean, and at that time you guys had really you lost a couple of members. You bring on a whole bunch of members.
Actually, exactly. So basically, we lost guys and we brought on guys. So during Team Ruthless, we ended up expanding to, I couldn't even count. I maybe could say all the names, but let me see if I can name some of the few. So from that 5, we ended up expanding into, and adding guys like Sam Quell, Adam Florence, Curtis Jones, who else? It was cross-training with Team Ruthless, cross-training with SYD, with Jonathan there.
Okay,
so that's how we ended up all becoming a really good team.
Team Sit You
Team
Down.
Sit You Down. We ended up training, cross-training. They would come to our gym, and we'd go there, we'd do cross-training and stuff like that. And then we ended up, some of their guys ended up coming to our team. We had the Tavangas, Marvelous, Martin, and who else? Pete Purdy. Oh man, we could
I
go
heard you
for
mentioned
days.
earlier Jonathan Visconti.
Jonathan, he ended up coming over to us. Miller Wolesi.
Okay. So now, at this time, when you guys become God's Army, the thing that I remember about you guys is you guys stood out because one of the things that people knew about God's Army is that you guys were great strikers. The other thing that people started to find out real quickly about you guys is that God's Army, you guys were a bunch of entertainers. I remember, you know, when you guys come into the ring, especially if Jonathan Visconti was performing, you know, fighting, you know, he would play some great music, and that's what God's Army was really known for. Was you guys were the hip hop, you know, fight school, right? So to speak. And you guys, all had your own personalities. You know, I remember that. And back then, you know, I remember that you guys had this young guy that was coming up in the ranks that used to hang out with you guys as well.
Oh, he had all kind.
Oh, one of the
even
guys,
Max Holloway too.
Right, so
Yeah,
one of the
he
guys
trained with us
that went
too.
on to the UFC,
Yeah,
right?
yeah. He came with us. He ended up joining Team Ruthless maybe in about 2006, around there. He started with Team Ruthless, and then me and he was actually friends with our friend named Josh Keanu. He the one actually brought us all together. In fact, the person who brought everyone together was our friend named Sam Ferreira. That's he was the actual link to all the chains. He the one brought everyone together. This guy named Sam Ferreira, hilarious guy. Really sociable, likable person, funny, awesome guy. One of my best friends. He brought everyone together.
All right.
Yeah, so Josh would train with us, and then eventually Max seen us doing really well, so he wanted to join us. So he ended up trying to join. The team wasn't really okay with it yet. So, and the thing is, I actually went through that whole process too of trying to join the team, and it wasn't good enough. You know what I mean? So I actually felt his wanting to join the team. So eventually I was like, you know what, just give him a chance. You guys gave me a chance, and look what I did, you know? And so I kind of took him under the wing a little while and trained him myself for the first few months or so, you know, actually for the first few years. And you could actually look at my fighting style and look at his. We resemble each other. We're very aggressive, entertaining strikers, you know what I mean? We'll come forward, we'll not stop coming forward. We don't care who you are, we'll strike with you. You can be the best fighter, you know what I mean? I'm willing, you know? So basically he came in, I trained him for a little while, for a few years, and I actually stopped training to go to college. I was like, you know, I see all these other guys getting hurt, and then once they get hurt, they heal, they end up going to construction or something. I was like, that's not me, I can't be doing that. So I ended up going, pursuing my bachelor's degree in business management and marketing, and then, you know, while I was gone, my coach ended up taking him under his wing, you know? Like, it was crazy. The relationship that they had, it was really, really, really something. Like, it literally got me jealous, you know what I mean?
So your coach being...
Yeah, my coach being like him, Max Holloway, and Colin McKenzie were like, like father and son. Literally, they would call each other father and son. I swear, they would call each other father and son. There was like, this bond that they had it's unbelievable, you know? They had a really crazy bond, and yeah, I came back to the sport, and our team still was perspiring, you know, was still doing really good, really good, you know.
Yeah, well, like I said earlier, I mean, you know, one of the things I remember with God's Army is that, you know, you guys would get out there and compete. Everybody knew that you guys were great stand-up fighters, and everybody wanted to compete against you guys. You know, you guys had that bullseye on your back, you know. So now, like you said, you know, you stepped away from the sport. And, you know, that's one of the things that I like about you, John, is that you've always been a very... intelligent person. You know, you're more than a fighter. You know what I mean? And I've seen that early on in you, that you always had a different way of thinking or looking at things. You know, so you went on to college, you know, you took some business classes, you know, and then later on you came back into the sport. You started fighting as a pro MMA fighter at that time.
Pro MMA fighter, yeah.
And so kind of what I wanted to touch on too with you is that, you know, so, you know, during this whole time, you know, you've always been with that team, you know, your teammates have gone on and had great success. Like we talked about Max Holloway, and we all know what happened to Max and what he's doing now. But I mean, I remember some of your other guys, you know, going out and getting onto like the Ultimate Fighter. So like we talked about earlier with Jonathan Vistante. And one of the things I wanted to kind of ask about and talk about is that I remember actually hearing about when you and Jonathan went up to try out for the Ultimate Fighter, that you had this mitt routine that you guys kind of set up.
I think I could honestly say, you know, most people may beg to differ, but me and Jonathan, oh man, we're like the dynamic duo for a moment in time, you know, in the MMA industry. I took Jonathan not under my wing, but his father allowed me to train him, which was kind of rare. But he allowed me to train Jonathan, and with the help of my old boxing coach, my older boxing coach, Janito Tangarao Pelin, me and him trained each other. We trained each other for a little while, maybe for a few months at my uncle's ranch in Nanakuli. Trained each other, taught each other how to hold mitts for each other, and learned different styles of techniques and all this kind of stuff as far as striking mitts. And then we ended up starting a team called UKA, Untamed Kickboxing Alliance. And then Jonathan came over. We had a lot of really good talent come to this ranch. Like, we had really good athletes, really good, like Boston Solomon, he came down there. He used to train with us. Jonathan, Ben, Miller, Aaron, Cole, Ramel, we had all kind of guys. And they would train here, and I took Jonathan. We started doing all kinds of marketing behind us, video. We did a lot of media. We put a lot of media of us training and stuff like that. And then we did a fundraiser again. Same family. Annette Keanu, them helped us do a fundraiser. We fundraised to go to Las Vegas to try out. I was his mitt man. We went to the tryouts and actually met a few people, such as like Mike Rio. I actually held mitts for Mike Rio to get in the house. He never knew how to strike, and I held mitts for him. He actually, I think he was second place in that actual season. And yeah, I held mitts for Jonathan. He just blew the judges away. Like, he was really, really, really good. I held mitts for, I had mitts for even Zane Kamak up there, you know, and I think a few other guys, but yeah, so most of them went past that part, you know, even once they got the striking, they went past that. It was all up to their interviewing skills, you know, the ability to talk, you know, and I guess maybe most of the locals, that's where they actually fell, but Jonathan didn't. You know, he was really good at that. You know, Jonathan, he had the gift of gabber.
Well, hopefully we can get him on the show, and you guys can see for yourself how good of a talker that guy is.
Or Ben, whatever.
Or Ben Santiago, right? Yeah. Well, and you know, back to what I said earlier about God's Army. You know, these guys, they are. Not even word, they are entertainers. You know, you get these guys in front of a crowd and they would do their thing, you know, whether it's fighting or talking or whatnot, you know, and it's awesome. So, you know, so besides, you know, all of that, you know, with the Ultimate Fighter and whatnot and the experience that you guys had, you actually went up and you trained with AKA up in California. So tell us a little bit about that.
I did, actually, I cannot express how important this part of my life was, because I actually met this man named Wally Carvalho. He actually took me under his wing, treated me like his own son, and did everything for me. He took me all over the place, taught me the MMA industry like most fighters cannot even comprehend, you know what I mean? So he took me all over. I traveled with him, and he introduced me to his network, such as Javier Menendez, and I sparred and trained with the likes of, Brett Rogers was one of the guys that I trained with, Paul Buenotello, John Finch, Mike Quickswick, Josh Koscheck, Josh Thompson, Cain Velasquez, Luke Rockhold, Misha Tate, all in one outing. It's crazy. I met Fabricio Verdum. I met Cesar Gracie. I was invited to train with them. I met Master Toddy, what's his name? Uriah Faber's striking coach. They was inviting me to train at their gym because me and Koscheck had a really good war. We were sparring, and me and him was going back and forth. Me and Josh Thompson was throwing gloves. We was putting it down at AKA, and so everyone heard about that. It went around like wildfire, and everyone was inviting me. Hey, come here, come to my gym. I'll pay you. Blah blah blah. Wow. You know, and it was crazy. Thanks to Wally, he taught me a lot of stuff, took me a lot of places, and yeah, he did a lot of stuff for me, that guy.
All right, so you know, we're actually getting close to the end of this interview, but we definitely will get you on, and we got to talk more story about all of that stuff. But you know, as far as like, you know, your closing remarks, you know, you've done a lot of great stuff in the sport. For a young person out there that is aspiring to become an MMA fighter, you know, what kind of words of wisdom would you have for somebody like that out there?
My word of wisdom would be, if you trying to enter this sport, before you're ready to enter the sport, you got to know that you're an individual fighting. This is a sport, man versus man. This is not about politics, all that kind of stuff. You got to keep that on the side. You're not no one yet, so just come in that game and give them your best. Do not negotiate who you're fighting. Just fight. You know what I mean? Just put your heart out there and just compete. I see a lot of fighters nowadays, they don't have that anymore. They're negotiating fights, they're negotiating pay, negotiating when. You're not in the UFC, you're not a champion yet, so don't do that. just go out there, put in work, and
Let your work,
that.
right, let your work speak for itself. Exactly. Yeah. All right, man. Hey, so thank you so much for coming out and talking with us.
Yeah.
And like I said, guys, we're gonna have him on again, and we're gonna talk more story. But John Bernard, thank you so much for coming out, my man.
All right. Thank you. Thank you for having me.
All right, and we'll be seeing you guys on the next one. Aloha.
All right, man.
From the mountain to the ocean, from my windward to the leeward side.
Last time on Sleepless Movies Hit.
I want you to know that I want to do what I can, that I feel your pain sympathetically, because I've never had BD.
Well, then maybe you should have found a fucking cure.
There's no need to be snippy.
Snippy, you're lucky I don't cut off your fucking non-healing hands and throw you out the goddamn window.
All right.
Oh, but you must watch out for this card. It's your enemy. It's a sleeper card.
And paying for your penicillin shot with money from my pension plan. And by God, I will do it.
Smims, it's me.
Okay, and finally, a small allowance, if you will, that is summarized on pages 27 through 31.
I think our offer is more than equitable.
These graphics are awesome.
Your offer doesn't even begin to cover all the years of neglect.
No, not that.
Emotional abuse.
No, not even. Mental cruelty? Definitely not that.
Can you show me how to make this one?
Oh, yeah, that's nice. Yeah, I have the manual for that software right here.
Oh,
dude. And I've got a copy for a good price.
Okay.
I'll take that, actually.
There you go.
I'll have it on.
Thank you very much.
I got lunch today.
Oh, can we go to that new Krothotopian place?
Sure. Yigtabros?
Yeah, that's it.
Whoa.
Good.
We have a reservation there right after we're done with them. You want to join us?
Emotional damages.
If you frat boys could curb your software piracy for just a second and refer to your notes, you'd see we're here to get this bloodsucker out of my boss's life once and for all.
Bloodsucker? That's high praise, coming from a trophy whore dyke.
I wear this suit for respect.
Oh, really? I thought you wore it to cover up your strap-on penis.
What the hell, you wannabe bastard? Wannabe prom bitch. Get out of my face. Get out of my face.
Hey, please. I think we were talking about emotional damage.
Yes. Emotional damages that she sustained when you're climbing back to college for his business degree. Oh, the very same degree that allowed Miss Sear here, over there, to live the lap of luxury for so many years.
It wasn't always like that.
Ma'am, let us handle that. We're the professionals.
Yeah, that's right. But wasn't your client also pursuing her degree?
Yeah, I was.
But I see in the notes that you actually didn't finish the last semester.
It says you withdrew.
Yeah, I did. That's when my son's candy business really took off.
Hey, Skosh! Hey, Skosh! Munchies! Munchies! Hey, Skoshy! Oh, Munchie! Hey, man! Oh, yeah! Oh, yeah! Thanks, Skoshy! Yeah! Dude, you rule! Thank you! Hey, Skosh! Uncle Fuzz! Uncle Fuzz, man! Munchie! Yeah! Oh, magic job going! Yeah! Wow!
Oh, I see. Stock got his degree and you didn't. So you want some kind of revenge alimony for the stupid choices you made?
Taking care of my son was not a stupid choice.
Then why are you requesting custody be given to Stock instead of you?
Yeah. He wants to be with his father.
It's more than just that. Ever since his adoption, for as long as I can remember, Skosh wanted to please his father.
Get your fresh sea produce here. Yes, very fresh. Straight out of the ocean. They're white fresh, very fresh.
Yeah.
Good evening, well, what have we got here? My partner and I were thinking we can be partners. Because I specialize in the hot, spicy stuff.
Yes, and I specialize in the pumpkified flavored things. My favorite being the pumpkin tartar sauce. With your fresh produce and our specialty sauces, we could have a great joint business venture. What do you say?
What do you say?
Well,
see, what we catch, we catch. And what we catch, we sell.
Yeah.
Is that so?
That's too bad.
May I?
Sure.
And you call this fresh?
Very fresh.
Not anymore.
Like freshly covered in dirt. So what are you gonna do about it?
Well, we're gonna go call the bronze.
Yeah.
Well, if you call the bronze, you will never find out what happened to your friend Leon.
Yeah. Leon?
Right.
Oh,
Yes, that's right. I believe he's enjoying a nice brown golden tan right now. Several days now. Wouldn't you say? Possibly more.
Yeah, Leon has been gone for a few days.
That's right.
Them's fighting words.
Let's be cool about it, chump. Why should we believe you?
You want proof?
Let's show them.
Pumpkin fly.
And Mapo Chipotle. Aprons on.
It's cooking time. Hot pan. Cold oil.
Let's show them.
You wait here and hold the umbrella, okay?
Oh, this is too heavy. I only can use one.
Oh, and I can take the other.
Okay, let's go. Ready? 1, 2, 3, go!
Tartar sauce.
Look, it's Leon.
Thank you, Major Chef.
Wild whipping is good, Leon.
Till next time.
For you. And this is my reward? I'm not gonna do it. Yeah.
Oh, yeah. All right, doors open. I could borrow for the night. I'll make it up to Sunday. Go.
Yeah, I've got some. No card number. Oh, another one. Yeah, you got everything you need. Right
Thanks, man. After spending time in college, I began to realize how little Stock and I had in common. About that time, Stock was finishing up his degree. From there, it was straight into the workforce. Little Skosh had to learn to be a man all by himself. Excuse me, they're here.
Oh, yes! Yes!
Oh,
I'm
so glad you got
here.
Oh, my
God.
Getting crazy over here.
Oh,
Have a seat, please. I was going through some of my junk and I found these. Here, these are for you.
Oh man, who are those people?
I don't know. They sure look happy.
Well, I know that guy's happy.
Yeah? How?
Well, he's I don't know, he's got the whole everything laid out in front of him. He's with his wife, the most beautiful girl in the world.
Yeah? What about this one? Hey, you wanna? Just one last time?
How does a guy like that get hooked up with such a monster?
Well, that's what happens when you leave your area.
Maybe it was an arranged marriage. It ain't like that.
What's she talking about, Squire?
She's posing.
What'd you say? She's fronting her.
How do you know?
Well, tell me you didn't notice the way they looked at each other when you came into the room.
Maybe you're right.
Oh, you still know what I like.
Yeah, I do. My soon-to-be ex-husband. But the question you should be asking yourself right now is, what is Sear like?
No, what the hell is that now?
It's my insurance policy. You will take care of our son, with or without that rabid cheetah bitch you've been banging.
Nah. Yeah. Oh, shit. What the hell makes you think that's gonna stop me? Fucking bitch.
Severe shock trauma to your groin. Maybe. Come on, Daddy. Grab up my fragile clothes. See if you can get the tape. It's right here under my bra strap. See if you can get it before I splatter that useless sack of yours. Come on, Daddy. Gonna teach the bad ex a lesson? Or is it the other way around? Well, Daddy, you disappoint me again. Guess that skank you got in the other room really has you whipped.
And as aforementioned, to the new beneficiary of the new life insurance policy, this message will be sent airtight, digitized, signed, sealed, delivered, 100% encrypted over to the new beneficiary of such. Ladies and gentlemen, By the power vested in us by the Pacific Realm,
I now pronounce you divorced. Amen.
Hey, boys, how do I make this chart again?
You be good. If your father isn't giving you what you need, then you call me.
Dad and I will be fine. You have a good time back at school.
This time I will.
If you ever hurt our boy the way that you hurt me, I'll kill you and your whore.
Such a wit on that man. You better keep an eye on him. He's always making the girls laugh. Bye.
Hey, nice to see you again. Can you say sorry? We'll call you. We'll change that beneficiary thing, got that all straightened out. All right.
Yeah, no, I'm sorry. You know, all the divorce. Come on, son, let's go get the car. We'll go shopping. We don't have to deal with divorce lawyers.
I'm gonna hold you to that.
What, the shopping? Well, yeah, I know how much you love the shopping.
Hey, tell me why you love me.
Because you're beautiful.
I know that.
Watch this, son. Because you complete me.
Don't you forget it.
Yeah. Yeah, I knew that'd work. Let's get the car, yeah?
Miss Luna, these are some old home movies I transferred. I thought you might be interested in how we used to do things back in the Stone Age.
Thank you, that was awful nice of you. And I just want to let you know something. You know what happened back there?
Yeah?
You know, it was purely business.
Oh, I know that. Listen, get through that tape, and you will be the perfect wife and mother. I mean executive assistant.
Thanks. I'm going to study this like the Bible.
God bless you. Piso Mahalo.
Where's the goddamn car?
Welcome. I'm Madam Pyrite.
And Captain Hammurabi.
Yeah, Corporal Bouchon. Lieutenant Upweek of the Mayor Special Task Force.
Of course you are. How may I help you?
We are looking for a specialist in psychological services.
Yeah, she's about this high, and she's shaped a little bit like this, except more peach. And, you know, her hair looks like some kind of a toothpaste caught in a coral reef or something weird like that. I've never seen it.
I don't think we can spare her.
Really?
Ma'am, we're on orders from my client.
Your client is the mayor now.
Orders from the mayor because of the killing of his daughter.
His niece.
His niece. Expedia.
Epidermis.
Hepatitis.
Enema.
Expedita.
Working with the mayor's always been a bad situation. And that's why it's always so bad.
Yeah.
I could help you. I'm in charge of all this.
Hey, yeah, right on. I agree with that.
No.
Oh, come on, man. This is Madame Pyrite. Don't forget she got my grandmama's full name, right? Ethel Cottonmouth Bouchon. You know, only like about...
No!
And
turkeys. Well, you know, they don't agree with me. However, we do need Tiara because she wrote that dissertation, you know, about the criminal elements in and around Sleesville. Sleesville, yeah.
You know, Beauchamp, we don't need anybody else. We can get the word on the streets ourselves.
Yeah! No!
Right. Of course I care, you know?
Tia, you have some visitors.
I gotta go. Excuse me?
Hello. May I help you?
Liza, there you are. Oh, got some mail for you. Hello. Listen to this one. I have dreaded the day that the disease would overtake my little girl.
My little girl. I have seen it ravage both my wife and her mother, Expedita's grandmother. Though it saddens me that I was not able to be with her at the end, it gives me great comfort knowing that she passed in a manner that she saw fitting. No one deserves to die the way her mother did. I am sure there was no God in heaven after she was taken.
And I'm now being told it's time for the interview segment. Miss Crothatopia, step forward, if you would. Yes. I think we all know that the winner will be Connie Kingston Fish. It's plainer than day. Let's check anyway, shall we? Oh my God! The winner and Miss Soft Shell Crab for the next year, Medusa Kabul. There she goes. Pinching her clothes. There she goes. Scurrying her way through the side of the beach. Miss
I know that I am not allowed to know who you are, but I wanted you to know that you, sir or madame, are in my prayers. I still don't know if I have much faith in God anymore, but I do believe in angels.
Even angels. Oh, that's so sad and so sweet. A lot of people believe in what you've done. Mixing pine and orange oil? No, Sunita. What? Did you just call me? There's a rarely spoken tale about a horrible creature that could take your pain and suffering away. The townspeople were so afraid of it that they pooled their resources and killed it. Townspeople? Are you telling me that I'm the monster that the townspeople want to get rid of? In so many words, yes. But I'm so clean. Well, that's true, but there is one other difference. What? The monster didn't have a bodyguard, and you do. Oh, you must be referring to my bacteriostatic jacket. Don't be embarrassed. I saw you eyeing it up. No, hygiene can be very masculine. Cleanliness is next to godliness. Well, and that's why your bodyguard is me. See that? That's for you. Oh, I don't know if I want a gun. No, it's not for me to give to you, son. It's for me to protect you from the angry townspeople. What did I do again? You're the monster. But I'm so... Right, you're too clean. Oh, I didn't do anything wrong. The townspeople are afraid of your gift. They struggle their whole lives to let things go. Guilt, stress, whatever. And yet somehow, when they speak with you, it all seems to lift away. But that's good, right? Good or not, they just don't get it. Most of them, not all, are afraid of what they don't understand and want to get rid of it. That's where I come in. But you're already here. What I mean is that I'll protect you from the townspeople that want to get rid of you. Why aren't you afraid of my gift? Because I and the rest of our club have taken an oath to protect anyone who help people use their freedom of choice. And that's you, Sin-Eater. Foreman, front and center. Come and meet Sin-Eater. Hello.
I saw what you did the other day and I thought it was great.
Oh, thanks, but Expedito really did all the work.
I picked up the poison before we all left.
Be careful with that.
Why? Is it so deadly and toxic?
It'll stain if it gets onto natural fibers like cotton.
But this breed's so much better than that ripstop polyester blend that we're supposed to wear.
What's that, soldier? Did you receive the directive on the many uses of microfiber garments? Yes, sir. Then can you tell me why you are harassing our beloved Sin-Eater with complaints about your uniform?
Yes, sir. I thought that after a few words with Mr. Eater, I would have enough courage to make the final leap into oblivion, sir.
You bastard! Drop and give me 5. Yeah, come on there, boy. I can see it's too much work for you. It's just a toy. Can't you see? It's not the real thing. Yeah, dying of old age ain't so bad. Yeah, it's the perfect way for cowards like you. Yeah, every night at home, all alone, just sitting, waiting for your heart to give out. Yeah, nobody just put it down and get the hell off of my field right now.
Hey, it looks like you do that pretty well.
It's not good enough.
Oh. You know, I'm just a novice at all of this, but I think you do that pretty well, I must say.
I'm worthless and weak. It wasn't always like this.
What is your problem? What's your problem?
Hey, come on, come on.
Come on, let's be a man. Let's be a man. Let's get to him. Okay?
Fight.
Coach!
Bring them up! Bring them over here! Oh, what's going on here, boy? Oh, boy, man. Don't be such a homo. We all know your mama's a hoe.
Yeah. But he had a knife.
Is this yours?
Yeah.
Oh, let me show you how to sharpen it sometime. Okay.
That's so funny.
What's going on here?
they were, it's, you know,
Oh, enough. You're going to detention.